Teresa or Kevin, did Ian send his regrets then for Board of Health? Yeah.
Councillor, through the mayor, Councillor Rabbits is going to be late.
Okay, perfect, thank you. Okay, so it's 2 o'clock. I think we are ready to begin. So good afternoon, everyone. I would like to remind you that our meetings are web streamed and televised, and ask that you please ensure that your phones are on silent mode. To always keep your camera on, and of course mute yourself when you are not speaking. Councillor Rabbits, as my understanding, he will be joining us shortly, and I know Councillor Huffman, you've indicated that you will have to leave a little before the end of the meeting, so we understand that. And with that, I will call to order the Board of Health, and of course, Council will proceed after the 2 o'clock meeting. Council will begin at 3 p.m. So first, if I could have a motion to approve the agenda. Councillor Taylor, seconded by Councillor Huffman. All those in favor? And that is carried. Any declarations of pecuniary interest? Okay, seeing none, we'll first begin with a presentation. Welcome, Dr. Huckowicz. Thanks for joining us today, sir, and I will turn it over to you.
Thank you, Mayor Chop. I had a very productive meeting this morning with the chair and vice chair of the Agricultural Advisory Committee. Thank you to Mr. Columbus for linking me up with the chair of that committee, and we discussed a number of issues, some of them that I'll come to later, because they made a number of I think quite reasonable and good recommendations that I think need to be followed up on. One, I guess before we get into all of the stuff about COVID and farms, I'd just like to indicate that, you know, in this public health world there are other problems. And of course, one of the things that we've seen an increased rate of chlamydia, which is a sexually transmitted disease. We have no particular explanation for that. I think we're looking at that in terms of why that might be. It's an easily treated condition if it's diagnosed, but of course that requires testing and whatever. So we're still in the process of trying to determine why there's been that kind of increase. If I get to COVID, one thing I think you've all heard from our vaccine coordinator about our increasing rate of immunization. I think we did 10,000 doses this past week, and that's a terribly good thing. We're starting to get involved in providing second doses to people, which will significantly minimize their risk. It won't put it to zero, unfortunately. No vaccine is 100%. And although there's some conflicting information currently, I believe, in terms of the efficacy of vaccines relating to some of these new variants of concern, I saw one piece of information this morning that said that Pfizer vaccine still had a 96% efficacy after full immunization, which of course kicks in at kind of 2 weeks after the second dose, against this Delta strain, which is the strain from India. So that's good news if that holds up, because that will be a continuing concern if there is lesser efficacy of these vaccines. I've done I guess, a very detailed analysis of the outbreaks that we've had this year on farms. We've had a total of 32. One just came in, I guess, within a day or two. So I'm going to concentrate on the 31 that that I have more information about, that have happened since January of this year. To a question I think that was addressed last time I spoke to the board, we do not declare an outbreak if someone tests positive while they're in isolation at a hotel off the farm. We've had 7 of those as well, but that's not included in the 31 outbreaks. We only declare an outbreak on a farm if, in fact, there's someone positive at the farm. And so the people who test positive while they're in quarantine off the farm are not considered as part of a farm outbreak. Of the 31 outbreaks that we've had since January of this year, 11 of them involved people who tested positive at the airport. So these are individuals who were supposed to have a positive test before they got on the plane. Unfortunately, what I've learned is sometimes those testing processes in the countries that they come from are less than ideal, meaning they crowd a whole bunch of people together while swabs are being collected from them. I'm told sometimes people are rather rough when they collect the swabs, making it quite uncomfortable for people. And so they're supposed to have this negative test within 3 days of getting on the plane. But of course, the period of communicability is, in fact, it's in that kind of, let's say, 2 to 4 day period. So the potential exists that the swab that was collected within 3 days of them getting on the plane was negative, but in fact, they became infected while they were in the process of getting the swab collected. And so 11 of the outbreaks that we've had relating to farms, the person tested positive at the airport. And of course, the difficulty with that from our perspective is that since the federal government exempted these farm workers from having to quarantine at the airport as they have required for other returning travelers into the country, by the time we find out that they're positive, they could be on the farm or they could be in isolation at a hotel. If they're on the farm, then since we allow 3 people to a bunkhouse, now we immediately have 2 contacts. And before the requirement for I guess the instruction that was put in about travel in March of this year, before that, and you had large numbers of people on buses going to a variety of different farms, those initial outbreaks resulted in a very, very high number of contacts who then had to be followed up. Then we have the problem of we had 16 of the outbreaks. So about half of the outbreaks, or a little over half of the outbreaks, were people who tested positive either on the day 8 or day 10. It's the second test that they're supposed to take. before they come out of quarantine. And so that becomes a problem as well, because of course, then all of the people that they've been in contact with, if they've been in quarantine on a farm, within a group of 3, then immediately you've got 2 other contacts. Depending on their travel arrangements or coming, then you have multiple other contacts. The remaining 4 outbreaks essentially occurred after the quarantine period was over. And of course, you will recall that last year, this area unfortunately had one of the first and one of the largest outbreaks. And it occurred after the quarantine period was over. And so that creates a whole other set of problems, because of course, after the quarantine period is over, there are really no restrictions on people. And that can be, you have a whole bunch of people in larger groups, and you then run the risk, the very real risk of many people being infected and becoming sick and having to be hospitalized, perhaps. There is, I would suggest to you, a very easy answer to that portion of it. And the answer to that portion of it is immunization. Although you don't get full immunity following the first dose, certainly kind of within 2 weeks after the first dose, you have a reasonable level of immunity. Our statistics in terms of our more recent cases, I think, relate to about 80%, an 80% reduction in risk of becoming infected after the first dose, and then a 90% after the second dose. And so, as I discussed with people from the advisory committee, I strongly encouraged steps that would ensure that people were immunized very, very early on, either at the airport, which is currently provided, or if not at the airport, then certainly within the first few days of their quarantine, to ensure that by the end of the quarantine at 14 days, that they have some reasonable level of immunity, because that would go, I believe, a long way to preventing these outbreaks that come after the quarantine period. And as I say, last year, one of the early ones and one of the largest outbreaks we had was in fact after the quarantine period. And this year, I guess 4 of our outbreaks occurred kind of after the quarantine period. Now, I wanted to indicate, well, I guess my analysis of what occurred before and after the instruction that was provided. And again, I in my discussions with the lawyers, it was pointed out to me that that was not a Section 22 order. It was an instruction, and under various regulations under this Reopening Ontario Act and the Emergency Act, those instructions have the force of law, but it was an instruction and not a Section 22 order. So before that instruction went into place, we had 8 outbreaks, 12 cases, and 55 contacts. And that was for a group of about 259 workers that we then had in the area, because we didn't have a very large number of workers in the area at that point, because it was early in the year. So these would have been January, February, and the beginning part of March. So the total number of cases and contacts out of the total number of workers that were here, it represented 25% of the workers, 25.8% of the workers. After the instruction went into effect, which limited the number of people per vehicle, so you no longer had larger buses that were transporting a larger number of people to multiple farms. And I think I may have mentioned at some point last time about this is a similar problem for schools in terms of children on buses, or maybe more than one bus, and because as soon as one is positive, then all of the others are considered close contacts and whatever. So after the instruction went into place, we had 23 outbreaks. that involved 36 cases and 47 contacts. Now that, I guess in some sense, seems larger, but by that time, we had over 2,500 workers present. So that represented 3.2% of the workers. So my analysis would say that that instruction, and people may want to take differing views of the whole thing, but currently my analysis is at the point of simply saying that that instruction went a long way to reducing the number of cases and contacts that we had in our area. And if we had continued at the same rate after as we had before, in other words, 25%, we would have ended up with about 300 more cases, probably I would estimate somewhere in the range of 3 to 4 extra deaths because of that. So I think that instruction, although people don't like it, currently, I think it was a reasonable step to put into place. It certainly avoided these large number of contacts. As an example, some of these early cases, we'd have a single case, but then we'd have 13 contacts, 17 contacts, 15 contacts, so forth. After that instruction went into place, we'd have a single case, then we'd have 0 contacts, 0 close contacts, 1, 2, 0, 2, 0. So I think it went a long way. But the one missing piece that I don't have yet is, and I've been trying to get it for a couple of weeks, I've made various efforts, and the one missing piece I don't have yet is I don't know what the circumstances are to compare with the other health unit areas who did not do the same thing in terms of their instruction. I asked OMAFRA for it at a meeting I had with them a couple of weeks ago. I asked the Ministry of Health at that same meeting. I put out an email to my colleagues asking them to provide me information about their outbreaks on farms and their case and contact. I don't have any of that yet. And so I do have a missing piece, but that's where I stand with that analysis of our current outbreaks. Some of the things that I've been looking at as possible changes and discussed, in fact, with the chair and the vice chair of the advisory committee. One is the issue of this not allowing people out, if they're quarantining at a hotel, not allowing them out of the room. And I know that that's been a concern and an issue. And the difficulty I'm told is that one is some of the hotels don't want them out of the rooms. And the other one is in terms of how are they going to be supervised during that time if they are. So I am looking at that because I guess I would be prepared to allow people out for some brief period during their quarantine on a daily basis, provided that the hotel that they were being quarantined in had no issues, because the last thing we want to do is have these places decide they don't want people there for their quarantine or isolation, and provided that they are supervised in some way by what I would call, I guess under the Occupational Health and Safety Act, they talk about a competent person. And so if those issues can somehow be resolved, that I certainly am prepared to look at making a change in that kind of a requirement. The other issue that I'm currently looking into, and I'll need more information, it's about these quick tests. The quick tests give you an answer within 15 minutes. The answer is not as good as kind of the final test, but if they're reasonably accurate, and if we decide, and if I take a default view that if it comes back positive, then I will assume and deal with it as if it's positive until I have a repeat test that says that it's not. Then I guess I would give consideration to allowing a larger number of people being transported to a farm. Not a huge number, but some larger than 3. provided that they were tested at the airport before they entered the vehicle and were negative on that quick test. Because I think that might eliminate a whole bunch of these tests where we, like I told you before, 10 of those or 11 of those 31 outbreaks were people that tested positive at the airport, but they were already here. And they had already had contact with other people, and then we had to deal with that. So I will be looking further into the validity of these quick tests and seeing whether there is some way of altering this limitation to 3. But I need to look further into that and to make a decision. And clearly, the other thing is that whoever the driver is would have to be fully immunized, which means 2 weeks past the second dose of vaccine. The people from the advisory committee seem to be quite open to that kind of a change. So I will be looking into that further. I don't know, people may be aware that we've currently had this rule of, I guess someone's called it a 30-day rule, although I guess more accurately it's a 14-day or a 28-day rule, where people who have been quarantined off-site in some other area, before they're allowed to come into this area, they had to be quarantined for another 14 days. And again, I think there may be a way out of that. I mean, the issue is trying to avoid people who, they've been quarantined, but maybe they somehow being quarantined in larger numbers, not necessarily one per room or so forth, that they became infected later in the isolation period and then were positive on entry into our area. And I guess one of the ways around that is some kind of testing. I'm not sure why the feds decided that the testing should be at day 8 and day 10. Because clearly and if you're going to be quarantined for 14 days and you're tested at day 8, depending on what the quarantine circumstances are, you could be infected following that test. So the test would come, the test from day 8 would come back negative, but you're positive, you're infectious, and you come and you infect a whole bunch of other people in the process. So I am in the process of looking at to see whether some other kind of testing routine, maybe later in that isolation period, could prevent the need for a further kind of 14-day quarantine period. What else do I have here? The people from the advisory committee made a suggestion, which I think is a very good one, and they were wondering whether the board would be in favor of writing to the feds in particular. Canada has promised to provide vaccine to a whole bunch of other countries, I guess, and they raised the issue about why not provide vaccines to the countries that we are accepting foreign workers from, because clearly if these people were immunized, if they were immunized 2 weeks before they came on a plane, it might solve a whole bunch of our problems here in terms of outbreaks and whatever. And so they were wondering, and I'd like to propose to the board that a letter go to the Prime Minister, the Minister of Agriculture, Minister of Health, encouraging them to provide vaccines to countries that we accept foreign workers from. I thought that was an excellent suggestion. The chair and the vice chair of the advisory committee had brought that up, and I think that's a great idea. And if the board would be in favor of that, then I would certainly strongly encourage that, because I think in the end, immunization of these populations would be exceedingly important. I mean, this is a highly vulnerable population for a variety of reasons. I think I may have mentioned they make up about 4% of our population. They made up about 10% of our cases. So they are a more vulnerable population, and I think immunization would go a long way. And we are not only encouraging it, but one of the farm workers there, he'd received his second dose and was fine, and I was encouraging him to tell all of his friends and to show them that he hadn't grown a second head and a third foot in order to encourage his friends to be immunized as well. We are offering a number of clinics. Staff have asked me whether they can contact some of the larger farms to make arrangements for providing vaccines so that these workers can be immunized. And they are a vulnerable population, as I say, for a variety of reasons, including the fact that they do have congregate living situations. And that would go a long way, I believe, to preventing these outbreaks that happen kind of after the quarantine period. Let's see, what else did I have here? One other thing not relating to the farms, but relating again to quarantine, because it's been brought up to me that the current I guess our current directive about churches and religious services indicate that there can be no singing. Anyway, I'm looking into changing that in terms of discouraging singing. They still would require masks. I'm also looking at changing the website, because currently the website talks about, I think it talks about, infection control or hygiene, whatever. And I think that website needs to be changed to deal with COVID control, because I think that on that website we should be also indicating that congregations should be strongly encouraged, and the leaders of congregations should be strongly encouraging their congregation, in fact, to be immunized. So I think that's it. As I say, the difficulty I'm having is collecting some additional information that would, I guess, let me come to, some conclusions about some of these issues. But I guess that's where I stand right now.
Thank you, Dr. Huckowich. Councillor Martin, I saw your hand was first to go. Go ahead.
Thank you, Board Chair Chop. Through you to Dr. Huckowich, firstly, I'd like to thank you for bringing to our attention the request of the letter and collecting and soliciting some input from the Board of Health, as opposed to just firing one off. That's a welcomed change, so thank you for that discussion. I wanted to comment on the fresh air concerning the hotels and staff and whatnot. To your comments, I guess my position, I speak for myself here, but my position would be that that our health unit isn't hindering anyone from receiving fresh air while they're in quarantine. If the hotel wants to take on that, human rights violation from my perspective, then that's on them. But I think the farmers are more than keen to have someone and have had someone on staff to facilitate with that. So it would be very welcome news to revisit that and have fresh air to be permitted. My two questions for you would be, when you revisit the transportation methods and you look at potentially upping the size of individuals, will you be giving consideration to the size of the vehicle and therefore the space permitted inside the vehicle and how many people could travel inside said vehicle, or will you be looking to set a hard and fast number, period? As an example, if I show up in a school bus, am I still only eligible to take 4 people back? Or
Well, I guess I would prefer that people don't show up in school buses. I guess. I mean, the honest answer is I still think that having a large number of people going to different sites is not a good idea. But anyway, so that's the way I would lean. I need to get more information from the other places as to how they've managed, what they've done, and with what outcome. And that's the missing thing that I don't have. I've tried, but I don't have that. I've got all of the Section 22 orders, and I've reviewed those in detail. And I must admit that the difficulty with most of these orders is that they really, they basically say to farmers, you're responsible for following the rules. You look them up. You decide what following the rules means. And by the way, there's a 750,000. And again, these are federal rules, generally, provincial rules. not local rules as much. So it's you follow the rules, and if you don't and there's a problem, then you may be subject to a fine, and we're not going to lay it out any more clearly to you. That's my view of a lot of these other orders. I think the order that was issued here in terms of limiting to 3, people may not have liked it, but at least it was clear. And I've spent the last 3 weeks reading through all of this stuff. It's a pile, I don't know, 2 feet high. And I don't know that even lawyers fully understand what's it. It's confusing. It's a mess. You have these documents that they start out and then they refer you to another document, which refers you to another document, to another. I don't know how the farmers could cope with all of that. And so I don't know that they could really understand what, in fact, the rules were that they had to abide by. But regardless, I'm trying to get more data. I guess what it would take, I often have discussions with people that don't agree with me, and I often talk to people. I say, what would it take for you to change your mind? And when they say nothing, at that point, there's no point discussing it. I can tell you what it would take for me to change my mind on this. And what it would take is data from the other health units that have foreign workers that do things differently, and data that shows that they had no problem. If I can get that kind of data, then I would change my mind. But currently, I don't have that data, and I have no reason to change my mind. The data I have indicates that I think there was value in limiting the number of people being transported, particularly since, like I say, in 11 of those 31 outbreaks, they were positive at the airport. And and at the beginning, they were in larger groups, and it meant we had larger groups to try and deal with. After the instruction went out, they were in smaller groups. We had smaller groups to deal with. So I need to get the data from other places before I would be prepared to change my mind to kind of open it up completely. But I think it would be a bad idea to have large school buses carrying people to multiple farms.
If I could jump in, Dr. Huckowicz, I think one of the compromises from what I heard that the farmers were willing was that it wasn't a bus they were looking to load up like it has happened in years past where you had, the bus stopping at multiple different farms. I think the compromise was that it was a bus to a farm. So, my understanding from speaking with members of the Ag Advisory Board, that was sort of a compromise that they were willing to take.
Yep.
They understood the need of not separating them around, but at least have one bus to one farm.
Yeah. Anyway,
Councilor Martin, go ahead.
I'm prepared to look at that, but again, I would think that what we would want is we would want quick testing. We would want to know, to the degree that it's accurate, we would want to know that the people getting on that bus were in fact not positive.
Okay, thank you. Through you, Chair Chop, to Dr. Huckowicz. All of that leads me into my second question. Is there something the Board of Health can do to support you in your quest for additional information? Is there something the board chair can do with other Board of Health chairs? That we can send letters, correspondence?
I can't see that. I've got these things out. Maybe it's just going to take them a bit longer to provide the information. I don't know. So at this point, no. I'll try and do this. Continue to get this information.
Okay. No further questions. Thank you.
Councilor Van Rishi, go ahead.
Yes, thank you. Thank you, Madam Chair. And through you to Dr. Huckowicz, I have a couple of questions. I absolutely agree that letters should be sent to the federal government in support of immunization in the country of origin coming to Canada. And maybe asking a letter of support from the provincial government to support us going to the federal government to get such permission. Likewise, sending a letter maybe to the farms organization, indicating to them that then in their next negotiations with the countries that we do get our foreign workers from, that some sort of policy could be set that should occur. It's very difficult, I can understand. I've been speaking with some people from Trinidad, and they're saying they haven't got hardly any vaccine in at all, so it's very difficult. So I think the onus would be on other countries to make sure they have some vaccine to be able to get to them. But I totally agree. And the second question, that's a comment. My second question is, I don't know why you're having such difficulty with the neighboring counties on how we can better get the numbers so that we can fully understand how we can transport the workers better down here, because 3 is limiting, and I know I'm just speaking again, same as the others, but anyway, I do like to support the actual letters going to the federal government, provincial government, and to farms. Thank you.
Councillor Hoffman, go ahead.
Thank you, Board Chair Chop. First question is, Dr. Huckowitz, do you know approximately how many more TFWs we have arriving in Norfolk County?
My estimate is another couple of thousand.
Another couple thousand still to come? Okay.
Yeah. But again, that's based on other years, and I mean, I've also heard from farmers that they're having trouble getting people. So I'm not sure, but yeah, based on prior years, I estimate another couple of thousand.
Okay. And I would just like to piggyback on my colleagues' comments that I would support as well a letter to the federal government and the ministers involved requesting that we look at providing vaccine to the countries that are we're getting the workers arriving from. And next question is, this is not COVID related, but going back to your very first comment regarding the STI with chlamydia, is there a demographic that is particularly being affected?
Well, I'm not sure about these cases locally. I mean, typically it's, it's younger women. I mean, that's usually been the circumstances in the past. And again, the difficulty is very often in getting people to get tested, but people don't think they're at risk, I guess, and so they don't get tested and they don't find out, because these conditions can, be quite, provide quite minimal symptoms for a long period of time. But I mean, they can also lead to severe problems later on. But I don't know what the local circumstance is.
Okay, thank you very much.
Okay, just an effort to keep this moving along. So we'll just get a motion at the end in terms of the letter. So we don't need to keep addressing that. Councillor Columbus, go ahead.
Yes, thank you, Madam Chair. And Dr. Huckowitz, I commend you significantly for taking the time to meet with the Ag Advisory Board, and I know they really appreciate it. The one thing I have two questions, but the first one is, did you discuss with them the mental anguish that families are going through at all? Did that come up in your discussion? Yeah,
we discussed that. We also discussed that. We also discussed that some of them weren't eating well when they were at hotels, and they didn't like the food, and they came malnourished to begin with, and that this was not a good thing for them either. So yeah, we discussed a variety of things.
Great, I'm glad that you got into that subject. And the other question, about the mandatory, about making this 2-week vaccination prior to arriving on a plane mandatory. Is that a possibility that something like that could happen? Well,
I'm not sure who would put it this way. I think you people, as elected people, would have a better understanding of whether other elected people are often in favor of making anything mandatory. As an example, I would think that it would make a great deal of sense to amend the Immunization of School Pupils Act to require immunization of children returning to school in the fall against COVID. We require their immunization against measles, mumps, chickenpox for good reason. But those conditions are certainly much less prevalent in our communities right now than COVID is. And yet the province Minister of Health doesn't seem to be particularly interested in, so I'm not sure, well, the federal government exempted these workers from the 3-day quarantine. I doubt very much whether they'd be particularly interested in requiring mandatory immunization before people arrive into the country. If they did, I mean, that would be very, very helpful, but I can't see the likelihood of that happening. So at this point, I think all we could do is encourage them and assist them by providing a vaccine to them. If their countries cannot provide the vaccine, then I guess and again, I say as a matter of principle, I think it's always better to assist and encourage people before you mandate things or pass laws or do whatever. So.
Regardless, a vaccination 2 weeks before you board the plane would certainly eliminate a lot of anguish and it'd save a lot of dollars in the agriculture community.
It certainly would. Now, again, I guess, and I've had this discussion with people. I mean, like I say, I think it's always worthwhile or better as a first step to encourage and assist rather than mandate as a first step. If the encouragement and assistance doesn't work, then there are other steps that could be taken. I have raised with people from the province, I guess my view, employers could, particularly in non-unionized places, employers could mandate immunization. When I was working full-time at health units, although we had to perhaps grandfather or grandmother or granddaughter people in, we would not hire anybody that refused immunization. I think that's I think an employer has certain rights relating to its workforce, and trying to protect its workforce by mandating immunization, I don't see that as particularly kind of onerous. But again, that would relate to the individual farmer as to whether he or she wanted to insist on people being immunized before arriving, or even after they arrive. And then, of course, in unionized environments, and I don't know that the farms are, but in unionized environments, it always becomes quite difficult because you have unions that, in my view, should know better, who in fact insist that people not be mandated to be immunized, but regardless. But so, yeah, I think at this point, we should be encouraging and assisting rather than trying to mandate. Although, the immunization would go a long way to solving a bunch of problems.
Thank you.
Councillor Van Passen.
Yes, thank you, Madam Chair, and through you to Dr. Huckowitz. Thank you for doing an awful lot of homework there, and I'm probably going to ask you for a little bit more. You mentioned at one point that the first dose of the vaccine has an 80% effectiveness, and you mentioned another point where the workers that were arriving here, once the instructions to limit the number traveling together was in place, that the percentage dropped considerably on that. But could you just double check for me on, didn't that instruction come out at the same time when the workers started getting the vaccines at the airport? Yeah,
I'll check. Yeah. I don't know when that started. But again, in theory, the vaccine at the airport would not. I mean, in theory, you don't really have much. Well, in theory, you have no protection until at least kind of a week after the immunization. So in theory, it shouldn't have any impact. But I will check and see what the date of the availability of immunization was. Okay.
All right. Thank you.
Any further questions from the board? Okay, thank you, Dr. Huckowitz, for joining us. It's appreciated, sir.
Thank you, and I guess you'll deal with a motion from the board in terms of some kind of letter, and then I guess we'll have to work out the logistics of doing that, of getting a letter forward, if that's what the board agrees to.
It sounds like it. Yeah, we'll just receive your presentation as information, and then we'll move on to that part.
Thank you.
So Councillor Taylor's moving that, receiving it as information, seconded by Councillor Michelli. All those in favor? That is carried. And then moving on, if somebody would like to move a motion that Dr. Huckowicz be able to send a letter to the provincial and federal authority or government officials in regards to vaccination of migrant workers prior to arrival into Canada. Councillor Columbus, seconded by Councillor Van Passen. Any further discussion on that? Okay, all those in favor? And that is carried. Thank you again, sir, for joining us. Okay, moving on to the next item. I guess I don't know that there's anything else to provide from staff. My understanding is there's no additional report to provide. I'm not sure, Jason, if you wanted to make any comments.
Through the chair to the board, no comment. We were asked with regards to do some calculations to estimate totals if we move to the quote unquote Chatham model. There's lots of assumptions that would have to be undertaken, and staff would want to improve the policy a bit further, but we did undertake some rough estimates for the remainder of the 2020 year. You're probably looking at less than $4,500 of cost, and then for the 2021 year, we're obviously only partway through the year, so we would have to forecast out overtime hours and that kind of stuff. But we took a guess at it, and we're looking at potentially $27,000, $28,000.
Okay, thanks, Jason. Further from council? My position from last week has remained unchanged, so that's. Councilor Martin, go ahead.
Thank you, Board Chair Chop. I guess I was hoping for more information. I was hoping for the breakdown. I was hoping for the options. I thought that was the intent, that we were throwing numbers around that we didn't. I certainly felt that way. I believe Councillor Board Member Vander she said the same thing. I thought that we were deferring for some kind of breakdown and chart or options listed.
I'm not sure how much more I think you just have to pick a number, based on, the number of employees that it impacts. It's relatively easy to run those calculations. What is the number that the motion failed last week for the cap at 20%. So my position holds that I don't support, we did do one payment capping at 15,000. And I believed, in my view, it was a one-time offering. I don't see it myself moving forward. So I think at the end of the day, that motion failed, but you need to just pick another number. It's relatively easy to make that determination, and then what the policy is, whether you want it to mirror Chatham or one of the other health districts, or come up with your own.
Yeah, I understand that. It's just not that straightforward for me, and I was hoping to see it on paper. I thought that was the entire reason for leaving it last week, unless I've misunderstood.
No, and I'll apologize if I misunderstood. And to be fair, when we said we'd come back to next Board of Health, we thought it meant 30 days, not 1 week. But our understanding of what the request was of staff was to run the Chatham model specifically, because we had provided other options, but to run the Chatham model specifically to come up with an estimate. The Chatham model has some similarities because they said no overtime for 200 hours, but that's for an annual, where the one we were proposing required you to work 5 hours a week. So if you do the math, it's kind of the same, but you'd have to know what your total overtime hours is for a whole year to know whether you exceeded 200 hours or not. So that's why it's a little bit more difficult to run those numbers for this current year that we're in. But if I misunderstood the instructions from the Board of Health. I apologize. I thought it was specific only to the Chatham model because that's what seemed to be discussed at the end.
I certainly thought we had a couple other options on the table, but no need to apologize, Mr. Burgess, because I don't know that we actually specified it. And you're certainly right. I don't think anyone thought we'd be back around the table next week because we did discuss hosting another special council and decided against that. So there may be some confusion there on both sides.
I don't know. I think Councillor Taylor had moved specifically for it to be this week because he believed staff wanted a decision. That was why we called it an additional meeting. Councillor Van den Riesen, go ahead.
You're on mute there, still.
My apologies. I was under the impression, I didn't think I anticipated it coming back today, but I was under the impression we would have more paperwork involved in it. And we talked about, not to exceed 10% of an individual's normal compensation. We talked about many things. So just, and looking at the Chatham Kent version of it as well. But I think it'd be more, because this is an important issue, I would like to see options written down and so that we can understand what we're talking about here. And provisions put into it, and how are things being checked? How are things being, the checks and balances in the system? There's not enough here for me to make a decision on. I'm sorry.
Sorry, say again, Councillor Van den Riesen, what was the last part?
I don't see enough checks and balances in the system here. I'm not a mute. Like, if we're talking about a policy to be set up, there should also be the policy, as well as what are the checks and balances in the policy to make sure that, say, for instance, one has X amount of hours, how are they all verifiable? How are things monitored? Things like that.
I agree with you. I mean, that's the difference. That's why managers, that was what I tried to explain last week. That's why you don't generally have compensation for managers, because they're the ones that are in charge of making that decision. So who is going to verify or authorize this additional overtime in this capacity? That is ultimately the challenge with the process. You are correct. But failing coming to the board every time you need, if that's what you're proposing, you're certainly welcome to put that motion on the floor that you want the board to consistently, approve overtime. But in the situation like this, where you have a pandemic and sometimes emergency situations, that becomes very challenging, obviously, to do. Again, this is, in my belief, we did do a one-time payment of up to $15,000. Those that over the course of last year have not reached that 15,000 threshold would still be entitled to do so, but that it was a one-time thing. This is where you start getting, inequities. Many county staff and many departments have all rallied together to support the pandemic activities. So again, this is a limited pool of managerial positions within the public health department.
Understood.
Councillor Van Passen, go ahead.
Yeah, thank you, Madam Chair. A question for the clerk. We had a motion on the floor at the last meeting that was referred to staff for more information. Does that mean that that motion is back on the floor now? That is what is up for discussion? Or is it off the books and we start over again?
I don't think it was a motion. They had just wanted the numbers. The way that I understood it, and I can go back and watch the tape, was that they wanted the numbers run for Chatham, which Jason's given the numbers for Chatham. The reason it came back this week was because Councillor Taylor specifically said that staff wanted a decision, which is why it's back this week.
Well,
I don't know that there's how much more information. Staff have written countless reports on this issue to date. You moved a motion last week to not support anything. I did as well. I mean, and we all supported for the one-time payment, but if we're looking for, a second payment, then somebody from the board needs to put that on the floor, and we need to move on and get to our council meeting. Kevin, I see your hands up.
Well, Madam Mayor, if I could, I put a motion on the floor. There was no seconder. There was a motion put on the floor that was put on, I think, by Councillor Huffman, seconded by Councillor Taylor. That motion was referred back to staff to get a little bit more input on the Chatham model. And as our CAO has said, I think the only real difference is the proposal in option 1 was sort of a bi-weekly overtime calculation. Chatham used a yearly calculation. So that is my question. Is that motion still live because it was referred back to staff and now staff has brought back that information? Is that on the floor or not on the floor?
I believe the motion from Councillor Huffman, I thought, had failed, which was the 20%. And there was no motion really to get the additional. It was that we wanted to get the additional Chatham information. I don't think that there was a motion to move that yet. People said that they wanted more information. So that motion was never on the floor.
Mayor
through the chair, if it assists, the motion that was carried at last week's Board of Health reads as follows. Moved by Board Member Martin, seconded by Board Member Michele, that staff report HSS 2111 regarding public health management overtime policy be deferred until the next called Board of Health meeting in order to provide additional information to the board as deemed appropriate by staff, which would enable comparative analysis with other local public health units' management overtime policies.
Additionally, Kevin and Board Chair Chop, I have in my note here on that motion discussion surrounding flex time, dollar values, vacation time, non-union. There was a sidebar conversation about that may not have been wrapped in, but.
Through the chair to Board Member Martin, so there was initial discussion on that, and then towards the end, it was determined as deemed appropriate by staff to be as a part of the motion. So that could have been, it wasn't explicitly stated, but it could have been implied that that was what would be deemed appropriate by staff.
Okay, so we have 5 minutes to go. Does somebody wish to put a motion on the floor? We've been around and around this, or does somebody wish to defer back for additional information again in regards to loo time and so on? I don't think you're going to get an additional report from staff. I don't even think that's fair at this point, but if there's specific information that you want, I'm sure that can be put together. So if you want to defer it back to the motion, if you believe there's information missing there, that's fair enough. That's your call. Or if you want to put a motion on the floor now, that's also your call. Councilor Martin, it was your motion that you feel it wasn't met. So it's up to you whether you want to. I'm just giving the floor to you if you want to ask for that additional information or
not. Thank you, Chair Top. I'm in the same position. I just don't feel like I have enough. I know there's been a lot of information floating around, but my brain doesn't work with the numbers floating around. I would like to see it in front of me on paper. So I would, but we'll see what the rest of Board of Health feels.
Okay, Councillor Van Passen, I saw your hand was up next, and then I'll go to Councillor Columbus.
Well, again, I'll put forward the motion, the same one I did last week, and see if there's a seconder out there that staff be directed to implement option 2 from the report CS 21-10.
And option 2 was?
Direct management maintain existing policy and as such no longer apply for overtime based on compensation for management staff.
Okay, does somebody wish to second that motion? Councillor Columbus, second that? Councillor Michele, you're seconding? Great, any further discussion on that at this point? Councillor Columbus, go ahead.
Madam Chair, I was going to suggest, as we discussed last meeting, that that there was supposed to be a report, I thought, coming outlining a couple of options with respect to the Chatham-Kent situation. That's what I was counting on coming forward today.
Okay, so Councillor. Is there any further discussion on Councillor Van Passen's motion at this point? Or Jason, I saw your hand was up there as well.
No, this motion is different. I just addressed the report after this motion is dealt with.
Okay. Kevin, I might just ask for a recorded vote on this one.
Just Chair Chop, I believe Councillor Rabbits, who may not have been pinned to your screen, as
Oh, I see his hand. My apologies, Councillor Rabbit. I see it now. Go ahead. I didn't see you there. I don't have
That
you
is
pinned.
quite all right, and no opposition. I joined at about 2:15, so I've been here for the majority of our discussion. Just wanted to make sure you did see me.
Where are you? I did see you when you joined. I was the one that let you in, but I forgot to pin you and then you disappeared on me, so my apologies.
And sorry, Board Chair Chop, we lost Councillor Huffman legitimately, or?
Correct, she had to leave
Okay.
early. Okay, Kevin, if I can just ask for a recorded vote on the matter?
Through the chair, I'm clerking today, so I
Oh,
will.
sorry, Teresa.
Before we take a vote, I just want to make sure I have the motion right. So staff is directed to input options as per CS 21.
That's correct. Your audio is almost impossible to hear, and it's got quite a crackle to it.
I will maybe pass it over to Kevin and I'll get this corrected.
I will do the recorded vote and we'll work out the technical glitches with Teresa. Okay, I'll go on my screen as it exists. So I'll go Board Member Martin.
No.
Board Member Van Passen.
Yes.
Board Member Taylor.
Yes.
Board Member Columbus.
No.
Board Member Van Dendriesch. I
Linda,
didn't
I don't
catch
believe
what.
we could hear you. Oh, Councillor Van Dendriesch, my apologies. You're on mute still.
No,
Board Member Van Dendriesch, how do you vote?
no,
Board Member Rabbits.
No.
Board Member Michele.
Yes.
Board Chair Chop.
Yes. Okay, so motion fails on a tie, so we can go around with this again at the next Board of Health meeting.
Is Board Member Huffman not in the
She
meeting?
had to leave, unfortunately.
Okay, so the motion is defeated.
Jason, go ahead.
So I think it's a wish of council. We'll bring back a formal written report. We're hoping we have 3 weeks to bring that back. So if for the July Board of Health meeting, is that acceptable to the board? It'll take us a few weeks to pull together a report.
Okay, Heidi, did you have something else you wanted to add?
Thank you, Board Chair Chop. Just from the discussions, I'm hearing that the board would like more financial details. The clarity that I'm seeking is around whether the board wants to see more detailed policy options as well. I'm not clear about that.
It sounds from Councillor Van Dendriesch, it makes it, you know, that's my issue with it as well. There's no control over how, there certainly wasn't any control the last time. So I would say so, what the exact mechanism that's going to be used to approve this moving forward.
Okay, thank you.
Okay, so with that then, if I could have a confirming bylaw, or it'll be bylaw 2021-12-BH being a bylaw to confirm the proceedings of the Special Board of Health for the Haldeman Norfolk Health Unit at this Board of Health meeting held on the 18th of May 2021 be approved, signed by the chair and board clerk and affixed with the corporate seal. Mover and a seconder, Councillor Taylor, seconded by Councillor Martin. All those in favor? And that is carried. Next, if I could have a motion to adjourn at 3:02 p.m. Councillor Taylor, seconded by Councillor Columbus. All those in favor? And that is carried. So we are going to move into our council meeting. Does anybody need a 5-minute break? Teresa, go ahead. 5-minute break?
Yeah, if I could just have 5 minutes to get my technical piece working.
Okay, so it's 3:03 p.m. and we'll start again at 3:10. And just for the participants as well, my apologies, but we'll begin at 3:10. I don't know why I've lost some people from my screen. It says Councillor Ravitz is pinned. I don't get this. Oh, there you are, one. Does anybody see Councillor Shelley? Is he?
Mayor Chop, can you hear me?
I can hear you, but oh, there you are now.
Okay, and because I'm having some trouble with my screen right now. Can you see me now?
I can see you.
Okay, good.
Okay, I think we're all here and we are ready to begin. Okay, so good afternoon, everyone. I will now call the council meeting to order. Apologize for the delay. Approving the agenda here is going to take a minute, and there's a number of changes that have been requested by staff in the order that the agenda will flow today. There are some staff reports that relate to deputations and other communication items and so on. So I will go through all of the requests that have been made. So the first is the addition of an item 6C, which is an information memo from Marlene Watson, the Director of Facilities, in regards to the Norfolk County soil remediation update. As well, 7B, the council minutes from May 18th, 2021, and the correction of replacing the April 21st, 2021 Tourism and Economic Development Advisory Committee with the May 19th, 2021 minutes. And then there are a number of changes in the order. So CAO 21-49, that's the release of the closed report, was pulled from consent by Councillor Van Passen and moved to after the deputations with a possible closed session. Resolution 19 pulled from the June 8th CIC minutes by Councillor Taylor for discussion. CD 21-45 and CS 21-37 are to be moved, to be discussed after deputation from R.W. Phillips and Joe Jealous. Communication item A requires a motion, so will need to be discussed and not simply received for information. CAO 2145, that's the IC report, is to be discussed after CAO 2148 to allow for closed session to follow immediately, should council wish to discuss the companion closed session memo. And I think that's all I have for you. The only other note I have here from Teresa as well is just that if we enter into closed session, she has a suggestion that we deal with all closed session matters, then return to open to resume the discussion on the IC report and move closed session memos and then proceed on with the bylaws and the remainder of the agenda. So we can deal with that at the time. Councillor Martin, go ahead.
Thank you, Mayor Chop. I guess I am wondering with the closed session report from Paula, CAO 2149, if that needs to be dealt with in closed session, because everything else has been in open and there's a recommendation that's kind of paired with some of that.
I believe, Teresa, you can speak to that, but I think there's a reason that Teresa and Paula have placed that in closed session at this point.
Through the mayor, yes, that is in closed session for solicitor-client advice, and I would recommend that it stay in closed session.
Okay, I guess follow that. My comment would be the entire remainder with a very open, transparent discussion has always been in closed session on this topic, but that's fine. I will follow staff's lead.
Jason, go ahead.
Thank you. Through the mayor, I was just informed by the clerk that we had an administrative error, that there was an additional deputation received on time by Mr. Bunting, but not added to the agenda. So because it was staff's error, that a further change to the agenda should be that that deputation should all be allowed under deputations.
Okay, that's fine.
We apologize for that.
Okay, anything further from council? If somebody could move the agenda as amended. Somebody, Councillor Rabbits, seconded by Councillor Michelli. All those in favor? And that is carried. Okay, moving on. Any declarations of pecuniary interest? Sorry, Councillor Rabbits, go ahead.
Thank you, and through you, my conflict is with regards to our deputations. It's item 5C, deputation by John Valley, water supply in Port Dover. It is Simcoe, sorry, and the rest of us. It's come to my attention that Tayu Tetsu is a client of John Valley's, and he may want to speak to how water could impact the factory where I am employed in a human resources role. So I believe I have an indirect conflict of interest with his deputation, and I will not participate in that portion of our meeting.
Teresa, is it necessary with it just being a deputation for Councillor Rabbits to leave and so on, or we just...
Through the mayor, the only requirement for a councillor to leave during this declaration of pecuniary interest is closed session. So Councillor Rabbits can choose to stay for it and not participate, or he can choose to leave and come back. That's solely up to him.
I'm assuming Councillor Rabbits, you'll just stay there since...
I will stay here, but you know, I will refrain from discussing my place of work with the deputation. Good. Understood.
Councillor Vanden Riche, I see your hand.
Yes, you do. Through you, the chair. I declare pecuniary interest on CS 2137. I have done business with the applicant as well as could possibly do further business in the future.
Question, Councillor Vanden Riche, and I guess that would apply to her as well then, Teresa. I wasn't aware of that actually. I thought the way they had changed the rules was you had to vacate, but
no, you don't have to vacate.
Through the mayor, it's just during closed session.
Perfect. Great. It was different one than we were doing in the past, so that's good. All right, so if there's nothing further, we have 2 consent items today. The first is staff report EIS 2128. That's a report to hire an engineer under the Drainage Act, 4th concession drain, Martin Culvert. Does any council member wish to move consent item A for further discussion? Okay, if I could have a motion then to approve consent item A. Teresa, go ahead. Sorry, stand by.
I apologize, Mayor Chop. I double checked the procedure bylaw, and actually your procedure bylaw does say, or our procedure bylaw does say, that they will leave the room and not take part in consideration or discussion of the matter, nor vote on any motion in regard of the matter. I apologize for that.
No, that's okay. That was my understanding as well. So, but my question for Councillor Rabbits, I don't think it's an issue just for the deputation. That was where my first question was coming from. There's no motion that's arising out of that. But if you prefer that he would turn off his screen and camera, we can do that as well.
I would, just in case, you know, I have a member of Taiyu Tetsu present, or perhaps
okay.
John
That sounds
Valley
good,
speaking
Councillor
to the
Rabbits.
matter. I'll turn my screen off.
Perfect. And Councillor Vanden Riche, that will apply to you as well. Okay, so moving on then. Again, if I could have a motion to approve consent item A. Councillor Rabbit, seconded by Councillor Taylor. All those in favor? That is carried. Next is staff reports CAO 2149. That's the release of the closed session report. Again, so Councillor Van Passen requested consent item B, staff report CAO 2149, release of closed session report, be pulled for discussion, and that discussion will be moved to after the deputations. Deputations now, we'll begin with the first deputation. Welcome, Lucy Bonanno, and this is Lucy's the new CEO at the hospital. For those that haven't met her, so I will turn it over to you, Lucy. And am I correct that you needed a little bit of additional time, or are you good with 5 minutes, or did you need 10?
Ms. Bonanno, you're on mute, but I believe
yes.
I believe the sign language is maybe an extra minute.
Thank you. All right. Yes, I could do with the extra time. Thank you, Madam.
So just for formal procedure, just if I could, somebody from council, I meant to ask this at the beginning. I knew that you had put in, you needed the 10. Councillor Martin, seconded by Councillor Rabbits. All those in favor? And that carries with the 2/3. Thank you. Go ahead.
Thank you very much. Thank you, Mayor Chop, and to our CAO, to Jason Burgess, and to the council members for giving us this opportunity to come to you today. For those of you who don't know me, I'm the new CEO here at the hospital in this great county of ours. I must say, I love it here. I moved here and live within Simcoe, but I love the whole county. I've been around it. But the reason we're coming to you today is because when I came here, I can tell you that this facility is older. It needs updates. There is no question about it. And I know that I came in at a time when the Building Better Hospital leadership was ending. I was coming in, and so we are at ground zero when it comes to the actual building of it. I am picking up the pieces, and I am coming to you with the request of the $5 million that was initially promised for these projects, and the two that I'm coming forward with are minimal invasive suites redevelopment, as well as our labor and delivery redevelopment. Together, those projects will cost between $8 and $9 million as a grouping. And so the money is absolutely relevant because we are not going to be receiving ministry funding for it. But I'm going to let Paul Clary, our project manager, speak to that a bit more, as well as Jerry Pilon, who's our architects. They are here today, and I'm just going to hand it off to Paul. Thank you.
Well, good afternoon, and thank you, Council, for allowing me to participate today. I was going to share my screen with you, but I think in the interest of time, you do have a presentation from the hospital on pages 27 through 41 in your package, and I'll refer to particular pages as I talk about the work that is underway at Norfolk General at the moment. There are, as Lucy mentioned, a number of capital projects in various stages of development at Norfolk General. Those are on page 29 of your package. There's 5 rather significant projects. I think important to point out there's 2 the 2 most immediate and most important clinical priorities are to deal with the labor and delivery suite, as well as to construct 2 minimally invasive operating rooms within the surgical suite at the hospital. My purpose here is to give you a little bit of context as to why these are important. On page 30, you'll see a little bit of the context for why labor and delivery is so important. The labor and delivery suite was last renovated around 1993, so almost ago. The model of delivery at that time was for mums and babes to labor and be born in one room and then be taken to another room for recovery, and then eventually to go home. That's not the model for birthing services today. We use something called LDRP, labor delivery recovery, all in a single room. The OR, or the labor and delivery suite, if you look on page 31, you'll see what it currently looks like. It's very much like an operating room rather than a modern family-centered place for families to grow. If you look on pages 32 and 33, you'll see some conceptual images of what we think a modern labor and delivery suite needs to look like. So our purpose in renovating the labor and delivery suite, we want it to be more family-centered. We want it certainly to be safer and more efficient, both for families as well as for the staff who work there. And there's a reality that there are more modern birthing facilities available at both Woodstock and Brantford. And we want families to be able to stay close to home, to have their to add to their families. So we're looking to modernize in order that mothers and newborns can get care closer to where they live, rather than having to take a trip out of town or farther away from the county. So that's really the rationale. As I say, the pictures speak for themselves in terms of what we have today versus what a modern labor and delivery suite should look like. Page 34 is the outline of the context for minimally invasive surgery. So there's a significant minimally invasive surgery practice at Norfolk General, but the ORs, there's 4 operating rooms within the OR suite in the hospital. They were built around 1964. There's been some minor additions for medical gases and some of the other services, but by and large, the finishes, the floors, the ceilings, the walls are exactly as they were built in 1964. Lots of services have been added and attached to the walls, and that is certainly not current standard or current practice for ORs. But the reality is, with the changing in surgical technologies, surgical practice, and with aging population, the demand for minimally invasive surgery is actually growing quite significantly. So our proposal here is to take 2 of the 4 rooms and renovate them fully to bring them up to modern standards in equipment. Now, minimally invasive equipment are booms that are structurally hung from the ceiling and gas columns. So all the gases you need, oxygen, carbon dioxide, zone within easy reach of the surgical team. Equipment is on boom, so it can be brought into the surgical area or out as needed. The lights are on boom, so they're more readily adjusted than the fixed lights of an older, more traditional operating room. So there's a significant amount of equipment to be brought in and installed, lots of structural work, upgrading of mechanicals and electricals. And you can see on on page 34, that's an image of the current surgical suite that we'll be renovating to introduce minimally invasive concepts. Sorry, that's on page 35, my mistake. You will see on pages 36, 37, and 38 of your package some images of the concept of what it is we're planning to build in terms of the installation of these of this minimally invasive equipment and the medical booms that hold all of and articulating arms that hold all of this equipment. And the idea here is make the room safer because we don't have cords across the floor. We don't have conduits and things on the walls. Instead, everything is self-contained within the articulating arms and the medical gas columns. They're within easy reach of the surgical team. So it's faster, it's more efficient, it's safer for the staff, but ultimately it will be safer for the patients as well. Now, Lucy mentioned, and you'll see on page 39, these two projects estimated about $8 million in today's dollars by the time we get through approval processes with the ministry and get to tendering and construction. We believe it'll be in the $8 to $9 million range. The ministry has indicated in our discussions with them to date that there will be no ability for them to cost share in these projects. So it's entirely up to the hospital to seek the funding it requires to complete both of these projects. And that's really why we're here today. We wanted to present to you the context of what it is we're trying to achieve. Many projects, but these are the two most important. There's still more work and more investment that will need to happen at the hospital, but these two clinical priorities are our most urgent, and we wanted you to be aware of it. And as Lucy mentioned, look for the county's support to make these projects happen as quickly and as soon as possible. And I will stop there and leave it for any questions you may have of me or of Lucy or of our.
Lucy, did you have any closing comments you wanted to make before I turn it over to the council members?
No, as I said, I just wanted to, again, introduce myself, but let you know that at the hospital, there's an awful lot of change and transition happening. If we don't keep up with what's happening within our structures, and COVID has really brought this out, we will begin to regress as opposed to go forward. We need increased services. We need to update our hospital. I'm coming in with a fresh pair of eyes and some experience coming from the north, where we also had to build a brand new emerge and so on. But I can tell you that we are in a good position. We've got staff that's committed. We have physicians that are great physicians here. It's just we need to update what we have or we will fall behind. Thank you.
I know you're new to Norfolk County, so I'll say it's kind of like all the facilities in Norfolk County. You're not alone. I have a number of comments to make, but I'll turn it over to Council first. So Councillor Van Den Rishi, I'll let you go, and then Councillor Rabbits, followed by Councillor Columbus.
Thank you, Madam Chair. Through you to, I guess the question was to Paul. My question is there, does it exist today a building fund?
Sorry, I think I heard, if I heard the question correctly, you asked if there is a building fund?
An existing building fund?
Yeah. Well, the foundation is certainly involved in helping to fund these projects and has been actively fundraising in the community. So we are expecting that we will rely on the foundation to help us bridge the gap to the 8 to 9 million that we need.
And speaking of the bridging of the gap, what do you anticipate, or what is your goal in the fundraising?
Well, as I say, we need 8 to 9 million. I can't speak to I haven't had a chance to speak to the foundation. Lucy may be able to speak to that in terms of the foundation's available resources towards that 8 to 9 million. But certainly, you know, we weren't here to ask you to pay for all of it because we know the community and the foundation have been giving to see things happen at the hospital as well. You know, as we go through planning with the ministry, we will have to provide them with a statement of the source of our funds, and we're in the process of collecting that information and those commitments now.
And may I ask one more question?
Go ahead.
Why was the ministry not prepared to support with additional dollars?
their indication to us is that that they have a significant constraint on their capital funding. It's probably they didn't give us the rationale why, but I do know from my work with the ministry, there's significant work being done now to look at how to pandemic-proof the healthcare system. And there's also obviously pressure on the long-term care sector. And I suspect that the government is holding off on capital commitments at this point while they deal with those issues. And if I could be crass, I would say that they're probably also keeping their powder dry in anticipation of a forthcoming election.
Paul, if I could add one more comment to yours. The other thing to note that I think is important for council is that when our experience with the ministry on these things is that when projects are our own funds projects and a hospital can demonstrate the community support and funding for the projects, the approval process for those projects moving forward is much quicker. So it's not just about the required funding, it's about the demonstration of support to show the ministry that this community is behind the project and is fully supporting it too. And that's a key part of a requirement for a ministry approval.
Yeah.
Thank you.
Councillor, what did I say? Councillor Rabbits, go ahead.
Thank you, and through you. My first question is for Paul Clary, Healthcare Infrastructure Planning Incorporated. Paul, when did you first, when was your services first sought after, and when did you first really begin your project here?
I started, I think it was probably late 2017, early 2018. I was retained by Norfolk General at the time to develop the pre-capital submission for the ministry for both labor and delivery and for a same-day surgery renovation project. And I prepared that submission on behalf of the hospital, took it through the approval process with the ministry, was subsequently asked by the hospital to revise, instead of it being one submission, to break it into two. So I worked with the hospital to accomplish that. And then I was asked to assist them with looking at the nursing home redevelopment and the impact on the campus at Norfolk General, and to also look at helping them with master planning and an emergency department redevelopment at the West Haldeman General Hospital site. So I've been working off and on with Norfolk General for at least the last 3 years. And
thank you for that. And
sorry,
and it leads to a follow-up question.
Yeah.
If I may. So I guess this process really for this particular project, really in your view, or your 2017, early 2018, we've had some submissions, formal submissions to the ministry. Were those part of a funding envelope, ultimately being unsuccessful? I'm hearing from you that the doors are closed. But my question is, there going to be another round that we can apply for funding, or is that to be determined?
Well, so the ministry, at the time, back in 2018, the thinking from the administration at that time was to complete all of these projects as own funds. As Jerry mentioned, the thought was that we could get through the ministry approval process faster. That it's basically a 6-stage approval process, and you have to get through every stage, and it can take years for the bigger and more complex projects. But when it's your own dollars at risk, capital dollars, and where there's little operating cost impact, the ministry is much easier to navigate through. So the thought at the time was that both the labor and delivery same-day surgery was going to be an owns funds project, and then the hospital made the decision, the administration of the day made the decision that they should seek cost sharing for labor and delivery. And so that was the reason I had to split the project in two and then resubmit. And it was only recently, it was I think in April, in our conversations with the ministry, that they said they have no capacity to provide funding for labor and delivery, but would be prepared to support the project as an own funds project, and in fact would allow us to go from our pre-capital submission, which is our current stage, all the way to stage 2. So we would basically jump further into the planning process to expedite completion of these projects. But that we only learned in conversation with the ministry in April.
Thank you for that detailed explanation. My next question through the chair is to Lucy. Lucy, I'm looking at the cost, projections here. I'm trying to determine if there is a capital fund established with Norfolk General Hospital. Is there a reserve for such projects? With all due respect, it's saying that these should be own funded, but here we are at a council meeting, and really it's the taxpayers who will be funding this project, or potentially through their altruism and charitable contributions, Norfolk Community Foundation. So, when I'm hearing own funds, I would hope that our hospital would be planning for capital projects by either creating a reserve, fundraising into that reserve, because it would appear that the 8 to 9 million is entirely to be borne by either a municipal partner or a charitable organization. Can you provide some clarity on that?
Sure. So I wish we had the funds for it at the end of the year, that I could say we had extra money that we could put in. This is a medium-sized hospital, and the way that medium-sized hospital funding works is very different than the small and the larger one is. It's almost, there are 3 separate ways of funding when it comes to funding healthcare and funding hospitals. So there's no reserve fund per se, no. But every year we do look at what we have to do in terms of capital funds, and then we try and take money from what's called a HERF funding that we have to apply for in order to help us with any repairs that have to be done. Anytime we do any capital redevelopment like this is usually where fundraising comes in, or we seek ministry funds, or we go to city council, municipalities, and so on to help our local municipalities to help with funding. That's the usual route that is done. I'm not aware of any other routes in the 30 years I've been in healthcare. So that's the only route I know. And the foundation, so we did fundraise. There was building a better hospital campaign done, and the funds that were raised, the goal was not reached, by the way. The goal was not reached. Apparently it was 13 million was not reached. But I was told that 5 million was promised by the county back then and had not been collected on. And that's what I'm here to do at this point, because it was part of the funding model towards these projects.
So if I could interject, Councillor Rabbits, maybe I'll get Jason to just chime in here. I just assumed it was kind of a given. But Jason, maybe you could just touch on the motion that was passed by previous council and sort of what kind of that looked like over that 10-year horizon.
Thank you. Through the chair to council. The previous motion, as CEO Bonanno did indicate, there was a previous motion that was passed by council to commit up to a maximum of $5 million for the Build a Better Hospital campaign, which at the time was estimated to be $13 million. What staff are doing now.
Sorry, Jason. And just to clarify again for council, that was from the legacy fund.
That is correct, yeah. But what staff is doing is that they are actually accruing as a liability $500,000 per year, because that's what it was. It was a grant of $500,000 per year over a 10-year period, not to exceed $5 million. Currently, we've accrued $2.5 million up to the end of December 2020. So we would be at $2.5 million currently was the previous motion of council at this point in time.
Sorry, and just can I make one more correction there? I don't think was it up to. I thought the commitment was 500,000 annually. I thought that actually was the commitment.
The council grant $500,000 per year over a 10-year period and not to exceed $5 million based upon the Norfolk County General Hospital Foundation overall capital campaign goal of $13 million. And then it says further in that the funds be held in a reserve fund until such time required by the Norfolk General Hospital Foundation for progress payments toward construction of renovations.
Yeah, it's kind of funny wording. So it's the commitment is 500,000 a year, not to exceed 5 million, right? So to me, it is.
Yes. So that was so. It's and I.
It's a $5 million commitment is what it is. It's just that we haven't reached that moment in time where there would be the full 5 million available, but previous council, we are committed for that amount.
Yeah, so and I apologize, we're at $2.5 million accrued as at December 31st, 2020, and the $500,000 for 2021 would bring it up to what's accrued currently is $3 million towards that pledge.
Okay. Further, Councillor?
Thank you, Jason. And if I may, so we're about halfway there.
Correct.
Yep.
Meeting our obligation. Okay, thank you.
Councillor Columbus?
Thank you. And I'm hearing that this project is approaching $9 million. And what I'd like to know is how many dollars do you have over and above towards that 9 million that have been raised within the community?
I didn't hear the last part. I'm sorry.
Yes.
Can you?
How many dollars do you have raised already over the $5 million that's been pledged by Norfolk County that have been raised in the community?
Yeah, that's great. We have about $2 million right now, which is going to go towards the MIS Suites project, and it's the L&D that it's going to cost us about 6 to 7 million. So we're going to do more fundraising, and we've come to sort of collect, so to speak. And so that's where we're going to reach our money.
When do you actually expect to see a shovel in the ground with respect to this project? Not a shovel in the ground, but let's say some construction actually taking place. Is it 2 years away, 3?
Yeah, that's a great question. I'm jumping as quickly as I can to do that because I know how important it is. But I'm going to let Paul sort of take that one on how quick we can get a shovel in the ground, so to speak.
Yeah. Well, and Jerry will probably kick me because he's the architect who will do the tendering, etc. But I suspect it's probably going to take 6 months. We have to do something called a functional program and get that approved by the ministry. We're just tendering that now. Hopefully have that by end early 2022. Then we do some design work, which will probably take probably a year. So it's probably 18 months before we're tendering. We are working on the MIS suite. We are working with the supplier of the equipment that goes in the ceilings. They're already doing some preliminary engineering work, and Jerry's working on layouts. But we're probably 18 months before we'll start actual construction on that. And pretty much a similar timeline, I would think, with the labor and delivery. We still have to get ministry approval, and then we have to do some design and engineering work and then go to tender. So that's probably 18 months to 24 months out, I would think.
Thank you.
Okay, Councillor Huffman, then Councillor Taylor, then Councillor Martin.
Actually, thank you, Mayor Chop. My question was answered earlier. I was wondering why the ministry hadn't committed to the funding, and that question was answered. Thank you.
That was where I was sitting too, and I thought I took my hand down. I just can't believe that this is regarded as the highest clinical priorities for the community, and the ministry isn't going to open up the purse. I think that's absolutely wild. But yeah, anyway, move on.
You're on mute there, Mayor Chop.
Sorry, thanks. Councillor Martin, go ahead.
Thank you, Mayor Chop. Through you to Lucy, I was going to make joke about your last name and coming to collect, but I won't go there. My question to you is, how can the community help? How can the community volunteer to the initiative and donate and keep it going for you?
Thank you for that, Councillor. Yes, you know what, we have I'm actually very excited about this. We have a new executive director coming on board for the foundation, and we're going to work together to really come up with a great strategy for the community because, you know, I like to say we're all greenhorns here right now, and we are actually. There's a lot of new blood, new eyes, and I think we're really going to work hard to reach out to the volunteers, communities, now that everything's opening up again, to really make them feel part of and inclusive of the hospital again and bringing them back in. So I don't have any exact answer for you, but I can tell you there will be a strategy in place for fundraising again with a new purpose and a new face. And we have to get hammers to walls and we have to get this finished. There's no doubt in my mind that we're going to do it. So.
Yep, sounds like a great asset. It'll definitely contribute to the hospital. So thank you, Mayor Chop. My next question will be for staff. So whenever you're ready for that, I'll wait.
Given the kind of unique circumstances with this one, because it's kind of our commitment, Councillor Martin, I don't mind if you want to just kind of go ahead right now.
Sorry about that, slow computer. Thank you, Mayor Chop. My question would just be to Mr. Burgess. How do we fulfill the commitment? How do we release the funds? What does that look like from our end?
I think my understanding is there had to be a formal request from the hospital, and it's already been approved by council. I think there was talk in the original documentation about receipts being provided. I think from staff's point of view, at this point in time, if there's an adoption of a plan going forward, that we would transfer the funds as requested to the hospital so they can start their process with the consent of council. At this point in time, as I've said, we've set aside essentially $3 million as of today for the hospital contributions. You know, we could do that and then ask for the hospital to come back with an update for the remaining of the $2 million would be my suggestion. And that way the community is brought up to date on that. But you know, I don't really have any concerns that the money would not be spent on the renovation of the hospital. You know, I think there's lots of soft costs that need to go into this, and I'm assuming I don't want to speak for Ms. Bonanno, but I think actually having money in the bank from the county actually helps their fundraising. It shows that there's a commitment to the rest of the fundraisers to narrow the gap at that point in time.
That's great. Thank you. That's all, Mayor Chop.
Thanks, Councilor Martin. Okay, I have a couple questions. Lucy, the first time we met, you touched on it a little bit, but we talked about the importance of an H designation, of a hospital designation, as and sort of the risk to a community if we were to lose that here in Norfolk County.
I did. Thank you, Mayor. So when I first met with the mayor, I was and I did an assessment. I was here maybe about 3 months or so, or 4 months, and usually that I need about that time in order to do a bit of a SWOT analysis for myself, just to get an idea of how we're going and see the community around us, but more or less the hospital. And I could tell you that I was rather shocked at the facility itself. And I'm going to be transparent with you. It is old and it has not been kept up. And so I knew I had to act immediately to try and get this updated. And the most urgent was the ORs, as we are coming to you, as Mr. Clary said, Paul Clary said, our ORs are absolutely in need. We are losing moms, you guys, to Brantford. It's documented. We are losing them to their why. When we ask them why don't we have more births here? We can. We've got new housing around us. here in Norfolk. Why are we losing them? Because we're not up to date in our L&D. We have to keep things up. We have to make sure our standards are up to date, safety standards, everything from pharmacy. Our IT is way behind. We've got to really do a lot of work. Why? Because if we do not, we are going to start not to be looked at as viable by the ministry, which I don't want to go down that route, and we could potentially not be looked at as, well, viable. I'll use the word viable, and that could actually impact services, and that's where I don't want to go. You'll notice, so what a lot of the councillors are not aware of, and I will say this openly, the mayor is aware, as is Jason, is that, you know, the assessment center we have and the vaccination center we have, do you know that we were not a vaccination site initially, meaning we were not supposed to get vaccines. We were all supposed to travel to Hamilton. I don't know if any of you are aware of that. It's because I began advocating with your public health unit, and public health and us, they were fabulous, by the way. We worked together in order to not petition, but advocate, I'd like to use the word, with the ministry to say, look, we've got our freezers in place, which we did. We bought them out of our own operational dollars. We've got that in place. We've got our standards in place. You know, we had to meet a lot of check marks in order to receive this vaccine. I think we treated the vaccine more gentle than we would a newborn, let me tell you. The standards we had to meet around that. We did. We put it all in place. When we advocated for it, we said, we're ready. We're not asking for money. We're ready to receive it. Why? Because I didn't want people to leave this area to go and get a vaccination. It didn't make sense. We waited a couple of weeks, and together, again, it was a collaborative effort. We were granted that we were now able to receive vaccine. Do you know we're one of the only smaller, medium-sized hospitals in the province to actually be a site that receives vaccines? Most of them are the bigger ones. Brantford, Hamilton are the bigger hospitals. Niagara, we are now one of them. And you know, I like to say we're on the same block as the big boys. Our house may be a bit smaller, but we're on the same block. And that's where I want to stay. And that's where I'm trying to bring this hospital. That's my vision for this hospital, is to kick it up a notch and bring it so that we are going to really be able to increase our services, increase and improve the way it looks, improve the whole structure of it. That's my vision for it. I'm told it's a bit grand, but I think it can be done. I think it can be done with a lot of effort and a lot of enthusiasm. We've got the staff, the physicians, we can do this. Sorry about that. I went on a bit of a rant.
No, you're good. I know you have the enthusiasm for it. I also have the enthusiasm for getting us some provincial funding because I think Haldeman and Norfolk is supporting a conservative riding since 1995. I think deserves that. So when I've done a little bit of research for council leading up to this meeting, last year the provincial government committed $175 million through the renewal fund to help hospitals across the province maintain their infrastructure and ensure a safe and comfortable environment for patients to receive care. Yes, 50 million of that was allocated to COVID, type upgrades and activities and so on. However, I look at the Niagara region. The Niagara region received 1.7 million, and this is where it's interesting, to help support projects that will increase the reliability of the electrical backup systems in case of a power failure, including retrofitting a switchgear breaker as well as refacing the building and replacing the roof. So in Niagara Falls, they're getting money to replace a roof, and yet our ORs have not been upgraded since 1964. I also learned just today, and I can't believe we've never talked about this at the Board of Health. It's never come up. I don't know how I missed the article myself. But I found out that the federal government committed 17.8 million. This is an article from the end of March, over 12 months to help cover the costs of an isolation and recovery center for migrant workers in Windsor who have become infected or exposed to the coronavirus. The Windsor Star reported that the 125-bed center in Windsor opened last July and is operated by the Canadian Red Cross. More than 1,000 migrant workers have been sheltered there. like, to me, one of the challenges that we face in Haldeman and Norfolk, when you look at, I then went on to see, you know, the political background of both Windsor and of Niagara. And Norfolk County, Haldeman Norfolk, has consistently supported the conservative government almost blindly over this period of time. And that's great. You know, there's no issue there. I'm not debating that. I probably have more conservative values myself. However, you know, the challenge with that is when a political party doesn't feel, you know, that they need to put some money behind your region because they're so comfortable there, it ends up the money going to other areas where, you know, those seats are more challenged. And for myself, you know, I kind of want to put this back on the province right now. So what I would like to see, you know, I know you're talking about the numbers that you need, Lucy. We've got the 3 million that we've already accrued as the liability. You know, I know in the past, I agree with Jason, there was a piece about, you know, needing the receipts and so on, but I do see your point of using it as a commitment basis and encouraging other community members to get on there and start donating towards this. I mean, it's clear. We need to keep the hospital designation in Norfolk County, and we need to keep providing these services for our community. And if we don't, you know, you're going to find yourself traveling to Brantford and beyond for any hospital care services. So my thought is that we, you know, we make the transfer for the 3 million to the hospital, and that we commit to pledge the additional 2 million early if the province ponies up an additional, you know, an equal commitment that Norfolk County is ponying up. And I think, again, as a conservative riding since '95, I think the residents of Haldeman and Norfolk deserve that. They don't need a roof. They actually need ORs that are functional. So that would be kind of what I would sort of put to council is we look to commit the 3 and that we send a letter to the province asking them and in support of the hospital that we will commit an additional 2 provided they also commit 2. Councillor Hoffman, go ahead.
I just wanted to say, are you putting that down as a motion?
Well, I can't because I'm the chair, but if somebody wanted to tag along and they thought it was a good idea, then by all means.
Okay, well, I just want to say that I think it's a fantastic idea, and I think it is the responsibility of the provincial government to step up in regards to this. We need to maintain our designation, and I wholeheartedly support your proposal. So I would like to put that on the floor as a motion.
Okay, thanks, Councillor Huffman. Councillor Martin, I saw your hand.
Just going to be a question there. I'll wait till you.
Sorry, I'm looking for a seconder then for the motion. Councillor Taylor, thank you. Go ahead, Councillor Martin.
Okay, so thank you through you, Mayor Chop. What's our plan if the provincial government does not jump on board? What is our timeline for the additional funding? Just to clear that message up.
Well, I guess we'll ask Lucy if we don't get any money from the province and she doesn't get any feedback, then hopefully she can come back to a future council meeting and provide us with an update of where we stand with any provincial assistance. And at that time, if they need more money without provincial support, we can make the decision at that time for the hospital.
Yeah, thank you. Yep, thank you, Mayor, for that. Yep, and I believe our CAO Jason also mentioned it that I would be back and give an update, and I will be doing that anyway, just to let the councillors know where we're at and how we're doing, and Paul and Jerry and I can come back and let you know. But we're just going to move forward with the funding that we're getting here from the county and carry on with the project, and we'll just take one step at a time. I mean, it's hard to read the future. It really is. In this day and age of healthcare, it is very tough. And we're going to take it one step at a time and advocate as we go along. And hopefully they'll hear our shouts, you know?
Well, and hopefully they'll hear the shouts of the community as well. I mean, hopefully I'm sure Monty's out there listening. But at the end of the day, you know, when your operating rooms haven't been updated and we haven't received hospital funding and we don't seem to, I see, you know, Andrea Horvath screaming about funding not going to the Chatham Hospital. You know, I want to hear our own MP screaming from the rooftop that we need some funding here in Haldeman, Norfolk as well. Go ahead, Councillor Martin.
Okay, so thank you, Mayor Chop. I guess I am in support of this. My only comments would be, I would be interested in maybe wordsmithing this a little bit. Maybe Mayor Chop, Mr. Burgess, Lucy, having a meeting with Toby Barrett's office. I'm in support of giving the funding regardless, but some lobbying in a collective manner, I think might go a long way instead of just dropping something in the media saying this is the plan. I agree that the provincial government should assist with the community, and but I think our approach pivoting here a little bit will go a long way.
Well, I think there's a motion that's still on the floor, and my understanding is meetings have taken place with our MP as well, so he's well aware of the situation at this point in time. It's not out of the blue. This has been in discussions for some time. Councillor Rabbits, go ahead.
Sorry, Mayor Chow, I guess what I'm just trying to clarify, I am in support. You get more bees with honey is what I'm trying to say. I don't know how you intend to roll it out is what I'm looking for.
Well, you can't lose something you're not getting. So that's my position. But Jason, go ahead, and then I'll go to Councillor Rabbits.
Just to, I believe, just to answer Councillor Martin's question and just to confirm so the staff understands, I believe the intent of the motion provided by Councillor Huffman via the mayor was that council would provide the $3 million today, and then if additional funding comes from the province prior to our next $2 million, we could accelerate the following $2 million that we also owe on our commitment to match provincial dollars. So if the province comes out with $2 million next year, for example, to fund it, we would then advance our remaining $2 million so that the hospital gets the funding ASAP and then can deliver the projects in a more rapid time. That was my understanding, but I just want to make sure I got what the intent of it was.
Yeah, the only I was going to come back to you actually, Jason, for some clarification on the wording in terms of the release of the funds, if you want that specified. I'll give you some time. I'll let Councillor Rabbits and others sort of ask some questions, and then between you and Teresa, if you wanted to sort of finesse that motion, if you'd like it to read it. Councillor Rabbits, go ahead.
Thank you, and through you, I'm speaking in favor of the motion. I'm glad to hear that we will meet our obligation and that we've budgeted and accrued some monies that can be released perhaps ahead of schedule or upon the request of the hospital. I did want to just speak to Lucy's earlier comment about the state of our services and how we are behind and falling behind further. Many of our constituents residents outside of the area for a variety of healthcare services, and absolutely Brantford and Hamilton area are the recipient of many patients that could have otherwise been treated in Norfolk County. So I am speaking in favor of the motion. I want to acknowledge that though we have a fresh pair of eyes on an old problem, we know the condition of our hospital, and I believe that we need to double down to advance looking at those primary areas crucially. And should this motion succeed, Lucy, I suppose you'll have an opportunity to establish a reserve or a capital fund for such an endeavor. So thank you.
Thank you.
Anything further from the committee? Councillor Michelle, go ahead.
Thank you, Madam Mayor. Through you, on what Councillor Martin was mentioning regarding conversation with, I'm sorry, are you able to hear me?
I can now. It was echoing back there a little bit.
Okay. It still is. Okay,
Keep trying and
I'll try to correct that shortly. I'm just wondering if I could, through you, ask Linda if she could just give us a brief overview of what kinds of discussions have been had with the province through our local MPP's office.
And Lucy, I think that was actually for you, just.
Oh, was that directed at me? Sorry, my apologies. Yeah. Well, I will say that I did contact our MPP, and I will say he took my calls immediately. He was very polite. He was very open with me. And regarding our long-term care home, so we did talk about long-term care. I will say that we also talked about the hospital at one point. I had made the suggestions. This was way back at the beginning when I first introduced myself to him. I said, I have a dream that I would love to see a brand new hospital on the outskirts of town on a new plot of land. That's my actual vision, but didn't come across very well, I don't think. So I think then we'll start to look at the interior of the hospital and begin to work on that. And that's when I started to realize that, listen, you got me at a bit of a vulnerable time, because I don't understand why some communities get brand new hospitals that already have hospitals and we don't. This is what I don't understand. So that's why I think we could make this a different entity. I've already got a vision of what we could do with this facility and fix it up a bit and have a brand new one outside the town. But okay, that's another discussion. We will have another day. But that's what I was discussing with the RMPP at one point.
Thank you, Lucy. Thank you.
Councillor Huffman, go ahead. We are actually in the debate portion here, but I kind of let the question slide. So if you have a question, fine, but we'd like to get on with the debate and move this forward and get on with the rest of the agenda.
Thank you, Mayor Chop. Actually, I was just wondering, actually it's been brought to my attention by some constituents who are watching this meeting, who have posed the question to me that it is an election year. And that may be a wonderful time to maybe ask for a little bit more than we currently have on the table. So we're looking to kind of equal what the province is putting up. I think their pockets are a little bit deeper than ours here in Norfolk County. So I would almost like to make a little bit of a friendly amendment to the motion that's on the floor. I know that's a little bit odd because I put it on there, but that we request, we were talking about putting in 2 million if they put in, that we would match. Anyways, I would like to ask for more on behalf of the province. So if we could have a short discussion as to what we feel might be an amenable number. I think that, like you said, it's very well noted that we've been a conservative riding, and there's lots of things going on right now in the political landscape. And I think that that election is coming up in October 2022, and we need to be prepared.
The only challenge, Jason, do you have a suggestion there?
I left it fairly open. I gave a copy to I only wrote one copy, and I apologize. I did give it to our clerk for her to submit. I did not get into like a 2-for-1 or type of item. I just remind council that at this point in time, we have, we are reserving $500,000 a year, and the only motion that we have currently is a $5 million commitment for council. So we can't exceed that $5 million. It's just really about how quick would we give the hospital that $5 million. And I think the intent of it was we would quicken our pace of the $5 million if the province put money on the table.
Yeah, here the challenge, Councillor Huffman, would be sort of, changing just like we did with tapping into the legacy fund this year. You would be getting into additional challenges with that. What I will say though is, we do also not only need help with the hospital, but we have some pretty major water issues that we're also going to need some help from the Conservative government here going into an election year as well. I mean, the challenges with the hospital infrastructure from 1964, that's what we're facing. It almost sounds like the rec center debate versus that we're having now. I mean, that's the reality of all of our facilities here in Norfolk County and our water facilities as well. So I appreciate where you're coming from, but I don't think, hopefully, as much as they want to give, we certainly would be willing to take, but hopefully we can, I mean, even at least that $2 million match would be certainly a good start.
Okay. All right. Thanks.
Councillor Columbus, go ahead.
Thank you, Madam Mayor. And I do recall several years ago being on previous councils where this $5 million was pledged. And the one thing I remember that was spoken about around the table was that these dollars were not to be released until construction had actually been implemented.
Councillor Columbus, if I could just interrupt you, Jason just raised that point at the beginning. He did explain that from staff's perspective.
Yes.
But if...
And there must be a video or some newspaper article or something indicating that.
He explained that to council just a little while ago.
Okay, Madam Mayor, I had some technical difficulties and perhaps I missed that part.
I can get him. Jason, did you want to offer your perspective on that again?
Yeah, through the mayor to council. It wasn't in the original motion, but it was certainly in the debate that the intent was, it even made comment of providing receipts to council of the construction. You know, at the end of the day, what we're saying is, I believe the hospital could probably, at this point in time, provide some of the costs with regards to their soft cost and their, you know, their architectural and their design and all the things that they're going through now. You know, with these projects, and that's why in the motion it would be specific for this council to kind of amend that and give slightly new direction to staff to say, let's release the $3 million so that they can deal with those soft costs, those design costs, and then use that as part of their capital campaign ask to the public. So that the motion that I've drafted for the clerk would clarify that because it's one of those things when it's not in the original motion of council that was passed, it doesn't mention that. You have to go through the notes. I'd rather just make it very clean. And this one that says, yes, we'll give you X amount for this purpose. And you know, we trust the hospital is going to execute on that purpose going forward. But that would require, there's a new motion that I've drafted for the clerk just to clean that issue up if council so desires.
Thank you, Jason. As I said, I had some technical difficulties and didn't get that the first time. Appreciate it.
Councillor, or Teresa, sorry, I see your hand is up.
Yeah, sorry. I thought it might be best if I read the motion to see if Councillor Huffman, this is the intent of her motion before we carry on with further debate. So that council authorized the release of $3 million for the Norfolk County Hospital Revitalization Program, and that council will approve the release of the remaining $2 million if the hospital receives matching. Further, that if the province does not commit funds to the hospital can request the remaining $2 million from Norfolk County in the future.
Yeah, that seems to capture it all. Mayor Chop, did you feel that captures everything? Yeah.
Thanks, Teresa. Councillor Van Passen? Hopefully this is debate. I keep hearing questions and we're in the debate portion. We're going to be here all night.
No, I'll support the motion as it is. I think if you want to play the political clout, priority number 4 on the list is the Norfolk Hospital Nursing Home Redevelopment Project. I think that's where the province's priorities will be. They've recognized there's terrible deficiencies across the entire province. And if you want to be more generous with Norfolk County taxpayers' funding, maybe when an application is sent in by the hospital to upgrade those facilities, we could look at that as a separate issue and allocate this $5 million as to the proposals that are in front of us today. So that would be my point of view. And I noticed that Lucy was nodding her head, so hopefully I think we're all thinking on the same track here.
Listen, we're fighting over a $200,000 beach at this point in time. So whatever funding we get, I think will certainly be, you know, fantastic for the residents of Norfolk County. We have a lot of challenging projects in every different direction. So with that, Lucy, did you have anything you wanted to add in closing?
No, thank you.
All right, thanks. So with that, I'll call the vote. All those in favor? Oh, sorry, Jason, my apologies. I see your hand is up. Did you have something you want to add?
Sorry, through the mayor, please call the vote. I just want to make one comment prior to Ms. Bonanno and her team leaving.
Okay, all those in favor? And that is carried unanimously. I was just going to jump in there one more time, Jason, if I can. Lucy, do you have a website that is set up yet for donations? I know Councillor Martin asked that question, but I know when you do set up that website, I just had a note from our CAO that he wanted to donate here online as the first.
You took all the steam away from me, Mayor Chop. I've already I was going to give it to the public. I was gonna say that there is a and Lucy was too polite, but when I was taught to fundraise, it was ABC, always be getting commitments. Norfolk General Hospital site, once you click on it, you can choose the Build a Better Hospital campaign, which is the old campaign, which is going to get revamped. But I did want to give that out. So if you go to the Norfolk General Hospital Foundation page, there is a donation for that. And I do want to thank, I know the hospital is old and dated, and but unfortunately, I've had to experience the hospital twice since my tenure here in Norfolk County. So I have my donation on the page. I will complete donation now, and I'll be the first one after your presentation. So when you go back to the board, Lucy, you can justify your team's time at council that you got a few bucks. Unfortunately, I did not win the Lotto Max, so there's a few zeros short of your ask, but it'll be a start.
That sounds great. Thanks very much. That's super. Thank you.
Thanks, Jason. That's awesome. Okay.
We
Thanks
go
again,
now.
Lucy.
Okay.
Take care.
Bye. Bye.
Okay, next, I'm just out of line. Teresa, go ahead.
Through the mayor, we should receive that presentation.
Oh, sorry, my apologies. Is that what you were doing, Councillor Van Passen, I bet?
Yes, it was, Madam Mayor.
Okay, thank you. And I didn't know if it was wrapped up. Councillor Van and Rishi seconding that. All those in favor? That is carried. Now, I just want to, so we're going to skip over item 5B for now, correct, Teresa? Or we're going to hear the staff report immediately to follow?
I believe that was the intent, yes.
Okay. All right, welcome, Mr. Jealous. I will let you go ahead with your presentation, or your 5-minute deputation, rather.
Mayor Chop, members of council, thank you very much. I have some brief comments with respect to item 9D, CS 2136, and even briefer comments with respect to the draft plan conditions, item 9A, CD 2145. May I proceed? First of all, I'd like to start by just thanking staff and members of council for all the work that they have contributed in putting together a very complex proposal for Delhi. It has a lot of moving parts, as staff has mentioned. We've had a lot of meetings, and it was even more difficult with the virtual presentations like we have here this afternoon. Prior to the application presented today, Norfolk owns a strip of land from the end of Argyle out to Fertilizer Road, intended for a future street. For a very long time, there has been no formal plan to develop the lands around this area. Hopefully this afternoon that will change. With the proposed configuration of the right-of-way to Fertilizer Road, we can design a more comprehensive development that was originally possible with just a simple through street. With the proposed plan to realign Argyle Street to the south along the existing drainage easement, we can create greater diversity to the employment lands, and we can also create more diverse properties that will provide needed places to work, which will also provide taxes and development charges to the municipality, and this will be outlined in future applications to Norfolk County. Through this draft plan of subdivision for phase 3 and the future plan for phase 4, we're proposing a comprehensive plan that benefits development, Norfolk, and or the agricultural operations for the Vanderbilts. This extension to Argyle Avenue and the realignment of the roads to Fertilizer Road benefits Norfolk in many ways, only one being the elimination of the environmental assessment needed to create any future roads in this area. There's also benefit to the property owner, David and Jennifer Vanderbilt, by providing an alternate route to Fertilizer Road that does not bisect their farming operations, which is very important for them. In addition to the conditions of draft plan of subdivision, the Vanderbilts and our family have also agreed to convey lands to Norfolk County all the way from the Bluegrass Estates through to Fertilizer Road, and this will continue to fully protect the interests of Norfolk County until we can sit down with staff and work through the best possible use of lands to that new way to the south, and that would be in the phase 4 negotiations. When all the conditions of the draft plan are fulfilled, almost twice the area of land will be returned to Norfolk County, as they will be contributing to assist this development. Therefore, our preference in the presentation by Lydia Harrison would be, in the 3 options that she mentioned to council, would be option 2, which is to convey these lands to the developer with the valuation by council to be at no cost. And the reasoning for that is noted in my letter that you have attached to your report, because we will be returning large areas back to Norfolk, and most of them will be paved, dedicated new streets, ready for new homes and new development. With respect to the draft plan conditions, we have reviewed those conditions of draft plan and are satisfied with recommendations by staff. We would respectfully like to make one more request on behalf of the owners, David and Jennifer Vanderbilt. Since they will be contributing additional lands to the south along that drainage right away, all the way to Fertilizer Road at no cost to Norfolk County, the Vanderbilts would like to request the lease of the old remainder part of Fertilizer Road back to them at the same time that the registration of the plan of subdivision that you have before you for phase 3 happens, and they would respectfully request of council to release these lands from Norfolk County at no cost to the Vanderbilts. So thank you again for your consideration of these requests, not only by the owner, but thank you for your consideration of this application. And myself and Bob Phillips from Kahuna Engineer, the design engineer, are here to answer any questions.
Any questions from the committee? Councillor Columbus?
Yes, thank you, Madam Mayor. And Joe, when do you anticipate the reconstruction of Argyle onto Fertilizer Road?
Well, we're going to be starting the phase 3 as soon as we can with all the approvals that are in place. As soon as all the lands are assembled together from Norfolk, we can start all the procedures, not just the design, but also the certification of titles. We're really hoping to start earthwork and servicing full-time right through the winter time. We still have to negotiate with Norfolk County and put all the mechanisms in place for phase 4. In other words, that dog leg that goes to Fertilizer Road. But we were going to start those consultations as soon as we get the phase 3 underway.
Thank you.
Councillor Van Passen, go ahead.
Thank you, Madam Mayor, and through you to the deputation. I wasn't sure if I wanted to talk about this now or when we actually looked at the application, but you know, I like the idea of getting the road out to Fertilizer Road. It's long overdue. It's been in the planning stages forever. Would you be amenable to putting that road in first before you start phase 3? Or as part of the installation of the infrastructure of phase 3, so that I don't want a piece of road and then another piece of road for phase 4 and another piece of road for phase 5. I want the road in all the way to Fertilizer Road first, and then we can release all those other things. Would you be amenable to that type of idea?
Thank you very much for your question. It is a good question. 2 things maybe hinder that. One is cost. I'm not a large developer with very deep pockets that, you know, some other developers might be. We're just a family operation. So once I have phase 3 underway and the funds coming in from that phase 3, then all of a sudden we have funds to reinvest, as we've always done, into additional works in Delhi. But also we haven't negotiated with Norfolk about how to, Norfolk will have that right of way or those lands, but we have to go through the design process with Norfolk before we can even contemplate any type of construction there. But phase 3 is ready to go. So if we can start phase 3, we're going to be right behind it with that dog leg going to Fertilizer Road. I hope that answers your question, sir.
Well, maybe we can discuss it more later on a different debate. Right now, we're working on your deputation. So.
Thank you, Mr. Jealous. I will say I don't fault you for coming. You know, you're doing your job there. I can't say that you know, I'm supportive, to be honest, of the recommendation or the asks that are in there myself. But at this point, I think we'll hold off and hear the presentation from county staff. So if I could have a mover and a seconder for the deputation. Moved by Councillor Huffman, seconded by Councillor Martin. All those in favor? And the first staff report, Teresa, help me out. I think it's 2145 is going to be up first.
Through the chair, I believe 2136 is the order in which staff wanted to review the matter.
Okay. Okay, that sounds good. Lydia, is that yourself?
Yes, it is. Thank you, Mayor Chop, and good afternoon, everyone. Report CS 2136 is in follow-up to report CS 2121, presented at the April 7th Public Hearing Committee meeting with respect to the application by Joe Jealous for the closing of Baldwin Street and parts of McIntosh Drive, Russett Drive, and Duchess Drive on Plan 334 in Delhi, and the further acquisition of a portion of county-owned lands that were to facilitate the extension of Argyle Avenue to the Fertilizer Road for the purposes of the proposed subdivision development for the area. This report is being presented to Council in tandem with the planning application report as well. If I can take a second, I would just like to share my screen and put the report up there, if I can find it. Let's see. I'm not sure if it's on the screen or not right now.
We're not getting anything.
No? Okay. Well then, I won't take any more time. Okay, I'll continue on. Bluegrass Estates is now in a position to move forward with phase 3 of its subdivision development in Delhi and requires to acquire a land assembly parcel owned by David Van de Velde and Norfolk County. Lands to be acquired from Norfolk County include the streets and portion of streets as illustrated on the mapping shown within the report, and also a portion of land required for the extension of Argyle Avenue. The portions of streets are on open streets as set out on Plan 334, owned by Norfolk County, and they're shown as parts 2, 4, 6, and 9 in Figure 1 on the mapping in the report. Norfolk County is also the owner of a strip of land which extends from the current termination of Argyle Avenue to the Fertilizer Road for the future expansion of Argyle Avenue, and this is shown as Part 12 in Figure 1. The sale of these streets within Plan 334 is a fairly straightforward request to Council for closure and conveyance. The sale of the strip of land, Part 12, is somewhat more complicated in that the county does not want to lose its potential for any future access to the Fertilizer Road. Council may want to consider retaining an option to purchase these lands back in the event that Mr. Jealous does not proceed with the Phase 3 development, or the development is stalled and Mr. Jealous loses ownership of the land due to any default under any mortgage situation. A slight change has occurred in the parcel acquisition since April 7th public hearing meeting, and Mr. Jealous will now be acquiring parts B and C from Mr. Van de Velde, and they're shown on Figure 2 in the report. And he will be including these lands in the Phase 3 development so that the connection to the Fertilizer Road can be completed earlier. Mr. Vandervelde has requested that the portion of the extension of Argyle Street, shown as Part A on Figure 2 in the report, be conveyed back to him to allow him to have a continuous parcel to carry on his farming operations. This sale of land can be accommodated. However, the county would not complete the reconveyance to Mr. Vandervelde of Part A until Parts B and C of Phase 3 of the subdivision are built out and the connection to Fertilizer Road is established. In the interim, staff recommend that Mr. Vandervelde enter into a license agreement for the use of Part A for his farming operations until such times as this parcel is reconveyed to him. Staff recommend that the lands, as shown as Part A, be sold to Mr. Vandervelde at the $30,000 per acre valuation that was originally paid by the county, and that license agreement be at a valuation of $200 per acre per annum. A table has been included within the report to reflect various valuation options that council may consider with respect to the county-owned lands to be acquired by Mr. Jealous. However, to remain consistent with the council-approved valuations as set out in report EBS 1614, staff are recommending that the unopened streets be sold at the council-approved $1.25 per square foot valuation, and the strip of land that was acquired by the extension of Argyle Avenue be sold at the $30,000 per acre value that the county paid to acquire these lands in 2010. Mr. Jealous, at the public hearing committee meeting of April 7th, expressed that there be a straight exchange of lands between the county and himself, excuse me, and has requested to pay for only the surplus land area between the lands to be acquired from the county and the lands that would be returned to the county as roads in the new registered plan of subdivision. The report sets out an approximate difference in the areas and provides a valuation for council's consideration. There are a lot of moving parts that need to come together for phase 3 of the development to move forward, and the proposed land acquisitions and exchanges of county-owned lands are ultimately required to allow this development to proceed. And with that, staff will take any questions that council may have. Thank you.
Okay, before we begin with questions, I think we're going to hear the second staff report. So Mohammed, are you on the line?
Yes, Madam Mayor. Good afternoon. This report is being presented to the council with a recommendation for proposed development known as Burgos State Phase 3 to permit 40 single detached and 9 semi-detached lots and 1 reserve lot for future development. The subdivision application is associated with the zoning bylaw application to change the subject land from development zone to residential type 1 and residential type 2 zone. Earlier, the proposal has been presented in a public hearing on April 7, 2021. The key issue discussed in the public hearing was to identify a mechanism of how the extension of Argyle Avenue to Fertilizer Road will be secured through this draft plan of subdivision. We had several meetings with the applicant on this matter, and a solution has been proposed by the applicant, as Lydia already described, that will include an extension of Argyle Avenue up to Fertilizer Road within Phase 3 subdivision application. Adding this extension in Phase 3 will ensure that the road connection will be constructed in Phase 3 before any further developments. This extension is shown as Street A in the draft plan subdivision in Appendix C. Maybe it would be beneficial if I can share the screen.
Just so you know, Mohammed, we can't see your presentation if you're actually scrolling through something.
Click on the window. Click on the window. There you go. That don't work there.
There we go.
All right. So this is the proposed subdivision that includes the extension of Argyle Avenue from the unopened Argyle Avenue at the the north side up to the south, and then further to the east to Fertilizer Road. So that's the new extension has been added with the previous subdivision plan that we showed in our previous in the public hearing. A part of the extension is shown in block 55, that is at the south side near Fertilizer Road. That will be a resultant of a severance application that the applicant already submitted, and that will be presented on the Committee of Adjustment on June 16th. And this will be a condition that has to be fulfilled as a condition of the draft plan of subdivision. We also included a condition to the owner that the owner shall ensure all road allowance, including Argyle Avenue extension that is shown on the screen right now, will be constructed as per the development agreement and dedicated to the county. We also recommended that a holding provision on the subject land until successfully execution of the development agreement, including confirmation of the construction and conveyance of the Argyle Avenue extension as a public right-of-way. In short, this Argyle Avenue extension is proposed to be secured through a registered development agreement and a holding on the subject land, and the construction will be confirmed before the removal of the holding. We have received all agency comments, and there is no major concerns raised by the staff and agencies. A comprehensive stormwater management plan and report and implementation of its recommendations are conditions of the final approval of the subdivision. The applicant also agrees to implement a landscape plan and cost of tree plantation for all lots to Norfolk County. All sidewalks, accessibility measures, and street lights will be designed and constructed as per Norfolk County design standards. Through Madam Chair, in planning staff's opinion, the proposed development confirms the goals and objectives of the official plan and consistent to the PPS policies by proposing new development within the settlement area and contributing to the housing demand in the region. The proposed development also addressed the coordination between housing growth and the provision of infrastructure through this Argyle Avenue Road extension. Therefore, the report CD 2145 is being presented to the Council with recommendations that the proposed draft plan of subdivision application be approved with conditions attached in Appendix B, and the proposed zoning bylaw amendment application be approved with the holding provision as attached in Appendix A for the reasons set out in the report. That's everything from me, and I'll be happy to answer any questions.
Thank you, both to you and Lydia. I just want to ensure that we're on the same page here for council, but when we make the decision, we are going to have to make the decision on the sale first, because correct me if I'm wrong, Mohammed, but authorizing the sale of the old right-of-way is needed because it's included as part of that proposal, correct?
Correct.
Okay. I just have a quick question for Lydia before we get started. Lydia, the $30,000 valuation that's being applied, that was actually how many years ago was that Norfolk County paid that amount of money? The taxpayers of Norfolk paid that amount of money. Was it 10 years ago?
That transfer of land happened in 2010, Mayor Chop. So we're looking at 11 years or so now.
So we're offering the lands at the same price that we paid for them back 11 years ago.
Through the chair, yes, that is correct. Yeah.
Sounds like a fair deal to me. I always find it interesting when I hear about us gaining roads as an asset, because to me, I'd rather the developers kept all of their roads. We need fewer roads in Norfolk, not more. Mohammed, would you be able to answer? I don't know if you have this information or not, but in Mr. Jellis's letter, the one thing I did pick up on was that he says, over the course of the Bluegrass development, we've worked along with Norfolk County to extend municipal services to all phases of the development in this area of Delhi. And that, sorry, the previous sentence was that, you know, it was designed for estate lots, which means there was going to be much fewer of the lots for sale back then. Do you know what the difference is in the density that's occurring now? and I ask this only because, you know, this idea of development paying for development is not really entirely accurate. So I'm just curious how much sort of work went in from the county up until this point to ensure that this additional, you know, density was available to the developer.
So, Madam Chair, yes, the proposed density currently is around 13 unit per hectare, which is much higher than the previous state proposal before.
So there is a significant benefit that's
There is a
occurred
significant
as well.
yes.
Thank you very much. Councillor Van den Riesche, I'll go to you first.
Thank you, Madam Chair. Through you to anyone that can answer it to me, I'm concerned about the valuation number as well. Is that a customary number that's used in other developments in other municipalities? The value price of that land seems, I know it was assessed 10 years ago, but is it not low?
Lydia, I'll take that. I'll pass that to you.
Yes, thank you, Mayor Chop, and through to Councillor Van den Riesche. Yes, those evaluations that are in the report were approved by council in 2016, actually, under report EBS 1614, and are the valuations that council approved at that time and still are in effect today. So those are the figures that I have to use in determining price for sales and what I recommend to council as well.
Now, Lydia, perhaps for Councillor Van den Riesche's benefit, since she hasn't been here, council did, I believe we made a motion, if not, we provided direction that we wanted to have those numbers reevaluated, did we not?
Through the mayor to council, yes, you did. At the April meeting, staff was directed to look into those valuations to see if there would be any differences now. I have reached out and have received some information, was planning to bring a report likely in September to give those valuations to council. But for the purposes of today's report, wanted to go forward with the existing valuations as we have them today.
It would be my recommendation that at some point in time there be a review done, considering the numbers and what's changing in housing today.
Yeah, Councillor Van den Riesche, that's what you said. We have already directed staff, so that will be coming back to council.
That'll be well appreciated. Next question I have is, when you said the density of housing, what is it? I'm under the impression that years ago, off of 1 acre, you got how many housings? And how many today?
So the change in this plan, just so you're aware, was more that this was designed for estate lots until such time as municipal services have now been brought down. So estate lots to an actual draft plan of subdivision, that's a significant difference that's occurring. And again, that's as a result of the municipal services being available.
Can I get a number? What is the size of an estate lot today? Mohammed, directed to Mohammed.
Through Madam Chair, I'm not sure exact amount of law being proposed before. Maybe, I mean, Mr. Jealous might answer that question, but the current one is 40 single detached and 9 semi-detached units. That means 18 units, semi-detached 18 units. Altogether, it would be around 58 units for the whole subdivision, phase 3.
58 units, and how many acres is 58 units going on?
So the density will be 13 unit per hectare.
13 per hectare?
Correct.
It's still commonplace. Okay, thank you.
Councillor Columbus, go ahead.
Thank you, Madam Mayor. A question to Lydia, I guess. Have you discussed in detail with the Vandevelds regarding this, the transfer of the property, the section that we're closing off and trading back into the redevelopment of Argyle? Are they aware of the costs associated with that, where you mentioned $30,000 per acre?
Through the mayor to Councillor Columbus, at the very initial start of this process for the closure of the streets and the sales, Mr. Vandeveld authorized Mr. Jealous to be his representative. So it has been through Mr. Jealous that I have been working with. And I would have expected that he would have been in discussion with Mr. Vandeveld. I did a couple of weeks ago receive a telephone inquiry from Mrs. Vanderveld. We did discuss briefly the transfer of the portion of land back to them. And I did indicate to her that the county would likely be looking for some consideration for that strip of land as well.
Okay, and you haven't heard back from them, I take it?
Through the mayor to Council Columbus, no, I have not.
Because she just sent me an email here. We gave the lower portion to Joe Jealous for free to complete the extension. We're looking for a land swap back for the piece we gave to the piece we will be getting back, is what she writes.
Right, that was the
She's
deputation
watching the
presented.
Yeah. So I'm just wondering whether she's got all the details and whether everything is accurate as possible. So perhaps Mr. Jealous, I don't know if he's still around, can comment on his communication with the Vandevelds.
Okay, Mr. Jealous is representing the Vanderbilt, so if that's who they've sent on their behalf to have representing, but it's quite clear that is the exact same ask that was in Mr. Jealous's presentation, is they are looking for a land swap. It's up to you to decide. I mean, you're offering it back to them at the same price that the taxpayers paid for the land 10 years ago, which I think is a pretty good deal. And us acquiring additional roads doesn't really benefit our situation. I understand it's going to provide some additional connectivity, but we also have a developer in Port Dover that just, has paying $200,000 to even use our roads during that development period for construction. So, I don't know, that's the question you have to ask yourself. That is the exact ask that Mr. Jealous presented, is whether you want to ignore staff's recommendation and the valuations that are presented, and you want to exchange the land, or whether you feel that's a fair valuation for what they're getting, which is really an significant increase in number of lots as well. Councillor Van Passen.
Yes, thank you, Madam Mayor. I don't know who I should direct this question to, but I just want to make sure I got the process straight in my head. So I want to be a developer in Delhi. I go buy 10 acres of land, jump through all the hoops to get a plan of subdivision approved and deal with the council and with committee of adjustment. And then I start building, and I have my nice lots all laid out, and I am required to put in the infrastructure, the water, the sewer, street lights, sidewalks, and roads. And when that's done, I deed those roads over to the county for no charge. Is that correct?
That is what happens in all subdivisions. Yes, generally we don't give them the land for the roads.
So at some point, a developer on the existing sort of plan of subdivision did deed those roads over to Norfolk County, and now they want to change the layout and change out the roads. Now, I'm willing to look at that portion of it where they're trading, like part of Russet Street is going to be closed, part of it's not. That's one situation, but not the whole shebang. But I will bring up the point. Again, if we want to talk about punching that road all the way to Fertilizer Road, first, before you start building houses, so that is complete, that the county's not going to sit around and the residents of this county don't have to wait another 10 or 15 years before they can drive and get out of Delhi that way, because that's what they've been waiting for, that's what they've been promised, and that allows us to complete all the land deals and not do the leases, not worry about a buyback clause, and just get it done. If you want to sit down and haggle about that, then let's sit down and talk about it. But other than that, I think the valuation, I think the mayor is right, because I've noticed, at least around this part of Woodhouse Township, maybe it's a little different in Delhi, but the price of real estate's gone up a little bit since 2010 around where I am. So maybe maybe Mike could comment whether Delhi is the same, but even farmlands had gone up a little bit since 2010. So I'm not sure working with the same valuations from 10 years ago is really correct. So those would be my comments for now. So.
Yeah, 38,000 over, or 30,000 over 50 homes is. Jason, I see your hands up.
Yeah, I just want to point out a small technical issue that we have here at Norfolk County because of past practices. Normally, what Councillor Van Passen said is correct. Normally, what you would also do is when a street is assumed back by the county or a road is assumed by the county, there's actually a bylaw that is created that recognizes the assumption of the road. We don't do that here in Norfolk County. It's something that staff is going to bring back because it's difficult to understand sometimes which roads have been assumed and have done the formal assumption process. There is a checklist that Public Works goes through to say, yes, we've tested these roads, it was built to spec. We do that currently, but then there's not the formal recognition that, yes, this road was transferred sometime. So it is something that we would need to work on a bit here. And I can circle with staff on your question of whether some of those roads were actually assumed by the county or were just still part of the plan and have not been assumed by the county. And that's where it gets difficult in these situations.
Sorry, I don't see any other hands up. So again, we have to deal with the staff reports now first with the property sale first, because that impacts the approval of the development application. So again, that was the request, the request from Mr. Jealous previously. Just if everybody looks to page 176 and 177, it's well over a page recommendation from staff, so I'm not going to read that. So does somebody wish to move the staff recommendation or propose an alternative? Councillor Columbus, you're moving the staff recommendation? Okay, thank you. Seconded by Councillor Taylor. Any further discussion on that? All those in favor? Any opposed? Okay, and that is carried with one opposed. The next is the development application. Sorry, I'm just missing my page now again. I thought I had it both out. And starts on page 76, and the motion. The motion is on page 88 for those that are interested. So now that the sale of the road has been approved, does somebody wish to move the staff recommendation or propose an alternative? Councillor Columbus, seconded by Councillor Taylor. Further discussion on that? Okay, all those in favor? And that is carried unanimously. Mr. Jealous, thanks for joining us again. I don't fault you for coming and trying. I know I'm a tough coach. I don't know what the
Thank you, Mayor, and thank you, Mayor, for the council.
Have a great day, and we'll move on with the next deputation, and that's Mr. Valley. Welcome.
Thank you, Mayor Chop, members of council. I'd just like to share my screen with you here briefly.
I know you know the rules, John, but just remember it's 5 minutes for the presentations now. I know it's changed from your early days here.
Yes, and I was actually gonna, can you see my screen now?
We have too many presenters on the same subject to go for more than 5 minutes, so.
I was just going to ask because actually one of my clients, Ronak and Darpen, who are actually listed as a deputation, have elected not to speak. And I am representing 4 different clients here instead of all of them showing up for their own 5 minutes. So I will be less than 10 for sure. Anyway, can you see my screen now?
Well, we would need a motion of council, so it's not just anyway. That is the new procedural rule, so you would have to get somebody from council to ask that. My feeling is still there's too many deputations. If you come forward with that request in advance and we remove some of them from the list, that would have been one thing. But that is to council. I just, the procedural rules are the procedural rules for a reason. You know, we're at 5 o'clock and we still have a whole agenda to get to. Councillor Columbus.
Yes, I'd like to ask the clerk, do we, Mr. Valley mentioned that he's representing more parties than just one. So do we know from the clerk whether we are getting the rest of the deputations that are in our agenda package? Or is he representing them also?
Through the mayor to Councillor Columbus, I have not been advised of that in advance. I'm not seeing anything from our deputy clerk either, so I have not been advised that anybody's been moved off the list at this time.
Thank you.
Councillor Martin.
I think we'll spend more time probably discussing it. I'll move the motion if he's less than 10 minutes to support it. If it's seconded, great. If not, fine.
Councillor Vanden Riesche is seconding. All those in favor? 1, 2, 3, 4, 5. There you go, John. Motion carries. So.
Thank you very much, Mayor Chop.
And that's with the condition that, sorry, which is the deputation that's not going to be presenting?
They're listed as Ronick and Darpan on your agenda. There are a couple of deputations after me. And can you see my screen now? Okay, very good. So thank you, Council. My name is John Valley. I'm here to talk to you about the concerns and some of our comments that have come out of your staff report that you received last week at committee. And it talks about water supply. And what we're concerned about is I'll say the panic that this has set into some of our clients. In that report in Simcoe, staff make the comment that the system is capable of meeting development needs for the community for projects that are currently committed or in progress. And that's the key phrase, currently committed or in progress. In Port Rowan, it's exactly the same thing. Developments that are currently committed or in progress have the ability to proceed. So we're asking, what does that mean, committed or in progress? So staff have said that committed means it's a registered plan of subdivision, or committed means it's a signed development agreement in place. And those things can be very different. They're not the same. They can be, some have one, some have the other, some have neither. Staff have told us that they're expecting a report to come out in fall of this year that will talk about this transition from a project being termed in progress to one that is actually has committed allocation. So apparently those ones that are in progress now don't actually have capacity somehow. And we're going to have to wait till the fall to sort that out. We're being told that in Port Rowan, any application that's made now for site plan approval will be deemed premature. And what premature means is the staff will not accept the application. They won't even allow us to apply. And that obviously is a huge concern for someone who's been working on a project for a number of months or years. So we're assuming that when staff did their report and they said, all these projects that are committed or in progress, we can accommodate them all. They must have a list. They must know which ones are can be accommodated and how, and the flows from each one of those. So each development would have its own water demand. And they've determined what can fit within the existing plant capacity. We're simply wanting to know who is on that list, who can go ahead and who cannot. So a couple of examples. I think there's 3 or 4 example projects here. Sutton Trail condominium in Simcoe. This is on Hunt Street in behind the old Minden Manor. Norfolk County has approved the zoning for this project. We went to a pre-con back in July of 19 and talked about the site plan application. Water was not an issue at the time. Our developer then has since hired Norfolk County's consultant to do a water modeling of the system. And again, they were told there's no problem with water supply. And back in December of last year, our client made a formal site plan approval application to Norfolk. That was just before Christmas. Today, we're waiting on the results of that application. We're waiting for a response from Norfolk County. And because we have not got an approval of or any response to the engineering design, there's no signed development agreement in place. But this project has clearly been going on for a number of years. We believe it's an in-progress project and should be allowed to proceed. The developer is simply looking for confirmation that he is considered in progress and that he can go ahead, but he doesn't have that. And obviously that's of great concern. Another project, MDR Townhouses in Port Rowan. Council will remember this project. Norfolk County approved the zoning for this project back in 2020. At the staff report at that time confirmed that there was sufficient water plant capacity for the development. Council specifically asked about this, and they were told after this development occurs, there'll be a remaining 51 cubic meters per day available for other development. At the time, development engineering staff told council that there were no concerns with servicing the site, and Norfolk Water Modeling Consultant also said no concerns. This very same developer owned a piece of property, still does own a piece of property in Port Dover, and of course got entangled in the challenges that were there with development. And so he looked somewhere else in Norfolk for more development land. He went to Port Rowan, and ironically, he purchased this land based on Norfolk confirming that there was servicing capacity available to him at the zoning stage. That's why he bought the land. He's in the process right now of preparing the detailed site plan application that will be submitted in July. But he's being told that this may be a premature application that will not even be accepted. County may not even take it in. And that there's no plan in place to actually increase the water supply in Port Rowan, and therefore he's in a real pickle. So he's wanting to know why, when he got his zoning, he was told that there was lots of capacity for him and that he could go ahead, and now that seems to be changing. We believe again that this is an in-progress project and it should be allowed to proceed. Another one, Toyo Tetsu. So this is a very new application. I'm speaking tonight on behalf of Mr. Edward Vilapavlovic, who is the Assistant Vice President at Toyo Tetsu. There was some mix-up. He actually wanted to appear as a deputation today, but that did not occur. Toyo Tetsu, I'm sure you're all aware, is out on Park Road in Simcoe. We think it's Norfolk's largest employer at over 1,000 employees. They are proposing to do a plant expansion and an office expansion project. Of course, this will create roughly 100 new jobs in Norfolk County. And it will also increase the water usage of the plant at this early stage, guessing roughly equivalent to about 6 new homes. Water usage equivalent to about 6 new homes. However, we've had a couple of meetings with staff, and they've been very encouraging, that they want to support this development. But we need to be building this fall to meet Toyo Tetsu's guidelines from their head office. We can't wait for a staff report to come in the fall to say who can have allocation and who can't. We need to be building this fall, not looking for more approvals this fall. And in fact, the builder is planning on ordering structural steel for the building as early as next week. Obviously, this is a priority project for economic development, and it's very much a huge rush for this company. We just simply need to know, is the county going to allow this project to proceed, given the criteria that were set out in the staff report and the comments that we have received from staff since. Another project is Judd Drive in Simcoe. This is the subdivision here. For reference, Walmart is here. The Al Shoes Plaza in Rolston's is here. Canadian Tire Plaza over here. This little piece of road right here, 19 lots on it. This is actually a registered plan of subdivision. It was registered years ago and never developed. Our new client is now in the process of developing the engineering drawings, but there's no signed development agreement yet. We're in detailed design stage and looking for Norfolk's final approval on design. Again, because it's a registered plan of subdivision, and staff have said if you have a registered plan, you have allocation. Is this committed? How does this one fall within the guidelines? This is our challenge. The developer needs to know where he stands. So in summary, we've got this idea that if you're a committed project or if you're in progress, that we can be accommodated for water. That's what the staff report says. And we're simply trying to figure out what that means and who is on the list. Is it just a registered agreement? Is it something else? Are we waiting for a staff report from the fall before we know what we're doing? Developers need some assurance and some of them need it right away. TTCA, Toyo Tetsu, again, they want to order structural steel next week for a large plant expansion. They need to know what's going on and they can't wait till the fall. Sutton Trail, that condo, they've already been waiting for 6 months for a response to their site plan application. So they need to get moving as well. And the guy in MDR down in Port Rowan, he bought his land because Norfolk told him they had water capacity. So that's a challenge for him as well. What we're looking for is for Norfolk simply to identify who these in-progress projects are. Who is it that they've allowed for in their calculations to say that they can be accommodated? We want to know who's on the list. And developers need to know where they stand.
Mr. Valley, you have 1 minute left remaining.
Thank you. TTCA needs to proceed immediately with their expansion projects. We can't wait till September. And there we go, under 10 minutes. So thank you very much. And we're here to answer questions. We do appreciate all the time staff has spent over the last week trying to answer our questions to many emails, but we do have a lot of clients that are very concerned.
I'm thinking, given there's so many deputations along the water, Mr. Valley, why don't you remain online and perhaps we'll hear the other deputations regarding the water as well. And then if council has questions of the particular deputations, they can ask them at that time. So we'll move on with the next deputation. And Mr. O'Hara, I believe you're next on the list.
Thanks for the opportunity to speak tonight. I will keep this very short. I know you have a long agenda. First of all, thanks for bringing this issue to fruition. I know that you're working on a solution. That's great. We agree that Port Dover and Simcoe are a priority. You know that I certainly have a soft spot for Waterford. Obviously, this is where we've got 3 current developments and working on a 4th. We are concerned that Waterford wasn't mentioned in last week's presentation. We understand that Waterford currently has water, and however, it will run out if all of our projects proceed. A recent hydrology report suggests that this is the case, that we have enough for at least 3 of 5 phases of our large development, concession 7, if that comes to pass. Waterford currently has wastewater, but we'll run out of that. We can solve wastewater, however, we cannot solve water. We understand the intent is to include Waterford in phase 2 in the Nanticoke pipeline, and we would like to ensure that occurs. We ask that all the planning take place for the pipeline, for the projected pipeline during budgeting and planning processes, so that we are part of the solution. We know that it comes on the way to Simcoe. It goes through Bloomsburg, so we are not that far away. We're a firm believer that developers should certainly pay their way. And we respectfully suggest that $5,000 be added to every development fee moving forward, and this start in January of 22, as long as council agrees to build the entire pipeline. We currently have development fees of approximately $20,000 a door, and feel that developers can absorb this additional $5,000 if they're granted access to water and wastewater. By my personal calculations, I feel that approximately 6,000 homes or more will be built in Norfolk over the next 15 to 20 years. This $5,000 added to development fees will generate $30 million for you to pay for the pipeline. We also feel that housing is key to a key building block for economic development, and our developments alone, we feel will generate about $500 million in ECDev. And we certainly are one of the largest hiring agents in Norfolk and want to continue to do so. Thank you very much.
Thanks, Tom. Councillor Hoffman, is there something in the water in Waterford? So
Yeah.
we are reviewing obviously our development charges again. I certainly have kind of changed my viewpoint actually from what I had a couple of years ago, and you know, I'm going to hold you to those statements in pretty due course when that comes forward. So thanks, Tom, for your presentation. And I know Waterford wasn't included in the report itself, but we did discuss it because I remember mentioning myself as well that Waterford wasn't in there, but certainly has been a concern of mine as well. So thank you.
Thank you.
The next person I have on the list, okay, this is the deputation that is not arriving. We're going to go to then Lee Greenwood. Lee, are you on the line? If you are on mute. Okay, I'm going to skip to the next deputation and we'll come back to Lee again. I'm scared to even try to pronounce this, but Letty. Are there any of the other two deputations online in regards to water?
Yes, Sam Bunting here.
Oh, sorry, Sam, I forgot yourself as well. Yep, go ahead.
Okay. Good afternoon, Madam Mayor and fellow council members. Sam Bunting here, owner of Prominent Homes, but speaking to you on behalf of the Haldeman Norfolk Home Builders Association. Thank you for having me, and thank you for staff for adding me in late. Appreciate your time and consideration. Through the Haldeman Norfolk Home Builders Association, we have helped influence many positive changes within Norfolk County over the years. From the introduction of the zoning department to an increase of staff to the building department. We appreciate this council and previous councils for listening to our concerns and you know, for working closely with our association to rectify them. Norfolk County and home builders have greatly benefited significantly from the new demand in the local home building construction industry. The home building industry has remained strong through some difficult lockdowns and seemingly endless shortages in materials. Despite these obstacles, many local home builders have maintained our responsibilities to our customers and local business owners that we work hand in hand with. As home builders, we provide many local tradespeople and businesses with jobs. We feel it's our responsibility to these local businesses to maintain a steady amount. As home builders, we have concerns that there may not be enough opportunity to maintain and continue to provide jobs for our local trade to the water shortage.
Sam, sorry, we're just losing you there. You're fading out.
Oh, my
I
apologies.
think it ended at we're afraid.
Okay. Let me back it up here. Maybe I'll just go through the last paragraph again.
You sound better now. It's like you're close or something. Thanks.
Okay, great. Thank you. As home builders, we have concerns that there may not be enough opportunities to maintain and continue to provide jobs for our employees, our local tradespeople, and our local businesses due to these water supply shortages that we're facing in Norfolk County. As the head of my business, it's my job to look into the future and secure enough work. I need to be confident to invest in developments within Norfolk County, but these water supply shortages, with them, I do not feel as confident to move forward. Quite frankly, I don't know how any other developer feels as confident. Water supply shortages, if they're not dealt with responsibly and quickly, they can create significant problems. By responsibly, I mean, I'm suggesting that Norfolk County Public Safety Act looking at other towns now that we know.
Again, Sam, if they're not dealt with responsibly, and then we've lost you.
Can you hear me?
Yeah, I can again now, yep.
My apologies. Something must be happening here. Basically, we're looking for Norfolk County to proactively look into other towns and make sure that, we're not facing these water supply shortages in the future. We're well aware of where we're at now with Port Dover and Simcoe. Can we make sure that we address Waterford, Port Roland and these other areas quickly so that we don't lose the opportunity to build? My purpose in speaking to you today is just to communicate the significant impact these water shortages have on us local builders, to give you a sense of urgency that we need these shortages dealt with as quickly as possible, and to respectfully acknowledge that, it's Norfolk County's, your responsibility, Norfolk County staff responsibility to, to us as home builders and to, all the people that we employ too. And we appreciate the jobs you guys are doing. So thank you very much for hearing my deputation.
Thanks, Sam. I mean, the one thing I can say, I don't think, especially again in terms of Waterford and that full connectivity of the pipeline, whether that ends up from Haldeman or from Dover in the end, I mean, that small piece is still undetermined, but ultimately we have to get the county, the county should have been off well-based systems years ago. So, a report back in 2007, when there was first talks with Haldeman, I said this at last council meeting, but they said that if we moved forward at that time, if the decision had been made the year that all of the interconnectivity would have happened and all these towns would have had secure water supplies, was actually 2021. I mean, that's the problem with water, is it takes years of planning, and here we are thrust into it. So, I know it's taking some time to make the decisions, but ultimately, that's where we've now learned, it wasn't just about Dover, and that was the problem in the beginning, bring the pipeline to Dover, but we see Simcoe and is big a challenge a spot, and by bringing the pipeline to Dover is not going to get development moving again. So by waiting, we at least were able to see how can we solve the problems for each of the communities that are in desperate need, and then get to the other ones like Waterford, which may not be as desperate as Simcoe and Port Dover, but certainly is also in a challenging position. I mean, we had 3 of our 5 water and wastewater treatment plants that were rated at medium to high risk. So thanks.
That's good news. And you know what, I feel for Norfolk County staff that, are giving their commitments, and it seems like that their commitments, aren't being honored, but it's not really their fault, which, I feel for their staff.
100%. And the other thing, just to help reassure you guys, I mean, you saw in the budget for the water and wastewater rates, you saw that 10-year trajectory. Here was the bad news delivered up front. Expect these increases year over year over year, because that was the full amount to build out the full pipeline.
That's understood. Thank you very much.
Thanks. Okay, so is there anyone else then online with the water deputations?
Through the mayor, I believe the one deputation rejoined the meeting, and I do not want to pronounce the last name in case I screw that up. So
I'm just going to stick with the first name, Letty.
Yep.
Would you like to go ahead, please, sir? Okay, Letty, you're on mute. I'm going to try to unmute you if I can. But I can't. Letty, I see you're online. Are you able to begin your deputation? Okay, council, why don't we take, if anybody needs a bathroom break, we'll take just a 5-minute break. We'll come back, we'll hear that deputation, we'll receive them all as information. Then if council wants to ask questions of any of the deputations, you have the floor to do so, and or ask staff of any questions. So we'll just we'll come back at 5:30. And if that Teresa, maybe you could try to work with them to get them online. Thanks. And if you still need a break, let me know.
Letty, are you there now? You're still on mute. I can't unmute you. Kevin, I don't know if you're on still, but can you try unmuting? And through the mayor, Letty is on the line now.
Thanks, Teresa. We'll do that one first at 5:30. I was just trying to figure out, Kevin just said somebody else dialed in, but maybe that was just... 1 second.
What I love most about Norfolk County, I think, would be the vastness of the county, how it's big and there's breathing space, and there are so many little pockets of beauty, natural beauty.
I love the seasons here. The springtime, the rain falling on the earth. I'm a farmer, so I enjoy those aspects of it, the smell of the rain. The summer times, we have beautiful, warm summers here.
You have such pristine water here. You have some of the finest cold water streams in Ontario with Big Creek and Young's Creek and others that produce great fishing.
Norfolk is very heavily forested, beautiful color in the autumn. The sun shines very brightly here in the wintertime, so I love the 4 distinct seasons we have here in Norfolk County.
What people find remarkable about Norfolk County, I think, is that
speak. My name is Lady Zeliki. I represent Parkfield Green Simcoe. Our development is just by Jude Drive. We have 19 lots, and it's we share the same concern about the water supply. Mr. Valley expressed it well. We have a registered plan of subdivision, and our assumption so far was that there was no issue with water. We've had pre-com meetings last year, and we're in the process of finalizing our engineering drawings. And we're actually anticipating to go to market next month. So we just want to get clarity onto what in-progress projects are, and so that we don't have any delays or any issues with our projects. Thank you.
Thanks, Letty, for joining us. I mean, it's is this your first development in Norfolk County?
It is.
Yeah, it's certainly, all these challenges with water are not something that we I don't think that we expected in this term of council. That all came as kind of a shock in our first year. So I can only imagine how hard it's for you guys, and certainly as somebody that's new to the county. And I apologize that these are the challenges that we're facing. So if I guess first, what I'll do again is I'll ask one more time. Lee Greenwood, are you on the line? Okay, so we're going to move on. If I could have a motion to receive the deputation from Mr. Valley, Mr. O'Hara, and Mr. Zlecki as information.
And Mr. Bunting.
Oh, Mr. Bunting, sorry, it wasn't on my list. Thank you, Councillor Martin. Councillor Huffman is moving that, seconded by Councillor Michelli. All those in favor? Okay, that is carried, and I will turn it over to council if you'd like to ask questions of the deputation. And then after that, if you'd like to ask questions of staff. Any questions? Councillor Vanden Rishi, go ahead, please. And maybe you could just say who you're directing your question to.
Thank you, Your Worship. Through to staff, the concerns that were raised by
Councillor Vanden Rishi, can we just ask questions first of the deputations, and then we'll go for questions to staff?
Oh, of the deputations. Okay, I had a concern, and I get it. Thank you.
Is there any question from any council members for any of the deputations that were presented? Councillor Michelli, go ahead.
Thank you, Madam Mayor. I think this is going to be for Mr. Valley. John, you had asked about a list of projects that would be, included as being ready to proceed with the available water in these areas and communities. I'm speaking in particular about the project in Port Rowan. What would you like that list to look like?
Thank you, Councillor. So can you hear me?
Yes, I can. Thank you.
So our understanding is that staff has said anything that's committed or in progress can proceed. So in order to make that kind of statement, we're assuming that what staff has done is gone through the list of the projects and said, here are the ones that are committed, registered plans or signed agreements or whatever. And here are the ones that are in progress. They maybe have a zoning approval. They know that they've been to a pre-con. They know that an application, say, for site plan is coming. And they've looked at those and said, here's the amount of water that each one of these needs to be supplied with. And we can accommodate them all because they're in progress and they're committed, and that's what they said in their staff report. So we're simply looking for them to give us that list and say, here are the 4 or 5 projects in this community and the 4 or 5 projects in that community that we believe can be accommodated. And these are the ones that we were referring to when we said projects that are committed or in progress can proceed. Which projects were they talking about? That's the list we'd like to have.
Thank you, John. Thank you, Madam Mayor.
Okay, Councillor Van Den Rishi, did you have a question for any of the deputations, or that's still your hand for staff? I'll come to you first, I promise.
Just for staff.
Okay, any further questions for the deputations? Councillor Michelle, your hand's still up there. All right, so in that case, then we will turn over the floor to council for questions to staff. And Councillor Van Den Rishi, I will start with you. Please go ahead.
Thank you. Through you, Ms. Mayor, to staff, the question is very simple. Do you have a list? Is there a list prepared? Did you go through, as Mr. Valley had indicated and asked the question, does the staff have that list?
Mr. Burgess, I see your hand up. Go ahead.
Yeah, thank you. Through the mayor to the councillor and to council, we do have a list, and to avoid any confusion of the term in progress, staff have been trying to be very clear with, and it was in Mr. Valley's presentation, what we're saying is approved and in progress, which means either a registered site plan or those types of conditions. At this point in time, we just don't want to have a massive list of projects out there at various stages that's out there that didn't factor in, because we are working through that list. We can compile that list for council, and if council wants to release it, that we'll take the direction from council on that. We do want to go through the MFIPA process, though, prior to releasing anything to the public. And that would take a little bit of time prior to issuing that list. The other challenge is, as what was written in the report to council, is that we are looking at well optimization in Simcoe. And once those numbers are finalized, we may be able to look to have to tell council, well, we do have some additional capacity at that point in time. But we can certainly go through and provide council with the information with regards to, which projects we looked at, why those were approved, and we would, we'd be happy to do that. We're just not ready to go and provide a list out to the public until we go through the appropriate process through MFIPA to deal with that. If there's concern from the public that, staff are juggling the lists in any particular manner to favor one person over another. The listing was very defined. It had to have signed agreements in place, and we provide that documentation to council. We are also asking for a bit more time to provide a fulsome report to council in September on how this whole process is going to work. I do also just want to stress too, just to be clear to council, there's 2 items going on here, and you just can't go and pick and choose which projects you want to go through. We do have an official plan that speaks to how these things are ordered. There's a legal process to that. And then the chief building officer is also independent and works under a different set of rules. So, council can come down and say, approve this project and let those builders go through it. But council's authority does not extend to this. If the CBO feels that there's a health and safety issue, he does not have to issue the permit. And it doesn't matter what council says or what anybody says about, what they think he should do. He is independent, and if he believes that there is that he's not in good authority to issue a building permit, he does not have to issue the building permit. That is outside my scope as a CAO to order him, or council's scope to order him to issue a building permit. So the reason staff is putting this all out there is so that a developer doesn't get surprised at the very last minute of not getting a building permit. And that's why we'd like to be able to advise builders and give them fair warning, and developers fair warning that, we'll let you progress, but you're not going to get water potentially at the end of this. So just want to make sure that those concepts are understood by council, that we have a number of documents that are in play here, including our official plan and including the building code, that we want to make sure that we have tightened down, and we have time to come back to council with a much more detailed analysis for your review.
One more question through you, Mayor, and it's to staff, of course. As long as there's good public relations to indicate to the developers that we're still there, that we're still looking at this, that we're on top of it, because we just don't want anybody, as I'm hearing, panicking about development. So as long as you can give them the fair information you've got, I think that's the best you can do. Thank you.
And just to be clear too, that is clear. And also, there's a difference between releasing a list to the public, but if a developer, wants to specifically ask about their development to the planning department will confirm to them whether they can proceed or not proceed. So we're not holding this, we're just not looking at releasing a list to the public of all the developments, but any developer or any builder out there who says, I have this project, am I good to proceed? They can contact, they can contact planning and get that confirmed directly.
Now, Jason, my understanding, and maybe I'm wrong, I thought that's a little bit different than what I had heard previously, which was you were still seeking legal advice to ensure that the list was compliant. Or not compliant, but that, everybody was, in the past, we've had a little bit around here, different rules for different people. And staff was taking the time to ensure that, we were being consistent across the board, and everybody was being treated in accordance with the official plan.
That is correct. I meant more specifically, if they believe they have a signed if they believe they have a signed site plan agreement, and then they are progressing and they want to make sure that they have done that, if they want to recheck with that, then they can certainly recheck with planning directly, because we're always open for questions. But if there is, we just don't want a developer who is actually, does have the approval to move forward, that they're not sitting there wondering if they actually have that approval. They can confirm that approval going forward with staff.
But I think that's kind of what is happening a little bit. But Brandon, did you have any comments?
Yeah, to the mayor, and this is a coordination between engineering and planning as well. So through engineering and water services, they're looking at what is the existing flows, what are the existing capacities for all of the communities in Norfolk. We then go through what are all of the new developments, their status of the new developments, and any pending developments, and see where they're at in the process, how much estimated development, how much estimated flow, and then when they're at these certain principles that we've established and more to come in this upcoming report, it can be committed as to the allocation. What's pretty key right now is that when we're looking forward to how much future development can happen, and everybody is, I think, on board with that, planning, economic development, all the reasons for our economy and building and construction to see what happens with future growth, is that we need a solution and we need a recommendation And that way, that will help us looking at what is our future capacity under that solution, because there's so many scenarios for what to do in the interim for Simcoe or long term, or for Port Dover. Once we have that solution and the decision that we're hoping to get, then we can start to really firm up how much capacity would then be available within a time frame and exactly which developments. And I think that's where we're going.
Okay, so I just want to reconcile Jason's statements and your statements, Councillor Van and Rishi's questions and Mr. Valley's questions, which I think are fair. If somebody calls the planning department tomorrow to determine whether or not their application is one of those that are committed in progress, will they get an answer?
So we have been answering through Mr. Valley or any other questions. There have been specific applications that we then confer with engineering to confirm if it has been committed or not and where it's in the status. And so we have been doing that for specific files. So there has been a subdivision or a site plan, it's been requested. We're at the registration or the agreement stage. Are we committed? And there has been some confirmation provided. What we're also saying is, if you have the site plan, so Mr. Valley and others have identified that they're site plans, what we're saying and through the recommendation of the report is, you can proceed through the site plan submission in Simcoe, and what's talked about then would be Port Dover. You can proceed to go through, and once we get to that agreement stage, that's where the formal commitment would happen. That's the kind of current principle that is being considered right now. We're kind of in the in-between stage until we get to that next report.
Okay, but that's for the additional capacity. So the current projects that are within the committed or in progress, for those that Mr. Valley was asking, are you or are you not able to answer that? I understand that for the others, you're going to allow them to proceed through the site plan period. And then if there's some additional capacity, if we can get the well online in Simcoe and there's additional capacity, you'll know how much is available to allow additional development to carry on. But I just want to be clear as well, and I'm still confused myself. So will we or will we not have an answer for Mr. Valley on those projects and others? And if it's no, just say no so that we don't get emails about it.
To the mayor, we have answered Mr. Valley on those projects that he identified, although there was one or two new ones today. And staff are right now confirming that, as I see from our messages. So we have responded to the individual ones.
Okay, so and if somebody else is another developer's watching and if they want to find out, they can contact us and we'll be able to tell them at this stage, the question comes in for the new developments and when additional capacity comes online.
That's correct, and it's a combination of planning of where they are in the planning stage and with engineering. So engineering is the one that would help with the actual confirmation of whether or not there's been something already committed or if it still needs more infrastructure before we commit it.
Okay, I don't mind bad news, just tell me the bad news. Jason, did you have anything else to add or?
No, I just want to be very clear that at this point in time, we're not putting out an overall list of everything that's out there, but if someone has a question, we will answer the question directly to say, yes, this is, you're in, or you can proceed, or you can only proceed up to this stage. We'll answer those questions directly. We just don't want to get into the situation of putting out some global list out there.
Okay, thank you. Councillor Huffman and then Councillor Taylor.
Thank you, Mayor Chop. Through you to staff, and maybe Mr. Burgess, you might be the best to answer this. Would it be feasible, due to the high profile of this entire situation, that if a developer is getting a go-ahead from whichever department is the final say, would that be Brandon, that the councillor in that area be notified? Or is that too much to ask?
I don't think it's too much to ask. I think we can probably do some overall reporting to council as a whole.
Okay, that was my next one. So
yep. Yeah, we're planning to provide a bit like a more detailed report in September to council, just with the rules and how this is going to impact which projects and how we decide to move forward. And I just want to continue to stress that what we're trying to do here is we are really trying to make sure that even if, once we have that planned solution, and we have two planned solutions, we have a planned solution in Dover, we have a planned solution in Simcoe, that building can continue up until the point in time of occupancy. That's really what we're trying to get to, so that people don't have to stop, or at least builders can say, hey, listen, they're gonna have water for me in 18 months. It's only going to take me 8 months to build. I'll start building 10 months from now, so that once water's there, I can go. And we're going to try to have that process. It's not something that we've done it informally before, but we want to make sure we have really good processes in place. It is really transparent, and we have all our I's dotted and our T's crossed. And that's going to come in September to council.
Okay. All right. Thank you very much.
Jason, if I just could sort of, I'm a little bit confused myself now still. So the list, what is the distinction between what's occurring in September after the review by external counsel, and if we have the list now that planning staff is able to comment on or address on an individual basis?
We could provide a list today also, just to council. If council so decides, we can certainly provide that list. It might take us a little bit of time to put that forward, but that would be in camera to council, and then we'd have to go through the MFIPA rules through the clerk if there wanted to be a release out to that. But there will be changes between now and September as we are getting some numbers updated, and that's why the engineers are to report back to us on some of those number verifications in Simcoe in particular.
Okay, so the list between now, an idea now or a list now, but the list is going to grow, hopefully, if we get some revised numbers that show increased capacity.
That would be correct, yeah.
Okay, Councillor Taylor, go ahead.
Thank you,
sorry,
Madam Mayor.
I'm sorry, Councillor Taylor, 1 second. Brandon, I saw your hand. Did you have something else you wanted to add?
Oh, sorry about that, through the mayor. I was just going to note that the follow-up report really is about clarifying the process so that we have a fair, transparent process that has the criteria for how projects are being moving from pending to committed, and what are the necessary tools that we're putting in place in terms of holding provisions, development agreements, wording, and that'll help clarify a lot of matters. And I think a number of us would like to see that sooner rather than later, but we do need some of that clarification of what is our ultimate capacity we're going for, and what is the interim solution.
And we could put some live examples into that report in the fall, so that council understands the major projects going through.
Perfect, thanks, Jason. I guess we'll be doing that before the end of July. Councillor Taylor, go ahead, and then Councillor Michelle, and then Councillor Martin.
Thank you, and through you. So just want to make sure that list, the only thing that list can do is grow from here, from what we think is already approved. We're not going to have someone that we said, yep, you're good to go, you've been committed, and September comes along and say, hey, guess what, stop everything.
Yeah, through the chair, that is why we're very, if we have a signed agreement with someone and they've had that, then yes, they are proceeding. There is no change on that. And prior to us moving forward with anything else, we want to make sure our numbers are solid to avoid that situation. So, but anything that we've signed, the criteria that we've posted, and staff can send out a further memo to this. With regards to what we are saying is committed at this point in time, what the requirement is. If you have a signed agreement, site plan agreement, then we are committed at that point in time.
Okay, thank you. Further, looking at the well optimization options, how many cycles until we have more to do with that in front of us?
And that's why we're trying to put it all to September. We believe that we'll have that information by September, and further proofing of the Simcoe water model.
Okay, thank you. And then One further question, how long are we expecting for outside legal counsel? I'm assuming this is also coming back in September, the outside legal counsel making sure that the list is compliant with all the everything. It just needs to be compliant, but that's also coming in September?
We do have the advantage. Ms. Budis is, comes from the planning world. She's going to be the primary on that, and we're going to rely on some outside counsel to add to it. So Ms. Budis this is one of her major files going forward.
All right, wonderful, thank you.
Councilor Shelley.
Thank you, Madam Chair. Just through you to Jason, just to be clear, Jason, these other reports, these thorough, sort of more complete reports will come in September. But you did say that we will be getting some kind of I'll call it a preliminary list in a closed session soon. Do I understand correctly?
If council wishes to direct us, we can prepare that. Brandon is off screen, so I can't see his facial expression or not. But I believe we could probably do something for the July session to say this is what we have. This is our list at this point in time for council with a whole bunch of caveats. And I don't want to get into the overall some of the details and nuances, which is beyond my pay grade, frankly, and knowledge base. But there are some other technicalities and issues that we need to deal with when we go through that. When we present those documents to you. So we are just trying to provide council with the best information, but I think we can do that for July. And then knowing full well that that's our list now, and then that may, that's a list today, and then when we come back in September, we may have some slight modifications to that list.
Okay, thank you, Jason. That would be very helpful. Thank you, Madam Chair.
Okay, now I'm going to turn the floor over to Councilor Martin. Okay, no questions from Councilor Martin. Anybody else? All right, so I think that's that for that issue. Thanks to all the deputations for joining us. And at this point, I think we're going to go back now to staff report CAO 2149 that was pulled from the consent items by Councilor Van Passen. And I guess first thing, I wanted to do, well, Councilor Van Passen, I'll let you begin, and then I just have a couple comments to make. Sorry, Jason, I see your hands up. It's not up anymore.
You're on mute there, Jason.
I said I have a comment prior to the discussion of the report, but I'll let councilor speak first. It's more appropriate for the councilor to speak first.
Yeah, thank you, Madam Mayor. I asked that this be pulled. I think we should deal with this before we do the minutes C and C, so that everybody understands the rules of the game and the recommendation from our clerk and the recommendations from our in-house solicitor. And, I'd love to hear the comments from the clerk and have her explain exactly what's in the report and listen and learn. So.
Okay, before, I just wanted to make a comment myself, actually, Jason, then I'll go back to you. I know there's sort of a bit of kerfuffle that has now been created as a result of this, and I certainly want to apologize to council. Actually, normally I would have even discussed it with the clerk or Mr. Burgess in advance. Unfortunately, I did not that day. Admittedly, I am getting frustrated with accusations of not being transparent when I have tried to put as much as possible into open session. Teresa and I have had discussions about how we can bring even more forward in the future from some techniques and so on that they've used in Brantford. So she's going to start to incorporate that, I think, in the new procedural bylaw and so on moving forward as well. And so, I know I kind of put our new clerk on the spot here as well. So to Teresa, I apologize to you as well. I certainly kind of didn't envision this occurring, but again, I wish I had asked you guys ahead of time. Jason, I see your hand is still up.
Yeah, through the mayor, I'd like to just rise on, I know this, this report has caused some controversy, but I would like to rise today with regards to a point of privilege based upon, last week's debate, if that's okay with council.
Go ahead.
So last week, the report that I authored was intended to be discussed and closed. However, it was discussed in open, and staff, do feel in hindsight, we should have probably corrected that or been more strenuous in that, and we can all recognize that. But the reason I rise on a point of privilege is during the debate, there was the two councillors took exception to the nature, quality, and my motivation behind the report, leading people to believe I wrote a report with bias and of poor quality. As council knows, I'm a licensed chartered professional accountant, and as a CPA, I have to adhere to my professional code of conduct, a code of conduct that has 5 pillars to it. One is professional behavior, the second one is integrity and due care, the third one is objectivity, the fourth one is professional competence, and the fifth one, ironically, deals with confidentiality. The comments, that were raised that question, frankly question the adherence to the first 4 pillars of my professional code of conduct in a public manner. And, and as such, I have to go back on the public record to state that, I do not believe I broke my rules of professional code of conduct. I believe that I acted in a professional manner with due care, integrity, and objectivity. As part of your training as an accountant, you are taught something known as professional skepticism. Some kids might say that's making sure your spidey senses are turned on. And this type of training in professional skepticism and 25 years of experience in dealing with complex private and public projects that led me to draft a report to provide disclosures of concerns I had regarding certain activities on the matter, as well as previous matters. Norfolk County, rightfully so, has policies to ensure that the county undertakes its various activities with transparency, integrity, and fairness. These are the hallmarks of good government. It is both staff's duty as well as council's duty to uphold these principles. And that's why I felt I had a duty of care to notify council of my concerns with regards to the matters in that report. It needs to be stressed to council that, there was a number of various pieces of data that once you start lining them up, it led me to a number of questions. There was also a very public document. It was made to council. It was put in our information package that made the comment with regards to backdoor dealing. As such, it's warranted, from my view, for myself and senior staff to review the integrity of the process because of that accusation. And the reality is, in the report, as I noted to you, I had a number of questions that I could not reasonably answer, and I had some lingering doubts, and that's why I provided that information to council. As I stressed in council, and this was supposed to be in camera, those were not conclusions, but they were concerns. And I think it's appropriate for senior staff to inform council of concerns. Because if we have those concerns, what would council expect staff to do? Especially when it comes to an integrity of a very important process. I do not want to be the modern day equivalent of Sergeant Schultz, the character from Hogan's Heroes. The person who turns the blind eye or, sees no evil, hears no evil, speaks no evil. So that's why I had put the report together to provide council with that background. I have, since I've been here with staff, tried to develop a culture where we can come to council when we've erred and be very transparent, with, things that we have done wrong and things that we have to clean up in our shop. And, and this transparency and trying to strive, even though we fail many times, trying to strive to the highest standard of professionalism, that's something that I believe is important. And I believe council has also recognized staff for doing this. And this was just one additional step for that. I believe a successful culture only works if it's consistent from the top to the bottom. The tone of the top is very important, and at the tone of the top, you need to lead by example. If there's 2 different sets of rules, one for one group and one for another, especially if that group's at the top, the culture tends to fail. And, I think it's important that because this discussion was happening in public, that council consider maybe addressing that issue going forward. In conclusion, if there were questions to the substance or the merit of the concerns I raised in that report, I think those questions should have been addressed a few short hours after the council meeting concluded last week. Because even though staff repeatedly confirmed to council that nothing should be released until council approved it, and even Councillor Van Passen specifically reconfirmed with the clerk for clarity of that, as you know, this council received an email from an individual with whom the in-camera information should not have been discussed with, noting that they were informed of the report. Though in theory, there could be some alternative explanation to how that information was released to him and how he was able to draft that email, I have my doubts. As my mom used to tell me when I was young and trying to figure out an excuse to get out of some trouble, she used to tell me, son, I may have been born at night, but I wasn't born last night. And, I have some concerns with how that email came to this council the day after. So I want to just stress to council, I provide these comments with the utmost respect. And I really want council to ensure that they're not taking in any manner that they're not intended to do. I think this council has made great strides in improving the decision making and making a ton of improvements for the county. And I think based upon what happened last week, hopefully some of those things can be motivated to make more positive action for council, and more importantly to set a tone to staff that ethical behavior is valued, and if you do have concerns, you shouldn't be afraid of going to council with those concerns. And those concerns, even if you are wrong, everyone makes their mistakes, but you're going to be treated in a professional manner, so that that open line of communication between both staff and council is maintained. So I thank council for allowing me to speak on a point of privilege, and I'll retire from there. Thank you.
Thanks, Jason, for your comments. I think there's a lot in what was just said. Teresa, I don't know if you had anything that you wanted to add right now, and then I think we should take a 5-minute break and then reconvene.
Through the mayor, I was just wondering, before we discuss the report, if I could just provide some opening comments to the content of the report I drafted, CAO 2149.
Yep, please go ahead.
Okay. So my report, CAO 2149, is before council today to provide guidance related to the possible release of closed session reports, and specifically closed session report CAO 2142, property sale update from the June 8, 2021 CIC meeting. As noted within the report, there are certain legislative measures that allow for matters to be discussed and kept in confidence, as outlined in both the Municipal Act and the Municipal Freedom of Information and Protection of Privacy Act. The report also outlines that all reports considered for a closed session item are reviewed by the clerk or designate to determine if the report meets a closed session exemption. The item cannot be placed on the closed agenda if it does not meet the requirements. The clerk acknowledges that council has a right to discuss closed session items in open session for transparency purposes. Exemptions that provide closed matters, especially as they relate to identifiable individuals or third parties, should be respected even during discussion in open session. Related to staff report CAO 2142, staff did not have a concern with the report being discussed in open session. During the debate, council did ask if there were staff concerns, and the CAO provided some commentary caution at certain points during the debate. Council resolved to make the report public, and the deputy clerk provided caution related to the release of some identifiable information at the end of the discussion. Although I appreciate the mayor's comments at the beginning, I acknowledge that as clerk, I should have interjected into this discussion to provide more direct guidance to council on the release of such information within the report, and I failed to do so. Council now has an opportunity to correct this matter to ensure council meets its legislative and procedural responsibilities, and the clerk would request that respectfully request that council consider the information provided within this report, as well as the companion closed session memo from the county solicitor, before it makes its determination on how to proceed. I clarify, and further to Councillor Martin's request at the beginning of the meeting, it is councillors' privilege to waive their exemptions under closed session. However, the clerk would recommend that when an item is in closed, it's there for a reason, so you should start the discussion there to understand the requirements of why or how it could be brought into open. And I would always strongly recommend that we adhere to MFIPA regulations as it relates to the protection of privacy. Should council determine that the report not be released or be released as suggested in part within this report, communications could be drafted to inform the public as to the legislated reasons why the report cannot be released in full. The clerk would ask that should council have questions or concerns related to procedural matters of an agenda item going forward, that they contact the clerk in advance of the meeting to discuss. And further, the clerk will commit to undertake a formal review of closed session report processes and procedural bylaw to ensure that appropriate processes are implemented to address these types of matters going forward. Thank you.
Thanks, Teresa. If it's okay with council, could we just take a 5-minute break and we'll start again at 6:15?
I would prefer to continue. I feel like we just started a report here and we just came off of a break.
It would just be 5 minutes and we'll start up again.
mics are live. We are able to proceed.
Thanks, Kevin. I did say 6:15, so it's 6:14. There's another minute. There's a couple councillors that are missing. So Michelle's back. Just waiting on Councillor Huffman and Councillor Columbus.
Do you have a separate clock, Madam Mayor? Because mine says 6:17 on two things here.
Well, I was going off the clock that's on my computer screen. That was based on the time, and I'm just waiting for Councillor Huffman and Councillor Columbus. Councillor Huffman's hand went up right away, so I don't think it's fair to her to start without her. I just needed a minute to process something, or something.
Well, even when before, like, seems that your clock's a little different than mine, so.
I don't know. My county clock just turned to 6:15, so maybe Brent's got a different clock for Norfolk County.
And mine just turned to 6:18. So.
Okay, Madam Mayor, don't use the clock that's in council chambers, please.
2:30.
Well, it's still right twice a day. It's not broken.
Councillor Huffman, Councillor Columbus, are you on the call? Councillor Huffman's there, and Councillor Columbus. There we go. Thank you, sir. Okay, so we'll begin again. Councillor Huffman, I see here your hand went up. Thanks.
Thank you, Mayor Chop. Through you, I don't know. I kind of know what I want to say, but I am feeling very, again, I know when Mr. Burgess started speaking, he said 2 councillors took offense, and I did speak up last week, so I'll assume that I'm one of them. I know he spoke to the 5 pillars of his professionalism there, but I also took an oath, and I uphold my principles and that of myself and my colleagues. I still continue to take issue with what happened last week with that report. It was an unsolicited report to council, which is out of the ordinary, and I do apologize to staff for putting them in the position of voting in favor of the motion to discuss it in open, so my apologies for that. I'm still feeling a sense that there's an underlying comment that one of the council members breached their ethics and their oath of office, and I'm continuing to take exception to that. So, thank you.
Councillor Martin, go ahead.
Thank you, Mayor Chop. I feel as though the cat's been let out of the bag. I feel as though it does not make sense from the public's perspective to now backpedal and not follow through on the unanimous decision that we put forth last week. I know that happens from time to time on particular motions. However, this is different because it's the foundation of the discussion. It's the fundamentals of the documentation that we said we would do, and we then continued to have a discussion in open session. I feel as though if we are based on Mr. Burgess' comments, which I hear and understand and appreciate, but I feel as though the underlying theme there is if we follow through, if we release these documents, we are setting the bar and the tone for our staff to not act professionally or not act ethically because council may release your documentation, when that is most certainly not the case whatsoever. I wish this report didn't come forward, and that was my position yesterday. I don't feel as though it is an appropriate use of our resources and our staff time. I think it could have come in a one-page memo that strictly just said, wanted you to be aware. There's a lot of effort put into this, and it's a reoccurring theme with a reoccurring individual. All of that to say, I don't feel like there is any going back at this point in time, and I think it's a good learning lesson for all of us. Those are my comments. Thank you.
Jason, did you have anything else you wanted to add?
Yeah, through the chair, just to be clear, the decision of what council wants to do with the report later on, I think staff has a number of recommendations there that can be dealt with. Just to be clear, the reason I rose on a point of privilege was not with regards to whether the report should be released or not. It was just some comments made about why I would write that report, and whether the report was objective or not. That was really the nature of the point of privilege, not about whether not to enter the debate with regards to whether the report should be released or not.
Councillor Van Passen, go ahead.
Yes, thank you, Madam Mayor. When I read this report 10 days ago, I got to think about when I was a little kid, I read the story about the 6 blind men and the elephant, that, each one described a situation, all of which were correct, but nobody could draw the conclusion of what the overall big picture was. And, to call the report from the CAO unsolicited, he's the only one that was in that position to take those little individual items, and when you start lumping them all together and put them together, you can draw certain sort of opinions, or those are facts that he brought forward to make council aware that he had legitimate concerns, I think, about the processes that were involved with council. Nobody asked for that report, but I think that's the duty of the CAO and all our staff to bring those concerns forward. And also, it's a duty of council to make sure the staff have that confidence to do that. And I think there's a lot of merit in that report when the next morning the report has somehow managed to get in the public. So there's definitely a little bit of a concern there as well on my part. But I think the current report from the clerk explains all the different rules and regulations that we have to operate under. And I think there's a very definitive answer at the end that you cannot make that memo or that report public. Well, you could, but there'd be so much redaction that there wouldn't be anything there to make sense. So, I don't see how we can possibly release it without violating more rules. Like, there'll be complaints filed because we do release it, because we're breaking a whole set of different rules. So I don't know why anybody thinks it'd just be okay because it was discussed. We still have to follow the rules. So I don't know if any of the staff want to comment whether I'm just the one thinking wrong or whether I sort of got a grasp of what the report says here.
So we're kind of moving into a sort of a debate at this point. Teresa, I don't know if you want to jump in here just to make sure we're on track. Certainly to answer Councillor Van Passen's question, but make sure we're on track here moving forward.
Through the mayor, procedurally, somebody should put a motion on the floor with respect to the report before them, which is CAO 2149, and then debate would occur.
Councillor Martin, go ahead.
Thank you, Mayor Chop. I do have one further comment, but I will put a motion on the floor to follow through and release the information as discussed last week. And then I would like to make a comment about something I had discussed with the clerk last week, but I'll let you get a seconder.
Okay, is there a seconder for Councillor Martin's motion? Councillor Van Passen, I'm going to assume, are you seconding that motion?
No, Madam Mayor, I'm waiting to see if that motion does not carry, then I would put forth the staff recommendation.
Okay, is there a seconder again for Councillor Martin's motion? Okay, seeing none, Councillor Van Passen, go ahead.
Yes, thank you, Madam Mayor. I would put forth as a motion the staff recommendation on page 20 of our agenda. And if you'd like me to read it, but
You can go ahead if you like, or would you like me to?
no, sure, you could, the mayor can read it. And you're in possession of a motion once it's made. So.
So the recommendation from staff is printed on page 20, is that staff report CAO 21 regarding release of closed session report CAO 2142 property sale update be received as information, and that the corresponding June 8th, 2021 council and committee resolution be pulled for further discussion before the minutes are approved by council. I'm not sure, Teresa, we're not going to need to do that then still, are we? No, so we'll skip that line and it would simply be, and further that closed session report CAO 21-42 not be released. Teresa, did you want to make, is there a seconder for that motion, first of all? Okay, Councillor Taylor seconding that. Teresa, did you want to make some, any further comments? Okay, Councillor Martin, go ahead, we're in the debate portion.
Thank you, Mayor Chop. Through you to my colleagues, I won't be supporting the motion. As I said, I feel this is entirely inappropriate to take this many steps backwards. I think council has the ultimate discussion around what information could be released and redacted. We have done that time and time again. And additionally, the comment I wanted to make was I did speak with the clerk prior to the council meeting. I spoke with Kevin. I discussed having this report in open session, and I was trying to process as to why the perceived conflict of interest with my issues as a council member that does receive benefits if they want, and I don't want them. I tried to move my own report into open session today, but if they want them, they would be protected by closed session. And this individual, who is not an elected official, would then be protected by a closed session report. And the response was that this individual is a member of Police Service Board, and so that could potentially be a reason, but that board is separate from council. So they actually probably didn't need the closed session protection. So I did have that conversation with clerks, and that's why when Mayor Chop discussed moving the motion, I was on board with it yesterday into open last week into open session. But that's neither here nor there. I won't be supporting it.
Thank you for your further commentary, however. Teresa, did you have anything else that you would like to add?
Through the mayor to Councillor Martin. So all individuals have the right to protection of privacy through MFIPA. That's not just special to council. In fact, in some ways, council has at times less privacy than regular individuals. And members of committees or boards of council, if they're acting in capacity of that position they hold, then there's a little more transparency in their actions. But when they're acting as individuals outside of that, then their rights are protected just the same as any other individual. So I can't speak to the conversation you had with Kevin. I know he's on the line. He may wish to provide commentary to that. But that is my belief in the legislation.
Councillor Vanden Rishi, go ahead.
Thank you, Madam Mayor. My comments are this. I'm behind the 8 ball because I haven't got a lot of this history, and it was very confusing for me last week. Very confusing, but very disturbing at the same time. But I think we better take a good learning lesson out of this. To me, there's reasons for putting things in camera. There's always going to be something that's going to come from staff, and we should take it. If we have to take it in camera, we should do it. But from this, we should learn that we shouldn't be continuing on this. I think that at some point in time, it should come to a halt. And let's learn from it and let's move on. I don't know the history, so, and I really, it's so quickly, I really don't want to know the history. So for me, I'd like to move forward from today on, and I will be supporting the motion. Thank you.
Thank you, Councillor Van Den Rishi. Councillor Van Passen?
Oh, sorry, Madam Mayor, I forgot to take down my little icon.
Any further discussion from council on the matter? Okay, all those in favor? And that is carried. Opposed? Again, my apologies to council. I know I initially moved the motion. I had no idea that Councillor Martin had previously a conversation with the clerk's department. I certainly normally would have had a conversation with the clerks about moving it something to open, and that week I did not. Again, you know, it's difficult sometimes when there's accusations of a lack of transparency, but I certainly respect the fact that we have, you know, the integrity of a $300 million corporation here to protect. And so my apologies for council for starting us off on this path of these discussions to begin with, and I should have left well enough alone at the time. So again, sorry to our new clerk, because I know she felt badly, and I apologize 100 times, but sorry again, Teresa. Councillor Van Passen? Did you have something?
Madam Mayor, and now the next technical question for the clerk. When it comes to the CNC minutes, how do we amend that recommendation now that we've overruled it?
Through the mayor to Councillor Van Passen, by way of the motion you just made, that'll supersede the motions in the committee of council minutes.
Like any other time that we pull something.
Yeah, but it wasn't pulled according to this motion. We didn't do that yet, so.
I think Teresa and I had a conversation ahead of time, so by pulling that consent item, which referred to that item, the clerk was comfortable that that would be sufficient to technically pull the item from the report itself.
Not pull is a different term.
Yeah. Through the mayor to Councillor Van Passen, when we approve the CIC minutes, they'll be approved as amended.
That's what I wanted to hear, that little adjustment.
Okay, moving on to the next item. Let me see here. Okay, so we're on to, and Teresa, just correct me if I'm wrong, but communication item 6. So the first is an information memo from Heidi Van Dyke, Acting General Manager of Health and Social Services, and that is in regards to the Board of Health Subcommittee for the Acting Medical Officer of Health recruitment. So again, this item was pulled because it does require a motion to appoint 4 members consisting of either council members, staff, or a combination thereof to the Board of Health Subcommittee, Acting Medical Officer of Health recruitment. Okay, so Councillor Rabbits, please go ahead.
I have a suggestion through you, if I may. I see that Haldeman has included the mayor and staff members, and I'm just spitballing here that I would like to have our mayor as well sit on that committee. And I'm also thinking it may be advisable either to consider what staff members we should include, or perhaps members of our Health and Social Services Advisory Board, who I think would be competent in the conversation regularly to consider this position.
So Heidi, I'll let you go ahead. I see your hands up.
Thank you, Mayor Chop. Through you to council, just to confirm for council, the Haldeman County staff are Kathy Case, who is the General Manager of Corporate and Social Services, and Lori Friesen, who is a Manager in Corporate Services, and also as to confirm for Council that I believe that the motion to establish the subcommittee did indicate that Human Resources Director Erin Anderson and myself would provide administrative support to the subcommittee.
So one of the a little bit differences, the nuance between us, Councillor Rabbits and Haldeman, of course, we have the public health department. So Kathy Case is representing them, but I mean, obviously the logical here from corporate services, but we, you know, we have the GM of public health. Heidi as well as Dr. Huckowicz, I know, and I believe Aaron was on those calls as well, Heidi and Jason.
Yes, that's correct, Mayor.
With the candidates, so they have had, you know, there has been a screening of sorts to ensure that the candidates were, I mean, obviously there's particular qualifications and so on for the positions, for the position itself that are a legislated requirement. So staff have ensured that the candidates that are coming forward to the Board of Health, you know, at least, you know, meet those qualifications, or at least have a plan to be able to meet those qualifications for the board. Am I saying anything wrong there, Heidi?
That's correct, Mayor Chop.
Okay. Now, will you also, I'll go to Jason in a second, but well, maybe I'll go to you, Jason, and then I'll ask my question after. And Councillor Rabbits, I'll turn it back over to you after.
Sure, yes, and I just, you know, this memo was sent to council. It could have also been sent to the Board of Health, to be quite frank, but because it was sent to mayor and council, we put it into the council package. But this was really came out of the Board of Health decisions. And the debate there was just we weren't going to dictate who Haldeman put on their hiring committee. They were free to choose it, but our Board of Health kind of already determined who was going to be on the hiring committee. And I believe the last round is to the committee as a whole, or to the Board of Health as a whole, will always have the final decision. So I believe this is just more for information to council at this point in time.
Well, this is providing a recommendation to the Board of Health, right? Yeah. For the final approval?
But that is the challenge with this is I believe this should actually be directed to the Board of Health, not to council, because it's the Board of Health that technically hires the medical officer of health. You know,
well, we can't wait till the next Board of Health meeting, so we're going to do it right now.
Yeah, I agree with you, and I think it's that you know that you can appoint your 4 members, and I think what we just need to do to the subcommittee, and I think we can just you know, direct that through it, but I think we'll have to clean it up after.
I think Teresa's shaking her head there, and I think that's actually it goes to council, right, Teresa? Yeah. No, I think procedurally it is a bit strange the way that governance structure is set up. So it's a committee that's made from council, but then the final recommendation will go to the Board of Health.
Okay.
So I think it was.
Sorry, through the mayor, when we reviewed the minutes from the Board of Health, that this went to the Board of Health, listed Haldeman County to appoint 3 to the subcommittee, and Norfolk County Council to appoint 4 to the subcommittee. So that leads the decision to be that 4 Norfolk County councillors have to be appointed to that subcommittee, and 3 members of Haldeman, whatever that looked like. So that was the motion from the Board of Health.
That was a motion. Okay, thank you. I apologize. I just remember.
So, and the argument for that at the time, like, I think that this subcommittee, because we have the public health department, I would think that it would make sense. I'm not sure about council's perspective, but that Heidi certainly would be in those meetings with us, although not a voting member, but certainly would be able to provide some input at the time. Is that reasonable, Teresa? I'm not even sure. I mean, to be honest, if we wanted additional people from public health, like if we wanted Dr. Huckowicz to sit with us as well, if he wanted to provide some input and some assistance to the subcommittee and or the Board of Health for the final approval, the way that I see that would be possible. I think that was kind of one of the ideas when he came on, was that he would sort of assist us through this process, but certainly he wouldn't be a voting member. Is that okay? Again, there are legislated requirements that go along with this position, and whether the candidate has those requirements or doesn't, but has a plan to meet them, I think that's something where Dr. Huckowicz would be able to provide in his, many years of experience as an MOH, guidance to the Board of Health, or guidance to the subcommittee. Is that fair?
So Mayor Chop, maybe I can start and then I'll defer to Teresa for any procedural items. I just wanted to confirm that Aaron Anderson and I had planned to support the committee by participating in the interviews at the committee's invitation as non-voting support members.
And your feeling with Dr. Huckowicz?
My feeling would be, and again, I would defer to Teresa, that he could be invited to do the same.
So if that's amenable to all of council, then, and Councillor Roberts is okay, I can even go back to you. So then we're looking for the appointment of, 4 members of Norfolk County Council to be onto that committee.
Thank you, and through you, I would suggest nominating, I would nominate yourself, Mayor Crystal Chop, but I would look to my colleagues to see if they're available or if they have any interest. Again, I was suggesting members of our Health and Social Services Advisory Committee may be a good fit, but there may be other councillors and perhaps some new councillors, Norfolk County Council, that would like to be involved in this process. And I'd be amenable to that.
Okay, Councillor Van Passen, I saw your hand up first, and then Councillor Van den Riche, and then Councillor.
Well, I think that you've already answered. We had this argument already. I think you and I, you were very adamant that it was going to be 4 members of council. So
and the motion passed. So let's move on.
And that's the pass. So let's move on and get the names and send it on here. So I think,
okay. So Councillor Van den Riche, go ahead.
Yes, thank you, Madam Mayor. Yes, I would love to sit on the committee, but I'm wondering if a councillor can get the list of requirements that are involved in looking for a new MOE. So I would appreciate that.
Okay, so those are available online under the Health Protection and Promotion Act.
Thank you. But I would leave my name stand if anyone else.
That sounds good. So why don't we do this to move things along? Who on council would like to be on the committee? Okay, 1, 2, 3, 4, and myself. So we're at 5. So I don't know how to, Councillor Taylor, I saw yourself? Councillor Taylor, Councillor Columbus, Councillor Huffman, Councillor Van den Riche, and myself. So, is there somebody that wants to go? Councillor Taylor?
If Councillor Huffman is going to be sitting on there, being a member sitting on the Health and Social Services Committee, I think it is important that we have some representation from that committee on the hiring process. I'm happy to take a step back and allow the process to go forward with the folks that have put their hands forward.
Thanks, Councillor Taylor. Okay, so does that work then? There's 4 members, Councillor Taylor, Councillor Columbus, Councillor not Councillor Taylor, Councillor Columbus, Councillor Huffman, Councillor Van den Riche, and myself. Teresa, do you need a formal motion and a mover and a seconder for that? If I could have a mover, yes, Councillor Rabbits, thank you. Councillor Martin seconding. All those in favor? And that is carried. Okay, the next item on the agenda, it's an information memo from Teresa regarding the composition of the Police Services Board, and as well item C, which was added, which is the information from Marlene Watson, the Director of Facilities, regarding the soil remediation update. If I could have a mover and seconder to receive communications items B or C as information or alternative. Councillor Huffman, seconded by Councillor Michelli. Any discussion on that at all? No? Okay, all those in favor? And that is carried. Okay, approval of minutes. So now we're moving on. I think I'm at the right spot. Teresa, again, stop me if I'm wrong, but item 7, we have the minutes of the regular May 18th council meeting and the May 31st special council meeting before us. And this is going to be a little bit of a new process our clerk has mentioned to me. So typically, if there were no errors or omissions, we would just adopt them. I've been informed that's not actually the usual process for municipalities. So we are going to start having a motion to actually formally approve both these sets of minutes. So starting today, if I could please have a motion to approve both sets of minutes. Councillor Huffman, thank you. And seconded by Councillor Taylor. All those in favor? That is carried. Councillor Vanden Rishi, are you opposed or?
Oh, no, I was not in attendance, so I can't vote on something I don't know.
Oh, you weren't, that's correct. You are correct. You weren't there. My apologies. Next is reports of committee, item 8. We have 4 reports of committee on today's agenda. Does council wish to discuss or pull items A and C from the report or pull items A through C from the reports of the committees? So A is the Tourism Economic Development Advisory Board from May 19th, 2021. B is the Telecommunications Advisory Committee minutes from May 27th, 2021. C is the Public Hearing Committee minutes from June 1st, 2021. Teresa, go ahead.
So through the mayor, you could add the committee and council and committee minutes to this motion as well, as long as they're amended.
Okay, and D, the council and committee minutes from June 8th, 2021 as amended. The only challenge with that was Councillor Taylor had pulled resolution 19. Oh, so I'm going to assume Councillor Taylor.
Sorry, that's my mistake. Sorry, I apologize for that. Yeah.
So Councillor Taylor, I'm assuming, are you looking for a deferral again until the public health matter is decided, or are you looking to move forward with this today?
I'm looking to move forward with it today. I had pulled it previously if any of my colleagues wish to speak to it further. I know that was at the end of the day there, and we were pretty gassed, I think, at that point. Didn't have much discussion, so I just pulled it as an opportunity to allow for that discussion. But I've reread the report now, and I'm comfortable with what's been passed, so I'm okay to not pull it if the rest of if none of my other colleagues here would like to speak to it.
You know, one of the other suggestions from staff in terms of the Norview component was to handle it, you know, whether we handle it in the same way as we handle the public health matter. So that's the only reason why you may want to wait until you've heard.
But see, with this carried as information, could we not add that onto the end of our, when we figure out what we're doing public health, add the Norview piece onto the end of that motion? Because this is just carried as information. So, I mean, there's no resolution beyond that.
Yeah, you received it as information last week. So unless you want to change that, you can still receive it for information and then bring it back to subsequent to the next council meeting. What might be easier for you, though, and Teresa, correct me if I'm wrong, if Councillor Taylor was to defer it again, that would ensure that it's on the next council meeting agenda already.
Yeah, I want to make sure it's easiest for staff at this point to make sure this comes back when we're dealing with the public health.
Through the mayor, then definitely the councillor should defer it to make sure it does come back. And if that's the case, I think to do it clean, we should accept 3 sets of minutes and then do a separate motion for the meeting council minutes.
Deferral and the minutes. Okay, so Councillor Huffman, back to the first 3 sets of minutes. You have the floor.
Okay, thank you. I had a question for Councillor Michelli from Reports of Committee B, Telecommunications Advisory Committee. I read through the minutes and they're extremely vague, and I understand that there was an update given on the SWIFT project in Wilsonville, and I was wondering if you could expand on what that update is.
Yes, through you, Madam Mayor. The update, I believe, and I'm going to have to check my notes, Councillor Huffman, but I think the only thing that I updated was that the project was going on schedule, and that there is, and you may have to, I may have to stand corrected, but the project in service date is the complete project in service date is August 31st of this year. That was the only change or update I had on Wilsonville. I did have some other information about the project in Long Point, which has been indefinitely delayed with a new project end date because of some permitting issues. But the project in Wilsonville is going almost exactly on schedule. And
Okay.
maybe I'll just add in the interim since that meeting, I have had some inquiries from people who are in that vicinity. As you know, there are some people in that area of Waterford and also a little bit west of there in Wyndham Center that have unfortunately
Left out of the loop.
well, they were left out of the loop, and also they were actually, I think, with regard to internet service in general, they were the customers of a company called Silo, and Silo was purchased by another internet service provider who has altered a bit of their business model, and some people are now getting extremely poor service, I'm told, and I did direct them to contact the internet service provider that had the Rogers project, the Swift project, which was Rogers, to inquire as to whether or not they might be able to get some of those lines and some of those concessions west of Waterford extended. And that's kind of pretty much the extent of any update I had about the Wilsonville project.
Okay, and to my understanding, I know because I've answered many irate emails and phone calls regarding those individuals who were left out, like halfway through a concession and things like that. And it's very frustrating because I have no per se say or quote unquote power over it at all. But my understanding is that there will be no changes made to the implementation of the project, and there will be no additional homes added, is my understanding.
Well, you know, Councillor Huffman, I do have to say that generally speaking, with regard to the official Swift project there, that would be correct.
Yeah.
But I do know from some conversations I've had with some Rogers staff and with our own Swift staff that there is every possibility that they will be just in the event of some competition that's going on in all parts of Ontario right now. If I were those residents, I would continue to be inquiring with some internet service providers about their situation, because I do know that that marketplace is getting more and more competitive, and I won't be shocked if some of those people will be able to have some of those lines extended either through Rogers, and in your Waterford area, obviously, it would pretty much be exclusively Rogers, as there are no other fiber providers in that area. But I do think that there will be, and I've been told this by Rogers staff several times, that they are hoping to extend all of those lines on those concessions.
Okay, that's good to know. So that's through Rogers, not through Swift, though.
So
that would be correct.
Yeah.
Councillor Huffman, yeah, that was the terms of the RFP were not. Council was not in any of the councils. All the members that belonged to Swift through the Warden's Caucus, the terms of the RFP were set, and in that case, it was they couldn't have, and Councillor Michelli might be able to remind me, but if you already had a certain amount, a certain download upload speed within your area, they were ineligible to apply. Beyond that, in Swift 1.0, which is what we just went through, the terms were how many homes that they would be able to hit within that, funding model that was provided, where it was that, and Councillor Michelli, you'd have to remind me on exactly how that went down, but it was the sharing model between, the provincial and the feds. And obviously there was some initial outlay from our contribution to Swift. So there was no ability for us to say, hey, we really want to see internet go here, or we couldn't say, you're laying cable, but you missed all these spots. That wasn't part of the terms of the RFP. SWIFT 2.0's terms are different in the sense of now it's looking for those more rural connections where it's, you know, it's more about kilometers of cable that's being laid. And so what Councillor Michelle's point is if there is a business case, though, if there's a hamlet along that route that hasn't been captured by the SWIFT project, going to SWIFT isn't going to do anything because that contract is already off and done. But if you go to, in your case, Rogers and say, hey, you know, we've got 50 homes that are right here, you know, we really want to, you know, we want to be a client of Rogers and we want to do this, that's where they might have some success.
Yes.
If they can, if they feel that there's a business case to justify it without any funding being added to that, then they may very well do that.
Yeah, and Madam Mayor, that's absolutely correct, and Councillor Huffman, that's why you know, if you are aware, and I have had some communications from people in that area as well, that if there is a group of people who are in somehow maybe not even a hamlet but a cluster of homes, who, as an example, were kind of left in the lurch when the silo company ceased operations there and was taken over by another provider, they may be able to, as a group, to petition Rogers to see if they can get a line out there. So that is what I think is the approach. And just to kind of remind, as Mayor Chop was just mentioning, the SWIFT 1.0 model was designed to pick places and projects where they could accomplish the most connectivity for the most homes within a certain geographic area. And it was totally intended to make sure it takes all of the decision making by, you know, political bodies out of it, so that there can't be lobbying for one ward over another. And so anyway, I hope that answers your question.
Okay, is there anything further? If not, if I could have a motion to approve the minutes from the 3 listed committees as presented. So, motion moved by Councillor Vanden Riche, seconded by Councillor Michelle. All those in favor? And that is carried. On to the council and committee minutes now. Councillor Taylor, I'll turn it over to you first.
Oh, I just see Teresa's got her. Maybe to Ms. Olson first there.
Yeah, sorry, through the mayor to Councillor Taylor, I would suggest that the staff report CO 2147 be deferred to, I guess, a specific date that you indicate, and then after that vote, then the CIC meeting minutes were approved as amended should be a second motion.
Okay.
I believe it'd be the July 20th council meeting would be your next council.
I believe that's when we'd have the next Board of Health. So yeah, July 20th. So
is there a seconder for that motion? Councillor Rabbits, and any further discussion?
And that's also including the approved.
Thanks. All those in favor? And that is carried. Do you opposed? I think Councillor Van Passen is frozen. The motion carries. So now on to the balance of the minutes.
And balance of the minutes. So that's as approved. We're yep.
Sorry, through the mayor, yes. We now need a motion to approve the balance.
Okay, if I could have a mover and a seconder for that.
Is that the balance of minutes as amended?
Yes, taking out resolution number 19. Seconded by Councillor Columbus. All those in favor? And that is carried. Staff report. So I think we're now back to the planning report, which is staff report CD 2153. And that's an application that's been received to amend the official plan with a site-specific policy to allow 10 block townhouse units fronting public streets and rezone the subject site with a special provision to permit 10 block townhouse units that do not occupy more than 95% of the usable floor area at first floor fronting public streets. Dymatic Tooling Solutions and Agent Civic Planning Solutions have put forth the application affecting the lands described as 171 King Street. And I'm not sure who from planning is presenting that report, but please go ahead.
Thank you, Madam Chair. Through Madam Chair to the Council, The report is being presented to the council with the recommendation for the subject land municipally known as 171 King Street in Delhi to permit 10 townhouse units in 2 townhouse blocks. The proposal was presented earlier in April 7, 2021 to the public hearing as information report. There were no major concerns identified through the public hearing, and there is no further comments pending from staff and agencies. The application has 2 amendment requests. The first one is an official plan amendment to permit residential units on ground floor, and an existing site-specific policy 7.8.3.3 will be revised to allow higher density of residential units on ground floor. The second one is a zoning bylaw amendment to permit no more than 95% of first story area as residential use fronting public street within the central business district zone. The current special provision 14.8.32 will also be revised, allowing this 95% residential coverage on first floor. Staff and agencies reviewed the reports and documents. Water and sanitary modeling report is reviewed and accepted by the development engineering. A site plan application will be required to review the detailed design and standards, and a holding provision is recommended until the site plan agreement is registered. Through Madam Chair, in planning staff opinion, the proposed development confirms the goal and objective of official plan and consistent with the PPS policies by proposing an infill development within the urban area and contributing to the rental housing in Delhi area. The proposed development is appreciated for its architectural quality through the reflection of its industrial history. Therefore, the report CD 2153 is being presented to the council with recommendations that the proposed official plan and zoning bylaw amendment be approved with a holding provision for the reasons set out in the report. That's it, and I'll be happy to answer any questions.
Thanks very much, Mohammed. How long have you been with us now?
It's been a little bit more than 1 year.
So I have to tell you, when I was first elected, I had a meeting with Mr. Klein and Mr. Rowe, who showed me a number of projects that over the years they had tried to bring forward, and they were so frustrated. I know in this case, if it's a project I'm thinking of, and I'm almost certain it is, that they nearly walked away from doing this project. I think I still have the drawings somewhere here in my office, and it looked amazing on that, in the first week after being elected, and it still looks like a great project now. So here it was something in the works for years, and I commend you for getting this forward to the council. So thank you. Any questions from council? Councilor Columbus, go ahead.
Yes, in this report, I know the previous project proposal by the applicant was a lot greater in scale, and it required a traffic impact study. Now, are you still, being it's only 10 units, living quarters, are you still looking for a traffic impact study for this project?
Yes, as through Madam Chair, as per the development engineering requirement, they still have to go through a traffic impact study review. But that would be, since this is only 10 units development, that would be a traffic brief. It should not be quite comprehensive study. And that will be done through the site plan review process.
Okay, I'm pleased to hear that you're relaxing the regulation on that. Thank you.
Thanks, Councilor Columbus. Would you like to move the staff recommendation?
Yes, I certainly would. I've been waiting for a long time for having this infilling development, former brownfield actually approved, and it's been a long time, as I say, and we do not have a laundromat in town of Delhi right now, so I understand it's going to have a commercial area with a laundromat, which people are looking for if they want to move forward. Thank you.
Did you ever think that this day would come, where it's development application after development application in Delhi? Well,
you're right. At one time, an applicant was looking to use containers, sea containers, that were 4 stories high on this particular site. So I'm glad that that didn't go forward, but I'm really happy to see this one move forward.
Well, it's great to see all this stuff happening in Delhi. That's awesome. Councillor Van Passen, you're seconding that?
I will second it. Yes, Madam Mayor. And, joining with Councillor Columbus, I made a lot of trips to that place to pick up parts from the Delhi Foundry over the years for the tobacco equipment that they specifically built for us. But I think if I had to look at all the different applications for development proposals, that would have been more trips than all the trips I took for parts. So I'm glad that this one's finally being recommended, and I hope they follow through quickly.
Awesome. Thank you. Any further discussion from council? All those in favor? And that's carried unanimously. Next is staff report. CS 2137 regarding the call for submission process update, Victoria Town Hall.
This will be Miss Darlington.
Through the mayor.
If I may, I would like to turn off my cameras.
Thank you, through Mayor Chop. The purpose of this report is to advise council that staff organized a public presentation by Cranberry Creek to obtain further public input on their proposal relating to the Victoria Town Hall as directed by council. The information from the session has been summarized and compiled for council's review and direction. During this session, Ms. Clofer responded to questions from attendees and invited individuals to contact her directly if they had any questions or concerns, and provided her number and email address. Ms. Clofer demonstrated her intent to listen to the concerns of the community and is amenable to working through any items. Staff to continue to support its original recommendation to enter into discussions to negotiate a license agreement incorporating information provided by the public and subject to any legal requirements and/or next steps. Further, staff are recommending that staff be authorized to undertake the necessary procedures for the county to obtain title to the property. Subject to any further comments from CAO Burgess, I'd be happy to answer any questions that council may have.
Hey, thanks, Shelley. Councillor Vanden Rishi, can we get your camera back on? And Teresa, go ahead.
Through the mayor, Councillor Vanden Rishi declared a possible pecuniary interest on this matter, so she's left.
I'm so sorry. My apologies. My apologies. Questions from council? Okay, Councillor Shelley, go ahead.
Thank you, Madam Mayor. Through you to Shelley. Shelley, forgive me if I missed it, but I didn't see anything that indicated the license agreement's length of term. Is there like a specific length of term that we're looking at with this agreement, or is that still being negotiated?
That was in the previous report. So and we can pull the previous report that went to council on that. I believe it was a 5-year term with a renegotiation period. The first number of years was because they're putting investment in the building, it'd be a nominal rental amount for their capital contributions to the building, and then it was going to be reset based upon the activity in the building. But I believe it was initially a 5-year agreement. We would put our standard out clauses on it. For lack of performance, we would have the ability to cancel with appropriate written notice.
Okay, Madam Mayor.
The final terms would be negotiated. Going forward.
Okay, so just as a general question, so that if after a period of time, if things went wrong, some of those out clauses, we can incorporate that and get out of this agreement, correct?
That is correct, yeah. If they do not perform to the standard that's required, we would have our out clauses. Usually it's because it's a nominal for the first bit of time, because it's a nominal lease, they're trying out a business concept. and putting in some capital improvements. They could also, it'd be a mutual one, if they don't think it's working, they could also notify the county to exit it also.
Okay, thank you, Jason. Thank you, Shelley.
Councillor Columbus, go ahead. Councillor Columbus.
Yes, thank you, Madam Mayor. My question is, being that this is a county building and it's been used for such, but now we are looking at basically a lease agreement or type of rental agreement. Will taxes be charged against this particular property now versus what we've been accustomed to? Who would pay those taxes? Would it be the proponent of the project, or would it be just free of taxes still?
I'll start, and then Mr. Arlington can add. At the start, it would still be it will always remain a county-owned building at this point in time. That being said, I think if it is established to be a longer-term agreement past the pilot project stage, we can go into discussions with Impact about assessing the property. At that point in time, it would be on the licensee holder to do that. And that would be provided for, they would be paying property taxes, but we're not going to apply for Impact immediately on that. And it would be after we go through the initial pilot project period to see if this thing is viable.
Thank you, Jason.
Councillor Van Passen.
Thank you, Madam Mayor. I still have some reservations about this. There was a public meeting, a lot of questions, and quite honestly, a lot of answers that weren't really answers. You know, like even in the report, amenable to working through any items. I would like a little bit more detail on, you know, like they were going to do capital upgrades. What exactly are those capital upgrades? You know, I know the kitchen needs work and the bathrooms need work, and you know, are they going to be upgraded full to handicap accessibility? They're going to use off-site parking, but have they made any arrangements? Like, you know, more or less, there is no parking spaces in Victoria, but I know I've talked to Michelle, and you know, they've looked at a couple of businesses that are not too far away that they had some parking spaces available. But, you know, I'd like a little bit more commitment on the details of it rather than motherhood and apple pie that'll all be okay and we'll look after historical bookings and the Women's Institute. But there's no real commitment to say, yes, the Women's Institute can keep their current schedule at what price and all of that. And I don't think there's a terrible rush on there, but, you know, I think that we should get a little better detail of or explanation of some of those details before we hand it over to staff and the mayor to sign the agreement.
So, Councillor Van Passen, if I can stop you, I see that Michelle is actually, I can see her name here on the screen. So if council would like to waive the rules of procedural order and ask questions directly of Ms. Clover since she's here, that is certainly a possibility for council.
Well, I'd be happy to move the rules of procedure.
So you're putting that motion on the floor. Is there a seconder? Councillor Taylor, all those in favor? And that is carried. Michelle, I think, right? I guess I'll.
If I could, Madam Mayor, maybe if Michelle explains some of the details directly to council, like.
Well, why don't I'll let you ask some questions of her. I just want to make sure she's actually even listening. She's hearing this even. All right, you're with us, Michelle?
Yes, I can hear you. Yes.
Right. Welcome. Sorry to put you on the spot. Councillor Van Passen, I think, had some questions, and I don't know if other members of council do. So rather than putting this off, maybe he can just pose some questions to you directly now.
Yes, thank you.
Is that okay?
What I was asking about, Michelle, was like some of the questions that came up at that public meeting that we had. And there is a list in the report of a bunch of reoccurring themes, but the question from the Women's Institute, will they be able to, keep their current schedule there at the current rate, rental rates, and, rather than an answer of, yes, we'll work through those items, could we get a little bit more detail on things like that, like the offsite parking, the type of capital investments that you're going to make, those kind of things?
Yeah, I'd be happy to provide more detail, but I guess at this point, it's really hard to give you concrete details without knowing. It's hard to, make an arrangement for parking without knowing if I get the building or not. It's hard to give details of like very specific things about, what the rates would be for the community and things like that without kind of knowing what the details of the lease agreement will be. And I'm happy to have those laid out in the lease agreement. Absolutely. Like, I don't have an issue with that. And I think that, like, to me, what I had expected was that would be part of the discussion to create a lease agreement, I guess. So I'm happy to provide as much clarity as I can, but it's really hard to do so without knowing exactly, what the terms of the lease would be. And I can't really make agreements with someone for parking without knowing if I'm gonna be able to host events in the building and if I'm gonna be able to get the lease. So it's kind of like a little bit of we're going in circles, I guess, if you know what I mean.
Yeah, that's the exact position I'm in from the other side. How do I go about approving a lease when I don't know the details of this and this and this? So, how do we work through that? Do we trust with the mayor and staff are going to work with you to sign a lease? I have confidence that the mayor and staff will look after the interests of the citizens and still look after you as a business, that it has to be viable. And, I do have certain reservations, but I also have great faith in our staff that they will look after the concerns that the citizens brought forward. So
I see
I
Jason's hand.
council to ask some questions.
I see Jason's hand is up, so I'll let him jump in there.
Yeah, just one of the clauses in the license agreement, just want to make sure we use the proper term, will be an annual review that will go to council, and also annual reporting for Ms. Clover's enterprise. And because we would have a cancellation clause within it, it's best to see how it actually operates. We could get Ms. Clover to agree to a whole bunch of stuff in the agreement, quite frankly, and she doesn't actually execute on it. So the intent was always that we would have an agreement, there would be annual reporting, and if council is not happy or staff is not happy with the performance of Ms. Clover, then we would be able to exit from it. So the intent was it was more of a proof of concept and how it works going forward, or if there's little tweaks that need to be required, that would be via a report from the proponent and from staff that would go to council on an annual basis. Assuming that there is an annual basis with COVID and she actually has time to operate a building and there's weddings in the future.
Council Columbus, or Van Passen.
Yeah, thanks, Madam Mayor. Jason touched on another one of those points. What is the difference between a license agreement and a sublease? Because that is one thing I did see in the original lease, that we're not allowed to sublease it. And I guess they're still searching to see whether they're the entity that still exists that leases the building to us. But is a licensing agreement different than a lease?
Yeah, I'm not a lawyer. Ms. Budis can provide fuller comment. A license gives you certain rights to the property that are actually less, there's less rights to a license than there is to a lease arrangement. So a lease by definition has some real property rights to it, where a license does not, but all have, and we normally traditionally should be using license agreements for our buildings, not lease agreements.
Paula, did you want to make any comments?
Hi, good evening. In truth, I am not the expert at this. Lydia Harrison is the expert at this in the corporation. She almost certainly would explain this better than I would. In general terms, I think it really depends on the nature of the relationship, whether you want a lease or a license, and what exactly makes sense in any one circumstance will depend on that relationship, as opposed to the question of the realty. I don't know if Ms. Darlington is in any better position to describe it than I've just done, but I'm going to defer, I think, to the realty folks.
Lydia or Shelley? Otherwise,
Lydia's just pulling up her Cole's notes on license and lease agreement, but I think essentially what Ms. Budis has described is sort of what Lydia can get in some further details. She's just taking a moment to pull up some information.
So I'll just, so generally, and this was how legal had taught me before, a license gives the right or privilege to enter and use a property, where in common law in Ontario, a lease actually confers an interest in the real property, which is also binding to the owner and other persons. So a leaseholder, no different than if I use the example of someone who is a tenant in a building under a lease, has certain rights to it that would be more stringent than a license holder, because a license is only related to the use, and there is no real property interest conferred to the leaseholder. So I hope I didn't screw up Lydia too much.
Lydia, did you have anything else to add?
Mayor Chop, through Lydia, you can continue on if there's other questions.
All right, Michelle, I saw your hand was up again, so I'm going to go back to you if you had something else you wanted to add.
Yeah, it was actually just to add to thank you, Mayor Chop. It was to add back to Councillor Van Passen's just question about renovations. So we do know that the exterior of the building is protected. I had a couple very nice emails from members of your community just letting me know a little bit about the history of the historical protection on the building itself, and that applies to the outside of the building. And the interior, I'd welcome you if you wanted to come and see Cranberry Creek Gardens and just kind of see what style of events and weddings we put on. We wouldn't be using the washrooms as is. That just wouldn't be something that matches the level of events that we host, I think. And the kitchen as well. I noticed a couple safety hazards in the kitchen that I would love to improve upon. So I think the kitchen and bathrooms, I don't see any reason why I can't tell you that we would love to improve them in any way that we can, to modernize them and make them more accessible to clients. They're very closed in and to the community. But it is, again, like I said, very hard to say more than I know we'll probably and I know I was criticized of this in an email from the community, but I know we'll put some paint on it, but it's very hard to nail down the specifics outside of, knowing what council will approve, because council does have to approve the renovations that we do in the space.
Okay, any further questions? Thanks, Michelle, for joining us. Sorry to put you on the spot. Oh, wait, Councillor Columbus, perhaps he has a question for you.
Madam Mayor, I think this is a very good proposal. We asked for partnerships with some of our community facilities. We've got one. I think it will create a great deal of synergy in the community of Victoria, and I'm going to move the recommendation.
That's excellent. Seconded by Councillor Huffman. Thank you, Councillor Huffman. And Shelley, did you have something else you wanted to add? Or can I just go to debate with council?
You can go to debate, Mayor Chop.
Okay, thank you. Councillor Van Passen, go ahead.
Yes, thank you, Madam Mayor. I've got a lot of calls about this. That building's not too far from my home. I've been by it my whole life. It's the heart and soul of that little hamlet there. But once in a while, you just have to try to do something different, because we can't carry on doing it the way we have been doing it. And my biggest fear is that at some point, there's going to be members sitting around a council table, and we're just going to walk away from that building, and it'll be gone forever. So whether this is the best option or not, it is an option that we can keep that building there. We can keep that heritage there. We can get some upgrades done to it. We can get use out of it. And, you know, we will write enough clauses in that if it doesn't work out, well, we get it back and we'll look at a way to do it. But we just got to, once in a while, you just got to try something new. And once in a while, you'll get your fingers burned and sometimes it works out. But, you know, we got to start somewhere. So, you know, I might get some more flack about this, but I'm going to be supporting the motion and have faith in our staff, have faith in Michelle, and just, you know, the way she works with the community, the way her staff looks after their community interests. I got to have a little bit of faith on that, and hopefully we can move forward and get a win out of this.
And some similar comments I was going to make at the end, but you put the nail on the head. That's awesome. Any further comments from council members? Councilor Columbus, I saw your hand, but that's just you moving the motion. You're on mute. Okay, I'm going to send that.
I forgot.
Okay, all those in favor? And Councillor Van Passen, you just said you were supporting, but I'm not sure I see your hand. Perhaps you're frozen. All right, there we go. And Michelle, there you have unanimous support. So I'm so excited to see. I mean, certainly everybody appreciates you know, everything that you've done with Cranberry Creek Gardens out there. It's an amazing facility, and you know, I think it's a really great opportunity for Norfolk County to have you kind of take that building forward. So good luck with everything, and thank you to staff as well for bringing forward kind of a unique and creative solution to some of our challenges in Norfolk. Teresa, I saw your hand.
Through the Mayor, I was just going to ask for a moment to bring Councillor Van den Leesch back to the meeting.
Well, why don't we take a 5-minute break again? We'll start at 7:30.
Okay. Thank you.
Thanks.
Can we have just a tad more than 5 minutes?
Oh, sure, Councillor, no problem. Did you want to eat or something?
Well, yeah, just maybe 10.
How about 15? Does that work?
Perfect.
7:40.
I can barely get downstairs in 5 minutes.
It's 7:40 on my clock, so I'm not. That's exactly 15 minutes. So whatever that is on your clock. Perfect.
Thanks, Mayor Chop.
Sorry. Okay, welcome back, everyone. Just are missing too many counselors still. Oh, there we go. Did Councillor Vanden Riche need help with her monitor or anything, Teresa, or is that?
I'll pop over and double check.
Two and a half years into this, and I cannot figure out the thermostat in this office. One second I'm sweating, and the next I'm freezing. I'm in the freezing stage.
The building only has two settings. There's too hot and there's too cold. There's no in between. So.
Yeah. I just don't understand that thermostat, even no matter how hard I try.
You see in the budget how we have a bunch of remote controlled thermostats and the staff are just messing with your head. That's
Well, Jason told me this year's budget, he was cutting off all the heat to my office.
That's cold.
But he was giving me 50 bucks, telling me they were putting 50 in, so I buy a sweater.
I'm not completely cold. I was providing a mitigation strategy. In fairness to the staff, though, the issue is when we start closing doors in here, it does set the temperatures off within the rooms. The air circulation in historical buildings aren't great.
Through the mayor, Councillor Vanden Riche is up and live in her room. Her picture is showing the meeting going. Kevin is trying to work out the technical difficulty with her screen not being on. There we go.
There she is. Perfect. Okay, looks like we are all back. Thank you. On to staff report CAO 2146, and that's regarding the bylaw enforcement service priorities. Teresa, go ahead.
Thank you. Through the mayor. Staff report CAO 2146 bylaw enforcement service priorities is before council today. The report outlines the departmental workloads, practices, successes, and challenges over the past year. Included in the report are topics related to enhanced parking enforcement in Long Point and Turkey Point in summer 2020 due to provincial regulations that allowed for the suspension of certain collective agreement provisions. Increased prioritization of enforcement requests through the designation of a supervisor of bylaw enforcement, the structure of the bylaw enforcement department and staff resource allocation, the process for prioritizing calls and requests received by the supervisor, levels of priority status, focusing on reactive matters versus proactive matters, recognizing 3 recurring priority matters related to cannabis, tourist parking areas, and downtown matters of our urban centers, which include garbage parking and property standard issues, and finally, challenges in meeting the demand. I would like to point out second paragraph on page 209. Bylaw deals almost exclusively with regulatory matters and nuisance issues in the community, and the priority response metrics can be dependent on a number of factors, including but not limited to safety measures, resource availability, season, timeframe, impact of infraction, and effect on community versus individual. Administratively, this results in the management of bylaw service calls based on effective resource allocation, timeframe of requests received, and an internal priority matrix, which is often based on the needs of that time period. Our bylaw team has been actively working to achieve results within the constraints of our resources and budget allocations. We have seen a significant positive impact on the work our officers have been doing over the past year, and we receive a number of compliments related to our team through both phone calls and emails. I will now ask Jim if he would like to provide any highlighted notes from the report.
Thanks very much, Teresa, and good evening, Mayor and councillors. Thanks for the synopsis, Teresa. I can provide just a high-level overview of the report, and then perhaps there'll be some questions that we can assist with. The report itself begins with a snapshot of where we were a year ago at the beginning of the pandemic, when, for months most regular bylaw work was curtailed and all efforts were expended in support of community safety measures dealing with retail openings and gatherings. And then, of course, by the late summer, COVID cases were dwindling, the suspension of the collective agreement ceased, and our 3 summer parking enforcement student contracts ended, allowing us to regroup and transition to a balanced workload in Bylaw. Part of that was to increase cannabis support by assigning a regular Bylaw officer to assist part-time with backlogged cannabis related zoning matters as both a succession planning measure and to add investigative capacity. Regular Bylaw call services vary each day. Typically, though, they include property standards, clean yard, animal control, noise, fences, zoning compliance, parking complaints, and highway obstructions, that type of thing, as well as assisting other departments and agencies. The complaint intake process itself is typically handled through our online Bylaw complaint form or by telephone through Service Norfolk, and assigned daily by myself as the Bylaw supervisor. Regular Bylaw calls for service were up 63% year over year as of May of 2021. And so the ability to triage calls for service has significantly improved efficiency by removing an estimated 20 to 30% of the calls that used to be handled by an officer on the road. That has saved valuable investigative and drive time and provided a more rapid response and better education to the public for their inquiries. The time expended on researching and report writing, telephone calls, and issuing tickets by officers each day is significant, as is the practical aspect of geography and cell connectivity with just 4 officers handling calls across 1,600 square kilometers with a mix of both urban and rural habitation. Officers prioritize their calls at the beginning and throughout the day as required. Given the high call volume and available staffing, the majority of Bylaw work is reactive to complaint intake rather than proactive, with parking enforcement itself carried out during downtime or when officers have time available in an area that they're already working. The second part of the report deals with 3 areas that are viewed as priority items on a more consistent level. Those being cannabis enforcement, seasonal parking issues in our high volume tourist areas, and urban issues related to stresses on our downtown cores. Last Tuesday, I reported to Council and Committee on the state of our cannabis investigations. As noted then and in this report, these are often complex matters that are time and resource intensive to investigate. However, we are making good progress now, including expanding our own interdepartmental cooperation and working with both AMO and Health Canada on proactive changes to cannabis regulation and enforcement. Parking in our tourist areas has been a challenge for some time, and that challenge has increased in recent years with many more visitors traveling to Norfolk to experience the great things that we have to offer. As with many similar jurisdictions in Ontario, that extra vehicle and visitor pressure puts a strain on already limited resources. This year, as in 2020, we will be able to supply a good level of parking enforcement on our 3 main beach areas over the summer, especially on weekends when parking pressures are most prevalent. The third priority item involves issues with our urban core areas in Norfolk, where some commercial and residential properties have experienced a decline in maintenance, and where we experience other issues that are common to urban centers, including garbage and parking issues. Bylaw continues to work with Simcoe BIA, specifically OPP, social services, fire, building, and other partners in an effort to improve these issues. The specific issue of parking in Simcoe continues to be a concern for many in our community here, and we are aware and engaged. However, as expected, Bylaw cannot solve this issue alone. To that end, we've developed an internal committee that will conduct a fulsome review of many related issues, and Teresa has already alluded to those in her comments. Finally, regarding scheduling, we are now beginning the process of reviewing Bylaw scheduled work times and days of the week as approved in the CUPE collective agreement. The focus of this will be to determine which days of the week and or times of the year will provide the best bylaw response to priority community issues while respecting employee needs. Subject to further discussion, those are my comments, Madam Chair.
Thanks, Jim and Teresa, both. Are there any questions or comments from council? Councillor Columbus, please go ahead, and then Councillor Rabbits.
Yes, thank you, Madam Mayor, and thank you, Mr. Milson, for your great presentation. My questions with respect to parking. We've talked about increasing the parking fines significantly for several months now. And I noticed in your report on page 213 of the agenda package, it indicates that we may want to move forward with this in the 22 levy budget. Great to see that in coming forward, I guess, for the 2022 budget. But can we have different parking fines in the county? Like, can we have, in the tourist area, can we have a higher fine for parking fraction than, say, in Simcoe or Delhi?
Subject to the experts at the table, I can say I believe so. There are municipalities in Ontario who have done just that. I'll use Prince Edward County as an example. I believe I included that in my report, that there are parking fines in tourist areas that were very similarly affected to us, shot up to, I believe it was $300, if I'm not mistaken, certainly a significant amount. And I believe that could be accomplished through a specific bylaw, if even just for a certain period of time. But certainly the clerk can comment on that.
Thank you.
Through the mayor to Councillor Columbus, Jim is correct in that. And that's part of the reason we created this internal working group was, we don't want a Band-Aid solution. And in order to correct the problems and challenges that we're having in the county, we need to do a fulsome review of all of our bylaws, because we have discovered a number of our parking bylaws, not only are they outdated, but some of them even date back to before Norfolk County was a county. And so we have different parking requirements throughout the county. And so we need to clean all of that up and bring a fulsome process of how we're looking at parking. And definitely the tourist areas are definitely part of that consideration, and through those bylaws we plan to address those matters. I recognize that is maybe not exactly what council wants to hear today, and we are talking about ways that we can perhaps put some temporary measures in, but ultimately we want to clean it up for a permanent solution.
Thank you, Madam Clerk.
Okay, so I have Councillor Rabbits, then Councillor Taylor, then Councillor Huffman, then Councillor Martin, then Councillor Michelli. Councillor Rabbits, go ahead.
Thank you, Madam Mayor, and through you. My question is for Jim. Mr. Milson, you had a meeting where I was present. I was with a BIA. And you explained really well some of the parking dynamics that are at play in downtown Simcoe. You explained to us, and I think we're all on the same page, that we have different groups or different users. We have residents, we have patrons, we have business owners. And quite often, either not all three parties will be able to prevail, or they'll have contrary views. And I imagine you even sometimes get calls to the same place, or emails suggesting contrarian or opposite viewpoints. I think it's really difficult to try to figure out what's best when you have these differing viewpoints and calls for service. We have bylaws to help give you guidance and direction in that. But as a counselor, I also have a hard time escalating a concern appropriately. We get correspondence by email. I encourage individuals to make their information known in public record, either by preparing a deputation if necessary or providing a letter. But I think our community is looking for engagement, and I think the hard part about trying to get a resolution is you're going to be offending one party over another. If we ever have a final solution on parking, there never will be one. But I think members of our community want to engage with a process. So Jim, I was hoping you could maybe explain some of your viewpoints on those different groups and how you think they may engage in a future process once we have something like that in place beyond our customer service through Norfolk County.
Thank you, Councillor Robertson, through you, Chair. Yeah, it's certainly, as we all know, quite a dynamic when you're dealing with so many variables in an aging downtown area. There's a lot of individual concerns, but those don't always correlate with community needs in general. And so we sort of opened the door with an approach to the BIA, as I know you were involved with, Councillor, and we did that with our operations folks as well, Bill Cridlin and I. And, we discussed it at length, and even out of that one group, there was still differing opinion. And so part of what Teresa and I have talked about is this parking group internally with a number of stakeholders to bring those views to the same table so that we can talk about them and determine a path forward. There clearly has to be a change. I certainly don't dispute that because I deal with it every day. It's just how much weight we put to the individual groups that have these needs. So in answer to your first part of your question, we have folks who live downtown. That's where they find the affordability and the convenience, and they live downtown. Some have cars, some don't. We have business owners and who have needs of moving things in and out of their businesses, let's say, and then we have those employees at businesses who also want proximity. So we're hampered by the fact that we essentially have two large parking lots in the downtown core, and of those, we probably have 160 spaces, I think, if memory serves. So our options are rather limited in dealing with that, but we do have a couple things we're working on, and I won't probably discuss them here unless council wants, but there's a couple of ideas that have already come up, one through the BIA that I think has some merit, and I've certainly been discussing it with the CAO extensively as well. So I'm not sure if that answers your question, but that's my comment.
It does, Mr. Nelson, and I thank you for your time and for council's indulgence.
I can't remember what I said now. Sorry, I think it was Councillor Taylor.
I had many parallels to what Councillor Rapids was saying there, so I'm good.
Councillor Huffman, I think.
Sounds good. Thank you, Mayor Chop. Actually, mine was on the downtown parking as well for residents. I get contacted on a regular basis by individuals who live in the downtown core in Simcoe who kind of repeatedly get parking infractions. So one of the things in terms of the parking group that you're doing, would one of the options be some type of residency parking pass? I'm just wondering if that might be, because we certainly, do understand why individuals live downtown. There's housing, there's affordability, and we need to have somewhere for these individuals to park. So my thoughts would be moving forward is that, something that would involve going to, town hall and showing identification in terms of their address and that they would be parking, because when they're parking there, for the most part, no one else would be parking there during the evening and things like that. So I just wanted to throw that out going forward, and because I know that it is an ongoing issue, and like you said, Jim, you're dealing with it on a regular basis. Just my 2 cents worth.
Thank you, Councillor. I very much appreciate it, and through you, Madam Chair. The parking pass issue or suggestion rather, is one that I had raised soon after I got here, and had a chat about that, and subsequently I know Mayor Chops had some input into that, and there's been some other interest in doing that as well. So it would be subject to certainly council's direction as to what they would like to see and that, but we would, this parking group will present some options to you for consideration and on a go forward basis. And I'm optimistic that type of thing can work. the original discussion was paid versus unpaid passes and who would get them and just how much room we have, how much capacity we have. So those are some considerations, but yes, a very, very good thought on that. Thank you.
Yeah, Councillor Huffman, I think that was something that had even been taken to the BIA already. I asked why. It was something we talked about a long time ago and why it hasn't happened again. And then I just found out recently from Councillor Taylor that it was, I'm not sure what exactly happened at the BIA level. But to me, I mean, it's not just the residents, it's our business owners as well that need somewhere to park instead of moving their car every 2 hours. And if there was an ability, I mean, we issue licenses for dogs and, you know, everything else. So to have, you know, a fee, it's certainly going to be a Toronto fee, but a fee that you have a spot in a lot to be able to park, you know, I'd like to see that, you know, yesterday kind of thing coming forward to council, and was kind of one of the reasons why parking in Simcoe was one of the reasons why I wanted to sort of get Bylaw to bring a report forward. But I have a couple other comments that I'll make on this afterwards, after we get through the rest of council. But Jason, I saw your hand was up there as well. Actually, first, before I go on to this, I'm going to ask you, Councillor Huffman, but if anybody else, Councillor Taylor and Councillor Rabbits can't play the game, but could you tell me where the two municipal lots are in Simcoe?
My understanding is that one would be where the old liquor store was, and the other one would be, oh God, I don't know.
But that's just it, you know, it's not your, it's not, what's that, Councillor Martin?
Where Harry cut down his parking sign? Your parking lot?
Is that it?
Is that it? Is that the second one? I mean, that's the funny part. I mean, here we are on council, and the gentleman that owns the Viking Bakery, I remember talking to him at the beginning, and one of the most basic things he asked for was a sign pointing to the municipal parking lot. And I can't think of what a more simple thing that the county could do to help out this situation. And that was 2.5 years ago. And I just like, I don't know why the sign is so difficult. I mean, even from the BIA's perspective, the fact that we as council can't easily answer that question and we come to council chambers in Simcoe, I mean, it's you know, it's embarrassing, but it speaks to the bigger parking issue in Simcoe and the spaces that are out there that people that come to Simcoe to shop, they simply don't know about. So thanks, sorry. I didn't know the answer either, so there you go.
Madam Chair, just for your, just on that note, the parking signs do exist just off of Norfolk Street and Robinson, but they aren't very big. And I've been in discussion with our economic development director about having that type of thing change. And it's part of our agenda in the parking group. So just so you're aware, but yes, it's very much an issue, and there's a lot of people that come into this town that can't find them easily. So good point.
Well, no, but that, I'm sorry, Jim. I just did that to illustrate a point. Yeah. I mean, it's something that's very simple, very, you know, there's no real cost to that, but would go certainly a long way. I mean, we should all on council easily know where each of those parking lots are at, and so should, you know, anybody that wants to come and park in downtown Simcoe to shop here. So, Jason, I saw your hand was up.
Yeah, thank you. Just through the mayor and to address two of the questions before, we did have a concept that we did put by the BIA. The BIA came back with some suggested thoughts, and we are looking into it. The one thing I'll point out to council is, you know, things are changing, and I would agree with Councillor Huffman to a large degree that for a lot of the tenants of buildings, you know, they might use some of the parking at night when businesses aren't open, and then, you know, and then they're away at work and frees up this parking spot. Excuse me, but what we're seeing both with COVID and frankly with a bigger trend of working from home, some of those old rules don't necessarily apply anymore. And that's something we need to look into further. And, you know, we actually are going to do an inventory of our total spaces and stuff, because in downtown Simcoe, for example, there is no planning requirement for parking for buildings. So if we start putting in more rentals and we only have so much on-street parking, what does that mean? And so there will be some bigger questions that this parking issue might take longer to do. But I think the parking group itself is going to tackle a bunch of issues kind of in line. So we'll get the signage so people know where to park. We're going to work on a permit issue for, in conjunction with the BIA for their staff of businesses and for their customers and for tenants in the downtown. But this is going to be, I think, hopefully, as Simcoe grows and becomes bigger, we'll have to maybe think a little bit differently about how we do parking in downtown Simcoe.
If I could, Jason, and I'm sure Councillor Huffman will agree, the problem is it's not just downtown Simcoe, even with the residential parking issue. And I think it's becoming a really big problem in Waterford as well, as we're seeing some development there in the downtown core. And that was, I still need to follow up with Brandon, but the one application, when they were looking at adding the 4 residential units on the main floor, I'm not actually sure what came of that. But there's a whole number of units in a building above on the 2nd, 3rd, and 4th floor that were not required to provide parking spots. And when we talk about tourist locations, I'm sure Councillor Huffman as well can attest, the people going to the Waterford trails now, it's packed down there on the weekend. And there's no limit on the parking. And that to me is something that, again, whether or not we have the bylaws prepared or not, but I think we need to get some signs in Waterford and limiting the time of the parking, because people are heading off on the trails and so on, and that's not helping our businesses that have already suffered so much, in downtown Waterford and in other areas. I don't know if you wanted to comment on that, Councillor Huffman, or not.
No, thank you, Mayor Chop. That's a very good point. And the issue is that, yeah, we do have more residential spaces going in there. And then along with that, having another business opening. And then we have the antique market and the trails and the walkways and the waterways are, like you said, just jam-packed on the weekends now. We have a lot of people from out of town. So it would be beneficial. The parking that's there is probably not going to be adequate for all of the needs of the community. I did look into angle parking, and it doesn't meet the necessary. There was a lot of hoops and things to go through and measurements and things like that, and it doesn't meet the criteria. We could have almost, I think it was at least doubled or tripled the parking along Alice Street west there, but unfortunately it's not going to meet the criteria to become angle parking. So that was one of the hopes that I had for that development moving in there on Alice Street looking onto Shadow Lake. So, but yeah, on a regular basis, there's just a greater number of much more traffic and a lot of parking. And now when all these businesses open back up, it's going to be a force to be reckoned with.
Yeah, it's one reason for us to, I think that bylaw in particular, to deal with parking for residential units where there's not an obligation in that downtown core, that needs to be expedited before further approvals come to council. And you can't force them to add spots when it's not a requirement under the zoning bylaw. So, we need to get that part in there as soon as possible. Councillor Martin, I think you were next.
Thank you, Mayor Chop. Through you to Jim. When you look at your priorities in the report and certainly the priorities of community members, I know you have one officer in particular that works directly with cannabis. You sent us out the bylaw statistics for the month of May, and I noted in there under the inspector tab quite the discrepancy with number of calls to particular individuals. Is there a reason for that? Are you prioritizing certain officers in certain areas or certain types of calls outside of Mr. DeBath, or why is it? Why does it vary as much as it does?
Thanks for the question, and through you, Madam Chair. I have 2 officers on 1/3 of the county, and that goes from Dover up to Waterford and through Simcoe. It's just volume, and they have the majority of the calls, those 2 officers. There's the drive time is reduced, of course, for them, and so they just get to more. The far west has much greater drive time. You can go from Port Rowan basically to Tillsonburg, and from the Elgin County line over to roughly Delhi. That's a huge area for one person, and so he has maybe less calls, but a lot more drive time involved. And also the connectivity issue that I mentioned earlier is something that I've been trying to work out since I got here without much success, and myself, and as far as connectivity for our officers, and or even in an emergency situation. So that requires that they have to go back either to a fire hall or to an admin center of some kind to do their reporting, which the other two officers in the east can just do from their car most of the time. And then of course the officer in central, I've actually adjusted his zone and added more to it because of the call volume there that wasn't as excessive. So it's a balancing act on a daily basis, but I would suggest that the lack of calls for service maybe for one officer would be just to do with proximity and drive geography more than anything else. And be honest with you, from my former career, that's exactly the same scenario was for the OPP as well.
Councilor Shelley.
Thank you, Mayor Chop. I think this is a first to Jim, and then I think it will be to Teresa. Jim, first of all, thank you for your very thorough and excellent report. I have a couple of questions about the internal committee that's been established. I am happy to see that it is inclusive of several groups and organizations that I think will be very helpful in assisting creating that larger picture that I think that committee is intended to create. I notice also that it will be requiring input from ward councillors. I'm wondering if you would be able, or perhaps Ms. Olson, to explain how that committee will actually function.
I'm going to turn it over to my boss.
Through the mayor to Councillor Michelle. So this is an infancy group, and I guess I want to make it clear right now it's an internal group only. So it started, a few weeks ago, actually, when we were trying to determine to bring some parking bylaw changes of who owned the bylaws. So, a number of staff across the organization come from different municipalities. Different municipalities handle things in different ways. So we needed to figure out where things were at Norfolk. Through those discussions, we recognized that there were a lot of departments at stake in this. And so we started the group to kind of try to determine who was going to own what and how we were going to allocate it. That kind of spiraled into, we have a lot of things we need to pull together to do this. So the intent, it really is for this group to start to meet, to be able to pull these pieces together, to recognize what we have to fix, who needs to be at the table. And we've already recognized that we need to consult with the community. So, through Jim and through the BIA, through ops and engineering, we've determined that there's certain key groups that could help determine. Most of it's to do with parking and signage, but we recognize that it kind of weeds out into other areas. So our hope is to have a few meetings over the summer to get in place who's going to do what of this piece, so that we can bring a formal report to council of how that's going to look, do consultations in the fall, and then hopefully have a whack of bylaws to be brought back to be repealed and replaced, so that 2022 is a productive year for the county, and something that council can be proud of. So that's our hope. I was always warned not to overpromise and underdeliver. So we will work hard to meet those.
Okay, thank you, Teresa. The last part of your explanation was the answer to my second question. So I will very much look forward to that report. And I do want to just mention that I think you've got some very, very knowledgeable groups on the list that you've included for that committee. So I'm very encouraged by what the report will reveal to us in the fall. Thank you.
So just part of the reason, just to rewind a little bit as to why I wanted this to come forward. I know we have bylaws obviously in place for parking and so on, but I will admit that there was one letter in particular from a constituent which really made sense, but she wasn't the only one. There were several. I found it difficult that during a lockdown, a shutdown period, when our businesses, almost all businesses, except for essentials, were closed, in particular in downtown Simcoe, which is already struggling enough that we were laying parking tickets. And while we had other critical issues in the county that, as opposed to worrying about parking in that stage, why we couldn't have reallocated bylaw officers to deal with some of the cannabis files that I know that there's obviously a high priority from council on. I would have rather see 3 guys at that point during the shutdown period working on cannabis, which is a huge priority for this council, and not worrying so much about ticketing people, which frankly, in her example, and I never even really thought about it that way, but she's like, my business is closed. I'm not going to work because I'm not allowed to leave my house and go anywhere. And I'm literally parking my car on the street in front of my house and I'm getting a ticket. And that makes sense. If somebody's, they can't go to work, they don't have a job now, and now we're putting a parking ticket on them. And for me, that's where I just think that there has to be a shift in bylaw priorities, because, let's hope that's the last lockdown that we face. But I'm, I don't think any of us can be certain that that is in fact the case. And if it occurs again, I want to see us move into more critical areas. Now, as we get into the summertime, obviously that's changing. Everything's opening up again, and the businesses that have struggled all of the winter, and certainly even their performance in the summer wouldn't have been the same last year. But parking is not just an issue again in Turkey Point and Long Point, but it's finding a strategy. Even in Waterford, as I said, because of the Waterford trails and people looking for something to get out and do, it's causing unnecessary, I think, stress and burden on our businesses that are trying to survive. So, Jim, I know you're going to have your guys out doing that in those priority areas. But for me, top 2 priorities are parking for the summer and cannabis. And of course, the third one that's coming in there are your issues. I know that you're tackling with downtown Simcoe. But the one thing that does concern me moving forward into the summer, and Teresa, I know you don't want to put a Band-Aid on things, and I know you want everything to be right, and I respect that. At the same time, these businesses have struggled for so long that I find it difficult that when people are saying, can you please, because of people sitting at the beach, because of people going to the trails, there's some spots that I just feel that we need to move on signage. In fact, this council had asked before your time, Teresa, so it's not to, but we had asked for priority to be put on 15-minute loading zone signs in Simcoe. I think Councillor Taylor had moved that with me at the time, and we had asked for it to come back right away because we did it for the businesses in Dover last year when they asked, and the businesses in Simcoe were asking, and we asked, please, can we get this back as quick as possible? Again, I'm not blaming you, Teresa, at all, but we never did, and I've never heard anything more about it. And I think, that's something still that people are asking for. And so I get we don't want to do Band-Aids, but I think there's some areas because of the tourist traffic that is maybe not shopping in our businesses, but is, using the outdoor amenities that we have in Norfolk County. We need to find a way to have some temporary solutions in those areas.
I'm not sure. Would you like me to respond?
I see Teresa was just put her hand up there, so I'll let her go, Jim. Thanks.
Through the mayor. So definitely we want to look at what we can get in place sooner than later. And, I defer to some of my other colleagues across the corporation. The first few weeks I started at Norfolk, I saw a lot of, conflicting emails. One person wanted us to check parking, the next person didn't, the next person wanted this. And so, that again was why I had that meeting with the group. And, there's reasons from operations perspective, from building perspective, from planning perspective, from ECDEV. And so we all got to the table to try to talk about those things. So I don't want to say that there isn't something we can do, and that's what we're trying to get to the table to, but it would be unfair for me to just come in and introduce a bylaw without being mindful of the other departments that may have critical information into that. And, I just unfortunately can't do that super quickly. So we are talking about temporary fixes. We have had some conversations with the CAO about that as well. And so whatever we can do to expedite some of this, we will try. All I can, guarantee you is that I will do my best and work very hard to facilitate this process to bring a solid response back to council. And, on the call are some of the other colleagues that may have some, feedback into why perhaps that 15-minute loading zone couldn't be brought back so fast. We did discuss that at our first meeting, and so I would defer to some of them.
I guess, again, I understand that in some cases, because we in a municipality have to pass bylaw for everything. But, I'm also of the mind that we need some solutions now. And even if it's not done perfectly, if it means that we have an oops and somebody doesn't pay their $20 parking ticket, I'm okay with that. I just want to see, we had a Board of Trade meeting the other morning I was on, and, they're saying all along, Powell Park on both sides that, there's no 2-hour parking signs there, and people are parking there all day long and heading off to the beach. Waterford, same thing up with the trails. So, again, I know that the bylaw might not be there, it might not be perfect, but if somebody wants to go to that trouble, by all means. So Jason, I see your hand.
Yeah, through the mayor, and I'll provide some context. The former clerk was the project lead on that. He did take an inventory of existing parking and I would say inconsistencies between the written bylaw and some of the signs, and also, frankly, the example that you just provided, the fact that there is no signs, though there is an existing bylaw somewhere. And if you remember, we had approved the budget originally because there was a motion from the Board of Trade for paid parking. We went down that road for a bit, and then they reversed their decision on that. So long story short, we did put some effort into certain things. Unfortunately, with turnover, some things got left. What I'm hearing from council, and I'll stand to be corrected, if we can bring back some temporary solutions, I'm cognizant of the time, but if we can bring back some temporary solutions for July, we'll prioritize a couple of the key areas in the tourist areas, and then council can approve that effective for July onward for the rest of the year, and then we can do it. Unfortunately, we don't know of any other way to do it without a bylaw being approved.
So is there not a way, though, in the case of signage, that the business owners in those locations that I just asked for are asking for the signs to limit people to parking there? Does it need to come back to council? Can it not just, can this, I think in some of those cases, like you just said, the bylaw actually exists, it's the signs that are missing.
That's correct. In those cases, we would just need the signage. And I don't want to put Mr. Cridland's roads team on. One of the issues, if you remember last year, was we had trouble actually getting the signs actually manufactured and provided to us. But what I'm hearing is council's desire is to move more quickly. We'll regroup as a team. We'll try to move more quickly on the things we can do. If there is high priority items that doesn't require a change in the fine, or a change in the fine, but we can add in a bylaw to help support some of the high risk areas, we'll bring that in July. Anything that requires a new bylaw. So let the team.
Well, I don't think anybody on council is going to hold it against staff if somebody accidentally misplaced a bylaw either. I'm not saying you need to, go through it with a magnifying glass.
We'll bring something back but
it's just the end of July is too late. That's the problem. That's where it's like, can we go ahead and get some signs up to help the business owners up? Because in those particular areas, people go and they don't go to the businesses, they go and they sit. And I understand, again, whether there's a bylaw or not, if some signs end up put up for 2-hour parking in those areas, I don't know that it's the end of the world.
Well, I'm just going to say that I'm hearing the message from council. Let us circle as a team. If there's something we can do in the meantime, we'll provide a memorandum to council on steps that we can take, and we'll prioritize the tourist areas first, and we'll move from there.
Awesome. Perfect. Jim, did you have something else you wanted to add?
I did. I just wanted to touch base on a couple of things. The first meeting that we're going to have for this parking committee is June 23rd, just so you're aware. Some of the issue with these signs, it's been very confusing for me as well, new to the corporation, and it's just exactly where people go to get a change made. Initially, when things were a little slower with requests, I had suggested a deputation to council because there was specific need, let's say from a business owner for a 15-minute parking space, and so that should be articulated to council, and then the message came through that perhaps that wasn't the best use of council's time because there was getting to be too many of them. So I wasn't quite sure, and I'm not sure still, the process internally when these large volume of requests do come in for differences in parking, and maybe need some direction on where that should start going forward. And I don't know, Teresa and I will have a chat about that, and certainly we will at our meeting on the 23rd. The only other thing I wanted to add, subject to any other comment, was regarding the cannabis. In fact, I did allocate the officer, the backup officer, to cannabis this spring as well, and he had already laid up a number of charges and spent several weeks in a row actually working on some cannabis files to help catch up prior to the summer. So it's not lost on me that cannabis is a big issue that needs to be addressed. I think we are making progress. It is difficult with the resources we have, but my goal is to once again, after Labor Day, and the vacations and things are over, those commitments are done, to have that second officer work full time for another 3 months through the fall to catch up as well as the growing season winds down. So thank you very much.
Thanks, Tim. Teresa, did you have some final, Jason, I see your hand up as well, but Teresa, I'll go to you first and then.
Yeah, I just wanted to clarify something Jim said. So we actually had an initial meeting a couple of weeks ago. I just want to clarify that we recognized at that meeting we were missing some business partners. So the meeting Jim is referring to is that we've brought all of the rest of the departments on board with that. So I just wanted to clarify that we've started this process already, but we've now believe we have all the right business partners at the table.
Okay, thanks, Teresa. Jason, did you have something you wanted to add? Your hand's down now.
Well, that was an error on my part, so I'm sure I'll pay the eternal fine for that.
Councillor Taylor.
Just to maybe circle back to the game you played earlier, that other parking lot, yes, the LCBO, the old LCBO lot, but between Kent and Colburn North, just south of my top drawer, is that second parking lot. If you guys can picture that.
You got it right.
So there you go.
Thank you for clarifying that for us. Councillor Van Passen.
Well, and just to clarify, both sides of the river at the LCBO are municipal parking lots, not just the one side.
That is true. And the one side has 48-hour parking.
Yes. And I knew where the one was on Kent Street too. So
I knew you would know, but I knew there was at least a few of us that didn't.
Where's the public parking lot?
I knew it too, Madam Mayor.
Okay.
Where's the public parking lot in Port Dover, Madam Mayor?
What's that?
Where's the public parking lot in Port Dover?
Well, there's one that I look at.
In the downtown core, there's one parking lot there.
There's two others, is there not?
Oh.
There's three.
They're not county owned though, but there is one behind the brig. That little parking lot is actually a county owned parking lot.
Stop talking about it on the record. It's going to be full, and I'll send the emails your way.
But there's a third one too. Is there not? Jason, what was the other one I remember with the Friday? It was further because it was where the other porta potty was going to go.
Yeah, it's not designated. It is. There is parking at the end across in behind the yacht servicing company, and then there's the one downtown. Powell Street, Powell Park, or that one, which is next to the giant, or as Bill Cridlin always refers to it, the Giant Tiger parking lot. Even though for a newcomer to the town, when there is no actual Giant Tiger, it hasn't been there one for decades, it's very confusing to anybody because I wandered around downtown or Port Dover for 10 days straight trying to find the giant tiger, but then Mr. Cridlin corrected it on why that was no longer there.
Oh, it's not Waddle's store anymore. It's Giant Tiger now. I
Okay,
didn't
we gotta
realize
get
that,
on.
but it changed.
We can quiz on the Port Rowan parking lot next time, Councillor Michelle. So if I could have a mover for the staff recommendation. Thank you, Councillor Taylor, second by Councillor Huffman. All those in favor? That is carried. Next item, Paul, I believe, is CAO 21-48, the 3 East Street lots.
Thank you very much, Madam Mayor. So this report was generated out of a legal services request from Jason Godby some months ago now. And I didn't know much or any of the background because the resolution in question and the genesis of this report occurred just a couple of months before I arrived. So the long and the short of it is that Council had sought to recover some costs for the extension of a road and related services in front of 3 lots on East Street and passed a certain resolution to do that. And then a few months later, apparently it became apparent through discussions with Realty Services that that resolution and the bylaw passed further to it was an insufficiently developed bylaw and was not registered on title. So it was not registered on title. The properties were then beginning to change hands and questions arose as to how we might recover the costs that the county council had sought to recover. And it was at that point that, and quite recently, further discussions occurred with staff, including the CAO, to try and resolve what we ought to do about this. And at the same time, a building permit application came in to the CBO, making the matter somewhat urgent in terms of, from his perspective, because he wished, understandably, to bring this issue forward. So the long and the short of it is that bylaw that was passed to try and recover the fees is not a bylaw we can use for the purpose. There are no other mechanisms at this stage allowing us to try and recover those costs other than the development charges, which of course will be charged to each of the lots in the normal course. As a result, we have really a bylaw we cannot use, and further to the clerk's advice, it was her advice that the actual bylaw that's been passed should be repealed. And so this is now in front of council for that purpose.
Thanks, Paula. I guess the question I asked Jason earlier, but there was a mechanism that could have been used. It's not that this would have been unheard of to do this, it's just that was not the right mechanism that was applied by staff.
Possibly. I admit to being a neophyte at all the development charge rules. There's some recent changes back in 2015, right? So part of what I was trying to understand is, can you? I mean, so under the Development Charges Act, there's a clear prohibition to require charges except as permitted by that act or another act. So really there are 2 ways to do it. There's the Municipal Act, which has a number of ways in which we can levy charges, and this would not be one of them if it's covered by the Development Charges Act, which it is because we have a bylaw that deals with this. So then there are these particular local improvement charges, and those are quite specific, and there's a particular regulation relating to that, and there's also permissions that does allow us explicitly to collect for services, for water services, for example, and that's a few years old now as well. So it's really not completely clear to me how it works. What I will say is, what I think the bigger issue is that this is a very old development. So it's a subdivision from 1954, and today, this would not happen. A new development would not happen where you didn't have all the right agreements in place to build the road out initially. So here we are dealing with an old subdivision in which I put it in as a tiny little footnote, actually. So Lydia had checked for us because I had the same question. I couldn't understand why the road wasn't built. I mean, this was done to a subdivision as a subdivision, and I didn't understand why this just didn't get built, quote, when it should have. And it was a 1954 subdivision. No subdivision agreement was registered on title either prior to or after the registration of the plan. And I understood from Ms. Harrison that that's fairly common. So today, for a new subdivision, this would not happen. And yes, I suppose in theory you can set up agreements with people. Whether or if that is technically permissible, I am less clear on, given the structure of the acts and the regulations that come under it. And I might defer to the CAO if he has more insight into that than I do.
I would just say that I think council attempted to adopt a unique situation. Unfortunately, the staff did not execute correctly, and now we're left with a position where we can't move forward. And because of the changeover in the landowners, it's not possible to do it. So we're just going to correct the situation and move forward with the recommendation that's been provided to council.
Okay. Councillor Van Passen?
Yes, thank you, Madam Mayor. I remember this, I think the discussion went about, we would have fixed the road anyway because you had two dead ends. We would have looped the pipe anyway because you don't want stub-ended pipes. And we were trying to get a little bit back out of that subdivision with the lots that were undeveloped. So, a little error was made. As CEO said, let's move on. It's done. We made a little error. We got caught on it, and nothing we can do about it. Let's move on to the next issue. So,
well, I think the deal was in the past was that all of the lots had paid for their section of the road, right? Everyone else along there had. That was what we were told at the time.
Yeah, but we missed our chance. Let's move on. I'll move the recommendation and
perfect.
Next report.
Seconded by Councillor Michelli. All those in favor? And that is carried. Okay, so next, now we're just getting into, we have the Integrity Commissioner, the follow-up for the perceived conflict of interest. And then we have the couple of matters to go into closed session. So Teresa, I just want to be sure I'm following what you suggested. Are you saying if council wants to review the closed session memo, let's go into close, discuss all the memos together, and then come back to this report coming out? Or did you want to go with this one first?
So through the mayor, I would suggest that we can start discussing this report, but my thought is if you want to go into closed for the memo that accompanies this, while we're in closed, we might as well finish with all of the closed items rather than go in and out and in and out. But I'm happy to start presenting this report if you would like.
Absolutely. Please go ahead. Councillor Van Passen, did you have an issue problem?
Sorry.
Okay, go ahead, Teresa.
All right, thank you. Through the mayor, report CAO 2145 is before council today to summarize the responses received from the Integrity Commissioner related to how they will manage the perceived conflict related to a partner in their firm being related to a member of Norfolk County Councillor in the relation of a cousin. The proposal from the Integrity Commissioner to delegate its authority to the external designated IC, as approved by the county clerk or solicitor, aligns with the scope of the current contract that the county has with the Integrity Commissioner. The delegation to the external IC would include any situations pertaining to an allegation against Councillor Martin, an allegation from Councillor Martin, an allegation against council as a whole, or if Councillor Martin seeks advice. The county clerk believes this would be a satisfactory approach at this time, and the matter could be reviewed again should any issues arise when this delegated authority is utilized. Should council wish to explore other options, it would be advised to discuss the companion closed session memo from the county solicitor. In reference to the section of the report that indicates that staff will review how better procedures could be developed within the county to more productively identify and manage such types of conflict in the future, staff advised council that due to a hectic workload, consideration of a number of staff holidays coming up over the summer, and other extenuating circumstances, that this review would not occur until the fall or winter of 2021. Further to matters that came up last week at the CIC meeting, I did reach out to the Integrity Commissioner to ask how the process would work and did speak with him yesterday. And he did indicate that because he is the appointed Integrity Commissioner, that all matters referred to the IC initially would be through an intake through his office. That intake would determine, if it met one of the 4 criteria I mentioned earlier. And if it did, he very clearly recognizes that that would have to be designated to an outside IC. He also indicated that some of the intake process would also be his responsibility to make sure that it was actually within the jurisdiction of the IC to even look at it before he asked us to send it to someone else. So if it was a criminal matter, an MFIPA matter, a lack of jurisdiction, he would make that determination on intake. And he did indicate that there would be a cost for that. He said that he could not determine what that cost would be because, it would depend on the type of complaint that came in. Would it take him a half an hour? Would it take him an hour? He just couldn't give me an adequate, not inadequate, but in fairness, he just couldn't determine what that would look like. He also noted to me in the conversation that because he is aware that I do have experience, although some of it is briefly, with 4 different ICs across Ontario through my former employment, that he would be more than happy to allow me to recommend an IC that I perhaps had worked with before that I thought would be a good IC to delegate matters out to. So this is before council today for consideration.
Okay, thanks, Teresa. Questions from council? I have a couple. I guess first of all, the question is to, I guess, to staff. It's hard because, Andy would have been the person here. But Ayrton Barrellis didn't identify the conflict originally, so their conflict check and their process didn't work. But I did read in the Simcoe Reformer article that it had been reported to Governor Simcoe Square. And so the Integrity Commissioner claims, however, that he was unaware. So I'm just wondering who at Governor Simcoe Square was this communicated to the Integrity Commissioner?
We don't know what that comment was, or if even the comment is accurate that was reported in the paper, and staff did not feel it was appropriate for us to undertake any type of review of it. So it's a question that if council directs staff to look at that, we can certainly look at it. But at this point in time, staff has not taken any steps, except for staff did reconfirm that question to Ayrton Barrellis, that we said we noticed this in the media report, and we asked them to reconfirm whether any staff had reached out. They maintain that they were not aware of any previous connections.
So then I guess, Teresa, I'm just wondering if I could get your, thoughts on the following, or even Paula. But where I struggle in some of the communications that we've now seen with Mr. Mascarin is, at first there was no mention from him of a perceived conflict. There was no mention from him of the use of delegating from the Integrity Commissioner to another IC. And that, only comes out later when it's actually pushed upon by staff. In fact, there's another section that I find interesting where the Integrity Commissioner talks about being, I can't remember exactly how he said, but he basically said that, in terms of the rules of professional conduct, that they were, subject to the Law Society. But in fact, as the Integrity Commissioner, they aren't subject to the Law Society. And so, even the email, I think it was on May 21st, where it seemed that our staff was driving the process as opposed to, the Integrity Commissioner. So if our staff hadn't got involved and asked sort of these tough questions, where do you think we would be at this point?
Through the mayor, I can start the conversation, and then Paula may want to add some stuff. So I was first made aware of the situation on day one with Norfolk County through an email from the IC. The IC in that email to our office made us aware of a potential conflict of interest, and then also indicated within that email that they would make arrangements to ensure the services were provided without the potential conflicts. My understanding is that the IC had a phone conversation with our county solicitor in which they discussed some of that information. Now, I wasn't privy to that, so Paula would have to speak to that. And as you noted, the county did do further investigation with the IC. I can't speak for if they would have brought this up or not, or if those were conversations that Paula had with them on that date.
Yeah, again, it seems funny to me that the integrity, it wasn't, suggestions coming right from the beginning with the integrity commissioner, as well as sort of misrepresenting, who that legislative body was that was, overseeing sort of his actions in this case. Paula, did you have anything you wanted to add?
Sure. So as far as I know, I was the first contact in the corporation on this question, and you're correct that the email written by Mr. Mascarin didn't specify use of the delegation authority, but that was specifically what he raised with me when we spoke. And he indicated that he would send a follow-up email to speak generally to the fact that he'd recognized that there was this, initially he referred to it as a potential conflict, and subsequent to that we've moved to the term perceived conflict, which I think is the more accurate term. So, I didn't write the email for him. He chose to write it as he did, but I don't think that he was trying to hide the idea that he would use delegated authority. He just didn't communicate it well. So I knew what it was. And so when I read it, I thought, fine. And I was in the middle of the hearing and chose not to pursue it further in that moment. But I can certainly see other people would have had no idea what he was talking about. So there was that issue. To the extent that there's I'm not sure if the right word, I think you suggested a misrepresentation about the application of the Law Society rules. It's complicated when you have a law firm that is playing double duty. In their world, they have a way of checking conflicts. And
they didn't check the conflict, Paula. It clearly didn't work, their conflict checking policy.
You wouldn't normally check a conflict like that, right? Typically when people run conflict checks, they check it against clients, actual clients. It's not typically about family members or who, smaller firms, that's an easier thing to catch than a really big place. So I'm just saying that a normal conflict check wouldn't check that. It's certainly not my experience in private practice. I always worked in small places where that would have been a lot easier to figure out as well.
No, that's fair enough. But in the world of an IC versus a lawyer that's dealing with a client, it's a different relationship versus a lawyer that's representing a client. That conflict check is very different than when you're, a sort of an integrity commissioner for a group of individuals. So this is my point. Councilor Martin, go ahead.
Thank you, Mayor Chop. Through you to my colleagues. I feel as though this has already been covered. There is some information that's obviously coming back up again because you, Mayor Chop, provided direction to have this, the correspondence released. That wasn't actually a vote of council, but I am okay with it. I just believe that the discussion at hand, now that this has been in front of us for the third time, should be surrounding the recommendations. I'm not going to sit here and answer questions or fill in gaps or pretend that I'm not here on how this came to be and what was in the Simcoe Reformer. On page 182, there are 2 recommendations. This has been in front of us 3 times now. I think that is what the discussion should be surrounding, not necessarily what's in the Simcoe Reformer and who, what, when, and how it was reported. When council members do or do not report conflicts, we don't sit here and have that discussion. So there are 2 recommendations in front of us, and I would like to go back, unless my colleagues would like to go into closed session and discuss the report. There's a summary found on page 48 of the confidential memo. I think that's a great summary that I would like to see that released at the very least with the rest of this information. So if we're going to discuss the recommendations, I will continue to be here. If it's going to just be questions about how this came to be for the 3rd time in a row, I am feeling uncomfortable at that point in time because it's like I'm supposed to step up and fill in how the reformer asked me what questions and when and so on. I just think it's not relevant to the recommendation.
My question was to ask whether staff was aware per reading in the emails and the article, and I'm entitled to ask that question. The integrity commissioner has very broad sweeping powers over council, and I think it matters. I don't know of another integrity commissioner that I can think of at any council anywhere where it's a different integrity commissioner for council as a whole and for a particular individual. But regardless of what happens, you know, I'm certainly not about to look to move, you know, to seek to get another integrity commissioner, because I think if I do, it looks like I'm doing something because, you know, I don't like the fact that Mr. Mascaron didn't like that I ripped up a report. But I do want to put on record that I do have concerns as to whether, you know, this integrity commissioner has more interest in ensuring the continuity of a contract than actually doing the right thing for the county, which again is that I don't know of an integrity commissioner anywhere else where there is a different integrity commissioner for council as a whole and a individual or a couple of individuals in another municipality. And so that's my belief. But again, I won't move to, you know, I'm in the chair, and I recognize how that will be perceived whether I was to move for that request. Councillor Van Pasten, go ahead.
Thank you, Madam Mayor. I think I've got a few issues with this current firm. You know, when I read the comment that they can say with a straight face that they did not provide an interview with the media, they simply factually responded to several questions. I thought that's what an interview was. And they say, well, no, that's not an interview. I was just answering questions from the media. We are dealing with a situation in this very short 2 years that we've employed this firm, where the Integrity Commission has improperly delegated authority to people he was not supposed to, has initiated investigations when none were asked for, has improperly shared confidential reports, has made comments about council and councillors that I considered myself to be disparaging. And I think there's an ongoing little request to the ombudsman about that. And he bills us for services that are not part of the contract. And, you know, and now we find that the firm is in conflict. It is up to council to decide whether the firewalls in place meet our standards. It is our choice to see whether those firewalls are proper in our minds. And I don't think they are. And I agree with Councillor Martin. I think that we should move on with this. So I will move recommendation number 2 from the report, that council direct county solicitor to seek an external opinion on whether there are grounds to terminate the contract in accordance with Bylaw 2018-33.
Is there a seconder for the motion? Okay, seeing no seconder. Councillor Michelli, go ahead.
I believe Councillor Michelli's on mute.
Yes, my apologies, Madam Mayor. I was trying to second Councillor Van Pasten's motion.
Oh, thank you, Councillor Michelli. Okay, any further discussion on that matter? Teresa, can I get a recorded vote on this? Okay, Councillor Martin, go ahead.
I'm just wondering, concerning our closed session report, if Paula has any open session comments she wants to make. I don't necessarily desire to go into closed session. I read the report.
Okay, well, we're in the debate portion, so that probably would have been done before this section, but I'll defer to the clerk how you think it should be handled.
Through the mayor, I don't believe you called the question. You did ask for a recorded vote. So if you, My advice would be you did ask for the recorded vote. So in all absences, we did ask for the vote first. So we should do the vote. So are you ready?
Yep. Councillor Vanden Rishi, well, we had just, this is the point. So we've asked for the vote. I asked if anybody had any further questions or comments for the debate.
So are you ready for me to call the vote? Like to do the thing? Okay, so I'm going to go in order that I have on this list. So Councillor Vanden Rishi?
I abstain due to the fact I have not privy to much of this information.
So just for the record, the councillor cannot abstain from the vote. If you abstain, you will be counted in the negative.
I get it. I got
it. Councillor Roberts.
No.
Councillor Columbus.
No.
Councillor Martin.
No.
Councillor Van Passen.
Yes.
Councillor Huffman.
No.
Councillor Michelli.
Yes.
Councillor Taylor.
No.
Mayor Chop.
Yes.
Okay, that vote is defeated.
Okay. Somebody like to put another motion on the table? Councillor Roberts, go ahead.
Thank you. Through you, I will move option 1 as contained on page 82, sorry, of the staff report.
Okay, option 1, that staff report CAO 2145 regarding integrity commissioner follow-up received conflict of interest be received as information, and that council direct staff in the event any matter arises related to council member in question, including a complaint against council as a whole, that the IC will address management of the potential or perceived conflict in consultation with the county clerk or county solicitor for the purposes of delegating his authority as described to avoid any perception of a conflict of interest. And a seconder for that motion? Thank you, Councillor Huffman. And Teresa, if I can get a recorded vote again.
Okay. Councillor Vanden Rishi.
Yes.
Councillor Roberts.
Yes.
Councillor Columbus.
Yes.
Councillor Martin.
Yes.
Councillor Van Passen.
No.
Councillor Huffman.
Yes.
Councillor Michelli.
No.
Councillor Taylor.
Yes.
Mayor Chop.
No.
That motion passes 6-3.
I'm looking for one other page in my notes here. My apologies. So I'm not sure how, council, we did talk about it last week. I've spent the last week thinking about it myself in terms of an investigation. I mean, it's clear we have had a couple of leaks from council. I don't know that there's going to be some smoking gun email that's out there to prove who it was. So I've thought about it, and I don't know whether, do we waste the money, or does council collectively stand up at this point, and stop putting our head in the sand, that this has gone on in a couple of occasions. It's pretty clear. And so I don't know whether there's an appetite from council, from somebody, to make a motion, to censure ourselves. For for the actions that have occurred, and making a commitment to ensure that this isn't going to continue moving forward. Yeah, Teresa, go ahead.
Mayor Chop, I just looking at the time, we do need a motion to go.
Oh, I'm sorry. Thanks, Councillor Taylor, seconded by Councillor Huffman. All those in favor? And thank you. Councillor Martin, go ahead.
Thank you, Mayor Chop. No, I have no desire to table a motion to censure myself or the rest of my colleagues concerning repetitive dialogue over leaks. If someone wants to do that through a notice of motion, bring it forward at an appropriate meeting, then so be it.
Anyone else that wishes to speak to the matter? Councillor Van Passen, I saw you lighting up there. Was that on purpose, or I'll go to count?
No, I'm still stretching, moaning, groaning, complaining, doing all sorts of things to try to sit through this meeting.
Councillor Van Riesche, go ahead. And certainly, Councillor Van Riesche, my apologies. I should have said that none of that applies to yourself. You clearly weren't even on council at the time, so.
Maybe so, but at the end of the day, what I'd like to see is that we all grow up and we be very, very responsible in what we do and make sure that we use our moral compass, and if things shouldn't leak, they shouldn't be leaked. You have a responsibility. You just don't have a job, you have a responsibility. So let's all grow up and do our jobs for the ratepayers of Norfolk County. Thank you.
Thank you, Councillor Van Riesche. Councillor Taylor.
Well said, but I am certainly in favor of the investigation still, as we spoke last week, with just the severity of the issue and then the very next day, more information being out there. I'm still in favor of an investigation. Don't know how the appetite around the table is, but I do want to see something happen. I doubt we will get a smoking gun, but I'd like to see something happen.
Councillor Huffman.
Thank you, Mayor Chop. Through you, I supported your recommendation last week, and I still stand by that. I'm in favor of an investigation. I'd like to get this thoroughly looked into, and I want this to be over with, and I want to move on to be doing the work that we should be doing. So I wholeheartedly support an investigation.
So Teresa, how to handle that? Does that, can we just table that as a motion now then? With Councillor Taylor moving that and seconded by Councillor Huffman? Or I know there was, so now there's been a decision as for how to handle it, with it being, I guess, at your discretion as to what firm we would go to.
So through the mayor, just to make it clear to council, I anticipate what you're saying to me is that you want a motion that the integrity commissioner be requested to complete an investigation related to possible disclosure of closed session matters, or something along those lines. And as I indicated in my report during the integrity commissioner, this intake would start with the original integrity commissioner. He would do an original intake of that matter. He would determine it was on council of a whole, and he would consult with me to send it out to another IC. But all, as I noted in my report, when I verbally spoke to it, the current integrity commissioner will start all the intakes on this.
And so your recommendation for a motion at this point?
So if council wants to make a motion that the integrity commissioner be requested to complete an investigation, I think, I'm not sure, I don't want to put words in your mouth, but if a Councillor Taylor's moving it, I guess I'd like.
I guess I want council to define the scope of the investigation here. Like we've had, you know, there was an issue that was raised by staff with the MOH. There was an issue that was raised with regards to the hublands, and there was a third one. I can't even, my brain's not working.
Mr. Burgess.
With the that's right, with the memo that was only delivered to a limited number of individuals in relation to Mr. Burgess's, the terms under which Mr. Burgess was hired. It was provided to a Facebook group where it was posted.
Through the mayor, I believe Councillor Taylor has his hand raised.
Councillor Taylor?
I would recommend this most recent breach. Just start there, and if we have a fruitful investigation, perhaps proceed further, but why not stick with this most recent aspect and then move on from there? Just to keep a more narrow scope so this doesn't get completely out of hand.
So through the mayor to Councillor Taylor, when you say the most recent event, do you mean the most recent event as in with respect to the recent report and the hub land sales, or?
Yes, the report from last week and
Thank you.
Subsequent leaking.
Okay, if you just give me 30 seconds here, I will have a motion for you.
You're good to go, don't worry. Madam Mayor, I believe Councillor Van Andriesch is waving at the screen there.
Councillor Van Andriesch.
Thank you for noticing me. Through your, oh God, my lights keep going out. Hang on, okay. How much will this cost? Since we are, if we have someone that's appointed to us, we're not going to use them, they go to the next guy, sort of deal. What is the cost, approximate cost, do you think? I ask that to anyone.
Jason, I see your hands up.
Unfortunately, when you give an item to the integrity commissioner, they're obligated to investigate it in the manner that they see fit, and there is no cost constraint on it. That was an issue of previous email that I sent on another matter where I had asked for that. Our current integrity commissioner will not do that. One recommendation I can maybe suggest is if you refer the report to the integrity commissioner and have the integrity commissioner come back and propose something, because council is the complainant in this case, they can come back and propose, you know, a scope and potentially propose a scope back to council that they think, you know, might make sense to avoid unnecessary cost. And then council can then provide further input into it at that point in time. That might be something for council to consider to maintain costs and make sure they get a report at the end of the day that they, you know, that they desire based upon their complaint.
Thank you.
Through the mayor to Councillor Taylor, what I've drafted is that the integrity commissioner be requested to complete an investigation into the leak or disclosure. I'm not a fan of the word leak, but investigation into the leak or disclosure of closed session information as it relates to the hub land sale and subsequent staff report.
And what Mr. Burgess just suggested there, is that an option that we can proceed with? I like the sound of that if it allows us to contain things a bit more just offhand right at the start.
I think staff can request that when it gets referred to whichever IC. Staff can say that under direction from council that that the IC provide a preliminary scope report to staff, which we can then share with council.
That sounds good. Thank you.
Hey, Councillor Huffman, you're seconding that? And yes, Teresa, okay, thanks. So we'll call the question, unless there's any further discussion from anyone. All those in favor? And opposed? It's only Councillor Michelli from what I see. And that is carried. Okay, so next item. Moving on to, let's see here. I guess now we're heading into closed session.
Sorry, through the mayor.
Sorry, that's not true. The bylaws?
Yes.
Okay, so do we have any council member that wishes to speak to any of the bylaws before us? Okay, seeing none, if I could have a mover to approve bylaws 2 OP 2021, 10 Z 2021, and 11 Z 2021, and 2021 to 73 to 2021-81 inclusive. Moved by Councillor Rabbits, thank you. Seconded by Councillor Huffman. All those in favor? And that is carried. We have one motion from myself, which I provided as notice of motion. It's on page 248. I think it's pretty self-explanatory. I'm sure you might see one of them driving around Port Dover rather often. Electrical vehicles, certainly offer an environmentally, friendly solution. They aren't allowed out onto the highways where there's this unique situation in Port Dover. As an example, the highway actually technically proceeds through town. But it's kind of a unique way in some of our areas, in Long Point and Turkey Point. I think it would be great to see more of them out there. And certainly with the traffic we're seeing, it could be a great benefit. So the motion's pretty simple. Haldeman actually just recently passed a bylaw as well in this regard. So I thought it would be relatively, I don't want to say simple for staff, but at least, there's a starting point from one of our neighbors that's there with one that has already been drafted. So it just says, whereas the province of Ontario launched a pilot project to permit low-speed vehicles on Ontario roads, and whereas a person who holds a valid class A, B, C, D, E, F, or G driver's license may drive a low-speed vehicle on a highway for which the maximum permitted rate of speed is 50 kilometers per hour or lower, and whereas Norfolk County residents wish to be provided a balance of road safety and environmental transportation modes, therefore be it resolved that a bylaw regarding low-speed vehicles in Norfolk County be prepared. Teresa, should I pass the chair, or can I just ask for a mover and seconder on that?
So your procedure bylaw would require that you pass the chair, but if council at its discretion wants to allow you to do it that way, or if you want to follow the proper process, that's the discretion of council.
Yeah, Councillor Hubbin, I can pass it to Councillor Van Passen. I just know you're cutting in and out there, so I'm happy to pass the chair to you if your computer.
Okay. No, I have a question. I just want, in regards to it being a low speed vehicle, what all do those entail? Like, what are you probably have one specifically in mind that you've maybe seen in Dover or something like that. But like, are they those hover things? Are they the electric scooters? Or like, what do they entail?
It's kind of like, Teresa can comment on I don't know, Teresa, if you have, from the actual wording, if the best thing I could say is if you look up kind of online, like some of the low speed electrical vehicles, they're almost like a giant, golf cart in a sense.
Okay. So we're talking something with 4 wheels.
I think within the provincial regulation that is classified, yes.
Okay, all right. It's just because I know that there's been a lot of
it's not like taking a.
Okay, all right. I'm good then with that explanation. That was very helpful.
Yeah, through the chair, if it's helpful, it's actually defined by the Ministry of Transportation what is a low-speed vehicle. It requires a number of. Requires an identification number. It requires an odometer, a speed. There's a bunch of things that's required for the ministry to do it. So it's defined by the province.
Teresa, go ahead.
Through the mayor, if any councillors are interested, on the May 11th info pack, I did provide information with respect to the low speed vehicle. And everybody's right there. It's more like a mini vehicle. It's not a golf cart, but like a golf cart wouldn't be substantial, but it's like a mini vehicle about the size of a golf cart.
Councillor Vanden Rishi.
My question through you to the mayor, to anyone that can answer it, I guess, what about the liability? If, for instance, we pass this motion and allow this to happen on the roads and it's designated where, what if is there any liability to the township or to the municipality? I apologize. If an accident were to occur and they were not in the zone of whatever, because you can't go more than 50 kilometers per hour, is there any I guess this would be to the lawyer. I mean, is there any possibility of liability?
Jason, I'll let you go ahead.
Yeah, and Ms. Budis or Ms. Olson, it's a 10-year pilot project that the province is undertaking. If we do it in line with the ministry, you'd have the same liability of any other accident occurring on one of your streets. But if they're not in an appropriate place where they're actually governed by the bylaw, well then, there would be liability, not so much to the county, but to that individual. We would be operating like there's a number of municipalities who have adopted these bylaws as part of the pilot project, and we'd be operating under the same rules as the other municipalities.
So Haldeman, as an example, Linda, they adopted theirs because that's their new pilot project for their bylaw officers. Actually, is using these vehicles. So they're testing out the feasibility of this. I see Councillor Taylor smiling because there was actually talk of doing something sort of similar in Norfolk County at one point in time. But we thought rather than us, when we didn't have the financial means to run a pilot project, that we would sort of wait for some of these other municipalities to do it and then to see how it worked out for them before we made a decision.
Yeah, I've seen them now. I feel quite about them, but anyway, thank you.
Councillor Taylor, go ahead.
I'm just picturing what some of these vehicles look like. I know if we launch this come November, they're not going to handle well in the snow. Just wondering from staff's perspective, when might we see this bylaw in front of us? Rather see it a little sooner rather than later.
Teresa, go ahead.
Through the mayor to Councillor Taylor, if this passes tonight, then we will bring a bylaw back to the next meeting of council, which would be in July.
Wonderful.
Councillor Columbus, go ahead.
Yes, does this include all-terrain vehicles?
No.
No? Okay, thank you.
Okay, Councillor Van Passen?
Thank you, Madam Mayor. Councillor Columbus reminded me, about a year ago, we asked the clerk to bring back a report on the changes in the Off-Road Vehicle Act and get some clarity on where they may not be used within the county. And, I know the mayor always get priority, but, I've been waiting for a year for my request, and you're getting it all in 1 week here, or one month cycle. I just wonder what the status of that one would be, and also the very important one to a lot of people, the changes to the Liquor Licensing Act and have a beer in the park in downtown Dover. That was about a year ago that those changes, and we've heard nothing back. So not that we're adding anything to the clerk's workload and anything like that, but just a gentle reminder that there are other things on the bottom of your desk if you ever get close to the bottom of the pile.
Yes.
Sorry. Through the mayor to Councillor Van Passen, those requests have been made out and we are right now seeking to find answers to those. So hopefully one of these days soon I will have those for you.
Thank you.
Did you have another question, Councillor Columbus?
No, forgot to put my hand down. Thanks.
No problem. So other than passing, is there a mover and seconder? Councillor Martin, seconded by Councillor Rabbits. All those in favor? And that is carried. Thank you, Council. Okay, are there any notices of motion? All right, general announcements. I did want to read out a really great email from Chief Page, and this was just yesterday. So I'll read it just because I think the email is perfect and really encapsulates it all. But she says, "It is with great pride I let you know in the past 7 days we have accomplished a record-breaking vaccination level in our counties. Last week we ran 21 different clinics, partnered with 18 primary care physicians for in-office immunization, and 15 pharmacy-led vaccination centers across our communities to deliver an incredible 10,580 vaccinations. We could not have accomplished this without the amazing partnerships of our local hospitals, physicians, pharmacies, workplace leaders, emergency services, and staff members across both counties. So many staff have come together in order to work both at the clinic and behind the scenes to ensure that we continue to implement immunizations across our counties. A special thank you to our internal planning team, the Mighty Six, that have been pulled from multiple divisions and roles and managed to facilitate all these great accomplishments. We have, she provided a picture, I can send this on to council, but we had Josh Daly, health promoter with the public health here in Norfolk and the Housing Corp, Health and Social Services, rather, I should say. Jackie Wood, also a health planner. Laura Goyette, registered dietitian. Dr. Kate Bishop Williams, epidemiologist, and Chief Page says she's stuck in the back of the photo. I know that there was a small press release put out, but I thought that was a great email from her, so I just wanted to share that with council and the public. So thank you to Chief Page and all of the team for making that happen. And Council Martin, I see you've got your hand up. Hopefully it's good news.
It's not that good. Actually, I'm wondering if I could maybe just pass my couple minutes over to Mr. Cridlin for a good old-fashioned Silver Lake commentary.
Okay, through Mayor Chop to the councillor, I'll do my best.
There is good news there.
Yeah, no, there is. I'll just do a little brief background. Yeah, staff were taken off guard a couple of weeks ago when the buildup of, I'll call it the algae, the green scum, had started to come. So 2 Fridays ago, we hired a contractor to gently lift the buoy system and do a gentle release of this stuff down the stream. So we thought we had this thing licked. However, by Monday, 3 days later of last week, the glob continued to grow. So staff at all levels with engineering, ops, worked together. We did get the design engineer on site for early Monday morning. We met with ops engineering staff as well as Mayor Chop met with us. And the engineers were fairly good to work with. They admit that it's the yellow navigational buoy on the opening, I guess, for those that don't know, tends to be trapping some of the algae coming downstream, and as it accumulates with the warm weather, the bloom grows. So they were a little taken back. They put a lot of these systems in and never had this issue. So as a design criteria, I think we all admit we've got to change that. So we do have the ability to change that and actually remove the one that is in there. However, prior to doing that, we have some concerns about just opening it up as we did last time, because there's quite a mass there, and letting it go downstream. We're working on an alternative which may start as early as Thursday, which will be actually kind of this brooming or sucking the algae off first, and that way limiting the amount going downstream. We've also, through the good work of CEO Burgess, we've secured some funding for this, and we did meet with the contractor again today with ops and engineering staff, and again, Mayor Chop was in attendance, and we do have a plan going forward. So it's our hope, Councillor Martin, that Thursday the residents will see some work there, and we're just not sure how quick this is going to be. We've also been in contact with the CA. There is no work permit needed for the work we're going to do, and with any luck, we can have this cleaned up in short order, and then also removal of the yellow barrier for navigational purposes now, and we are looking at an alternative there. So that's where we are. Staff has taken this as a very, a priority task, which it is. We do feel for the residents living in the area. Stood by the bridge or the dam for the last 2 mornings, and yes, the smell can be intense. So staff are taking it very serious, and we have some funding in place and some alternatives. And with that, I'll turn it over to any questions that County Council may have.
I guess the only thing I would add, Bill, to that, just for Councillor Martin and the public, I know you just made the comment that the engineer said yes, it was from the wire with the yellow caution buoys, but there's no way of guaranteeing that once the glob is suctioned out and then the wire is removed. Again, that is sort of a guideline from the ministry, not a legislated requirement, that it's necessarily going to fully cure the problem. I mean, that is certainly the hope at this point in time, but the idea is that we'll have to just remove it and see and kind of take one day at a time with it. And if, it does start to build up again, then we're going to have to look at some different engineering changes to it.
Yeah, good point, Mayor Chop.
Anything further, Councillor Martin, with that?
No, just thank you, Bill.
Councillor Taylor.
Thank you, Madam Mayor, and through you, just want to recognize that it is National Blood Donor Week. So if donating blood is something you've ever been curious about, the blood.ca does have a very easy booking tool. They aren't accepting walk-ins right now with COVID, but the booking system is very easy to navigate. I believe it's Simcoe, Dover, Waterford have clinics. It's a great cause. They're always in need, so it just certainly, if you're curious, check out their website this week and maybe even book yourself an appointment coming up to give a bag.
And if you see the Bulldogs bus in town, don't assume it's necessarily the Bulldogs playing hockey in Norfolk County.
Didn't want to say it, but yes.
Councillor Columbus, go ahead.
Thank you, Madam Mayor. With these virtual meetings, from time to time, we have all experienced some technical difficulties. And I'm just wondering if I could ask the clerk when she anticipates that we could once again meet in person.
Through the mayor to Councillor Columbus. I was notified, I believe, about a week and a half ago that is another item on my to-do list to develop that plan of return to council. So I will admit I prefer in-person council meetings as well. So it will be on my priority. Realistically, I want to say that it'll probably be September by the time we're back, just because there's really only one more meeting cycle. And just looking at all of the priorities I have for council, I just want to be realistic that I can set proper parameters around that. So I will be bringing something back, but again, it'll be early fall when we're back in some fashion, whether it's all of us, partial, or whatever that looks like. And then some of it will be subject to how things go over the summer and provincial orders and reopening and shutdowns.
Thank you, Teresa.
Councillor Michelle, go ahead.
Thank you, Mayor Chop. Councillor Columbus' question reminded me of a question I have for Teresa as well. And Teresa, I'm definitely not trying to add to your pile on your desk, but I'm just wondering if we are going to get the council calendar updated soon. On the website, it only takes us to next month.
Through the mayor to Councillor Michelle, yes, we are working on that. We should have that out soon. We were just working out a few anomalies and a few things that I'd like to reschedule into council's calendars for September related to some of the committees. So I'm hopeful in the next week or two we will have something out to you.
Thank you, Teresa.
Anything further from council? Okay, in that case, we are going to move into closed session. We have
through the mayor, I would probably add that fourth item back on, just because all of those items, even if we just accept them for information while we're in closed.
I just have 3 listed for some reason. Okay, so we have 4 in-camera items that were provided to council. The memo CAO 21-49, I guess that's what I'm missing, was discussed earlier in the meeting, so we'll proceed with discussions really on the 2 remaining items. It seems the other issue has been disposed of as well, but I will provide that as Teresa just described. So the motion reads as follows: that council enter into closed session at 9:28 p.m. to discuss the following matters: staff report CD 21-51, that's the Judd land sale, staff report CAO 2150, Waveland judicial review, and there was the memo CAO 2145 regarding the integrity commissioner with the matter disposed of. Pursuant to sections 239, 2C and F of the Municipal Act 2001 as amended, as the subject matter pertains to proposed or pending acquisition or disposition of land by the municipality, litigation or potential litigation, including matters before administrative tribunals, affecting the municipality or local board and advice that is subject to solicitor-client privilege, including communications necessary for that purpose. I can have a mover and a seconder. Councillor Taylor, second by Councillor Rabbits. All those in favor? And that is carried. My understanding is we're going to stay on this link and we're going to just head to a breakout room, Teresa.
Through you, Chair Chop, or Mayor Chop, if you could give me 5 minutes to set things up and then I'll have things ready.
Okay, so 5 minutes, my clock. Yes, Teresa, go ahead.
Through Mayor Chop, since we added the CAO 2149 into close, we do need to just reference section 239 2B because that would have been the original closed. Just a article.
Okay, so 230, so B, CAO 2149, the release of closed session report, solicitor client advice, sections 239, sorry, I have 2F on here.
2B would be for 49. Identify, sorry, that must be a clerical end on my notes too. It's identifiable.
It's incorrect, just so you know, it's incorrect in the agenda. I don't even have the language for 2B in front of me. I probably should know it at this point, but
yeah, that's, oh, sorry, 2F. Yeah, ignore me. It was 2F because it was solicitor client. Sorry, I apologize.
No problem. Okay. So 5 minutes for Kevin, and we'll be back here at 9:36. 5 minutes, whatever your clock says.
Okay, mics are live and we're ready to reconvene.
Okay, thanks, Kevin. Okay, so first report, staff report, or sorry, motion to reconvene in open session at 9:45. Councillor Taylor, seconded by Councillor Martin. All those in favor? It's carried. First report, staff report CD 21-51, Judd land sale. The motion reads report CD 21-51, Judd Industrial Park land sale proposed resolution be received as information. And that Norfolk Council authorize staff to redesign the layout of the lots to eliminate the need for the construction of the service road Haycock Way. And that Norfolk Council authorize the registration of the proposed reference plan to create the proposed redesign. And that bylaw 2019-98 pertaining to the dedication of Haycock Way be repealed if required prior to the registration of the updated reference plan. And that Part A, as illustrated on the revised mapping, be sold to Mohammed Zakari and Farokyar at a price of $26,500 per acre and a valuation of $230,550 to be adjusted to the actual measurements to be provided by the land surveyor, and that the road allowance Haycock Way illustrated by dashed lines on the revised mapping be sold to, I know I'm butchering their names, Mohammed Zakari and Farokyar at a price of $1, the size of which to be determined by the land surveyor, and that Part B, as illustrated on the revised draft mapping, to be sold to R. Fiedler at a price of $26,500 per acre at a valuation of $91,690 to be adjusted to the actual measurements to be provided by the land surveyor. And that subject to confirmation by Norfolk County that the drainage agreement be registered on title, the location of the drain identified in the revised reference plan, and that the impact of the drain be considered when negotiating the price for any of the parcels encumbered by the drainage agreement, and that staff be directed to report back to council on the sale of parcels encumbered by the drainage agreement should the negotiated sale price per acre of those parcels be lower than the prices approved in staff report CD 21-51 Judd Industrial Park land sale proposed resolution, and that the mayor and clerk be authorized to execute the agreements of purchase and sale and all other documents deemed necessary to complete the transaction, and further that the net proceeds from the sale of the properties be credited to the current year operating budget as a disposal of a tangible capital asset and transferred to the industrial land reserve. A mover and seconder. Councillor Taylor, seconded by Councillor Van Passen. All those in favor? And that is carried. Yeah. Next is the information memo from Paula regarding staff report CAO 2149. This again hasn't been our traditional procedure in the past. That's what Teresa would like us to start adopting. So Councillor Van Passen, are you moving that procedure? And seconded by Councillor Taylor. All those in favor? That is carried. Third motion relates to staff report CAO 2150 regarding the Waveline judicial review. The motion reads as follows: that staff report 2150 regarding the Waveline judicial review be received for information, and that the county solicitor be authorized to settle this matter in accordance with the Appendix C to this report, and that the county solicitor be authorized to prepare an information memorandum explaining the rationale for the settlement for the next open information package. A mover and a seconder. Councillor Columbus, seconded by Councillor Michelli. All those in favor? And that is carried. I think Councillor Van Passen is frozen again. And finally, again, receiving for information, an information memo from the county solicitor regarding staff report CAO 21-45. A mover and a seconder. Sorry, I don't know why I just put my hand up. That's how tired I am. Councillor Huffman and seconded by Councillor Rabbits. All those in favor? And that is carried. So that's it for this evening. I did not put this on as a general announcement. As many of you know, my grandfather passed away a couple weeks ago. Today was actually his 100th. So Chop, our last name actually means draft beer in Portuguese, and my grandfather never drank anything but beer and wine, but in particular beer. And he said even drinking water was bad for you. So everybody needs to go home and have a beer for Bill Chop's birthday. Teresa, go ahead.
We still need to do the confirming bylaw
Yeah.
as well.
If I could have a mover and a seconder for confirming bylaw, which is 2021-82, being a bylaw to confirm the proceedings of the Council of Norfolk County at this regular council meeting held on the 15th day of June 2021, be approved, signed by the mayor and clerk, and affixed with the corporate seal. Councillor Martin, seconded by Councillor Taylor. All those in favor? And that is carried. And finally, Councillor Huffman, motion to adjourn. Thank you. Seconded by Councillor Taylor. All those in favor? And thank you. Council's adjourned 9:51 p.m. Thanks, everyone.
See you
Thanks,
guys in like
Kevin.
11
Thanks,
hours.
Teresa. Thanks, Jason.
See
Paul.
everyone
Thanks,
tomorrow
everybody.
morning.
Good night. See you in the morning.
Right
Take care.
early.
Kevin.